Check.
A very good morning to everybody. Firstly, I want to congratulate all the organizers and my dear friend Mrs. Ishi Khosla for organizing this wonderful event on gut health. Now, what I'll be speaking about is from the perspective of a medical doctor who decided to come into the field of preventive healthcare and understand preventive healthcare from a concept of nutrition and how the body heals itself. My understanding about healing is rooted in some bit of modern medicine, but a large part as a medical doctor when I started reading the ancient Vedic scriptures and how the body and health was defined in the Vedic scriptures. Now, according to the Vedic scriptures, how it defined the body was slightly different than how we as medical doctors understand the definition of a human body. So human body is not just flesh and bones. It's not just about what we see as a physical liver or a kidney or an intestine or a gut. It is powered by many other layers of what we call as a being. Now, as a medical doctor, for me, initially this was hard to understand because we are used to some things which we can touch, feel, hold, and see with our physical eyes. But it's hard for us to understand things which we don't see under a microscope or don't see with our eyes. And therefore, to understand how the gut impacts health, we have to first understand how the ancient wisdom understood health and the human body. The ancients understood health in a more holistic and integrated way. That means they did not only talk about intestine or a heart or a kidney, even though they could see because dissections and dead bodies were being dissected even at early times to see what is inside the human body, bones and flesh and everything else. But how does this work? How does the intestine work? Where is this consciousness coming from? So the root of health was rooted in consciousness, was rooted in intelligence, which was not something you could uh, just locate in a liver or a kidney or an intestine. So gut health took the form of intelligence. Of course, today in modern medicine, we do talk about the gut intelligence and the gut brain axis. But ancients knew thousands of years back that the physical body might be the working machine, but there's something beyond the physical body which is powering that machine. And how does that power work to keep the body healthy? And what are those things which make the body unhealthy was what they talked about. So, physically, how the physical body is powered was understood as the breath. The breath powers the human body. And therefore, when the breath goes wrong, or when we do shallow breathing, or when we do breathing which is not conducive to a balanced health, that's where diseases start. And therefore, why the breath was given so much importance, because the human body was not just seen as physical flesh, but it was seen as energy which was powering the human body. And that energy was understood as the life energy. And therefore, the flow of breath was considered paramount. The correct flow of breath was considered paramount when we talk about human health. Now, when we talk about breath or the life energy flowing through the body, we also know that in terms of anxiety, stress, breath is the first thing which goes out of balance. And we feel in the pit of the stomach, literally, anxiety or fear. And that's where the energy systems go out of balance. And therefore, in the Vedic system, great care was given to how do you build the body? How do you construct the body? What are the elements which construct the body? And then once the body is constructed in the right way, the right elements are there, how does the breath flow within that body easily? Because the physical body was considered the tangible portion through which the breath flowed. And therefore, it was considered more like a energy system conducting that energy. Of course, in the physical body, it was not just about everybody should eat apple or everybody should eat bananas or everybody should eat rough fish. No, it was very, very personalized. And not only personalized because every one of us is very unique, but also personalized to a greater extent. And that personalization started first with understanding one's own unique body type, which was made of the same elements as are found on earth, which is whether it is water or whether it's earth or whether the minerals of earth. But it was also considered critical that how the body is interacting with food, which is another part of earth. The fruit is from earth. The trees draw their nutrients from earth. The trees and the leaves draw their nourishment from the hydration, from the sunlight. And this was very deeply understood, that the interrelation between the environment and the end product, which is a plant or a vegetable or what is the fruit of earth, and who is consuming it? The human being is consuming it. So in what way it should be consumed? It was not just enough to say, drink milk or have clarified butter. It was also important to know, how do you eat it? Eating meaning, how do you cook it? How do you combine it with other food elements? At what time of the day you should eat it? What is the weather with which it will work? And what is your life cycle? Are you a child? Are you an elderly person? And how it will be digested? Meaning thereby that food was not understood in a limited sense of just having a couple of carbs or proteins or amino acids. It was understood as a dynamic thing. When I say dynamic thing, it means that how is the body constitution? Then what is the age? Is it a child? Is it a youth? Is it an elderly person? What is the season? How is the food being handled? That means, is it roasted? Is it being dried? Is it being fried? Is it being steamed, boiled? Everything was mentioned. How is it combining with other foods? Is milk being combined with watermelon? No, that was forbidden. Is milk being combined with cherries or citrus fruits? No, it was forbidden. Is honey being heated? It was forbidden. That means the unique biochemical reaction which happens when two foods combine was also studied in great detail. In fact, what is amazing is that something as common and popular as milk was studied in great detail. That means camel's milk was different than cow's milk, was different than goat's milk, was different than buffalo's milk, was different than cow's milk. In fact, some scriptures have gone to the extent of saying that if somebody wants to have a fine brain, they should avoid buffalo milk. So, milk and its impact, and different animals and their milk and their impact on the human body was studied. In fact, great detail had been studied whether people who were eating foods like birds from the marshy land or from the dry areas or from the mountainside, even the flesh of that bird or that meat or that was described, that what would be the impact on the human body. Which means when we talk about gut health, the ancient acharyas or the teachers and the Veds who were given the responsibility of diagnosing and treating patients were different. The acharyas were training and teaching, and the Veds were treating and correcting the disorders and guiding the public. So certain formulas or rules were given. Much of what we understand as Ayurveda today is very little of actually what Ayurveda was in actuality. Ayurveda was about prolonging health and longevity of a human being. It was not about giving medicines only. Medicines were considered a small part of this whole science of Ayurveda, which is a long life, which is protecting the life and the health of the individual. And therefore, many many instructions or directions or cause and effects were given. And these cause and effects were defined according to what is the goal of eating. That means, is the goal of eating for a warrior would be very different from a scholar, would be very different from somebody who was more into day-to-day physical hard work. Which means that it was not just one diet for everyone. It was not just everybody eat 2000 calories because it's healthy for you and have a protein or a carb. No, it was very, very defined and personalized to the kind of occupation, the profession. And the occupation and profession was not only about being sedentary or being, doing hard manual labor. It was also about whether your work needed you to be more in the lines of administration, or a warrior, or a scholar, or a learner. So the definition of what the food could do with you or would do to you was basis also what is your goal in life, what is that you are doing in life, and how would you use the food and end towards that goal. Of course, there are a lot of recipes, and a lot of people understand Ayurveda only as vegetarian and sattvic food, which is not true. Ayurveda it was a science. It talked about cause and effect. So there are many recipes of alcohol in Ayurveda. There are many recipes of different kinds of pickles in Ayurveda. There are recipes of different kinds of plants and foods and animal and different things. And therefore, food was understood in its deepest, personalized, scientific way and the effect it had on the human body. And accordingly, people could choose what they wanted to eat, and depending on how they were handling their bodies. Like, for example, it was explained that how the same product, say curd, in different seasons either would work very well or actually become harmful for the body. So the same product, a curd, even if we, let's say, from the same animal, let's say a cow's curd made from cow's milk, in rainy season would have a different impact. In the dry, hot summers would have a different impact. Even the kind of curd, was it like a whole curd, or was it just the whey protein or the whey of the curd, or was it the cheese which was made from curd, from milk? So everything was defined in such great details that it's amazing the power of observation and the power of scientific reasoning and logic which was applied to the art of eating. So Ayurveda has a large portion which dedicated itself to the art and science of eating. And kitchen was not just about just filling the bellies. It was almost like a laboratory where different combinations, whether it is called decoction, like cinnamon, cardamom, ginger, holy basil, they were made into various decoctions for every possible kind of health or ill health, which means whether it was upper respiratory tract infection, whether it was to set an indigestion in order, or whether it was to even rejuvenate. Anti-aging was a very large part which has been described in Ayurveda in great details again. That how does the body rejuvenate, and what is the way of anti-aging through all these decoctions. And these decoctions were also of different kinds. Some herbs were first fermented and then they were converted into decoction. Some were just seeped in hot water. Some were even allowed to just seep in plain water. And so all these fermentations, formulas which were created because of a deep understanding between the external world, whether it's plants or animals, the internal world, which is the human body, and the environment, which was constantly changing and evolving with seasons, with time. So when we talk about gut health, I think it's really nice and important to note here that ancient Veds, or the doctors as they were called, looked at a couple of things. They looked at the stool, that what is the nature of the stool, what is the nature of the bowel movement. They also looked at the tongue to see how the tongue is, how healthy it is. They looked at the the sclera of the eyes. They looked at the pulse. They looked at the condition of the skin, the hair. So they not only looked at just one parameter, they looked at the entire body as a machine, or as a spiritual machine, let's say, the physical body and the spiritual body together. How was it handling food? And therefore, a lot of diseases they could diagnose much before they became manifest, simply by what they called as the pulse diagnosis. So they saw the pulse and they saw the variation, they saw the disturbances in the energy system, and they could say that if this energy system has been so disturbed, what are the probable diseases this person will get? Of course, today we are lucky and fortunate to have great diagnostics in terms of whether it's radiology or blood tests. But we must also remember that when we look at a blood test or radiology, it should not be only seen in isolation. It should be seen in a holistic manner, which means that we just don't look at a blood sugar reading which is high and say, okay, here's the medicine, or you're diabetic. We also have to see that along with the high blood sugar, is triglyceride high? Is the liver also become fatty? Is the digestive system, that means, is there inflammation in the liver? Are the liver enzymes rising? And we don't just treat a blood sugar, we treat the body, we treat the digestive system. And the most important thing which I would like to state here as a medical doctor who studied modern medicine but finally decided to move into holistic health and healing, was that the ancient systems define the body as a healing, the body having the power to heal itself, body having the power to regenerate itself, rejuvenate itself. And therefore, to unlock those powers, a lot was written about. How is it relevant in the modern times? It couldn't be more relevant in the modern times. Today, what do we see? We see that there is a huge influx of chemical foods, foods which are less normal, less natural, and more chemical, biosimilars, whether it is artificial color, artificial preservatives, pesticides, or they are packaging, plastic packaging. So we are being inundated with chemicals from every possible area, not only the time the food grows, whether it is in agriculture practices, but also the way it is processed, the way it is packaged. So right from plastic seeping from the packaging to the water, the pesticides and the chemicals which are in the water on which these plants are growing. So it is no surprise that gut disorders are rising, allergies are rising, infertility is rising, cancers are rising, and many other conditions which are connected to lowered immune response is rising. And it is very, very clear for us to see that the human body, which was designed to eat natural organic food, or food which was made in the most natural form, is now getting mixed up with a lot of chemicals which the body was not designed to either eat or digest. And therefore, the gut health is the first stop or the first step which we need to fix if we want to fix anything, right from cancer to infertility. Because if the gut health is not there, it is almost impossible to fix any other part of the body. The entry gate to our whole system is the gut. And therefore, I'm so glad this conference is happening because it is pointing towards the most important doorway to health, which is our gut.
ध्यान से रहना, you shouldn't like slip off this. Just be careful.
This is very close to the...
Yeah, it's very, very tight. Is that the camera?
Yeah, there'll be two. Just testing it. Hello? Yeah, it works. Good morning, ladies and gentlemen. A very warm welcome to all of you on behalf of the Celiac Society of India, our distinguished guests, our esteemed speakers, and of course, we're waiting for more participants to arrive. That's fine. It's a winter morning. We forgive them. But a very, very warm welcome to all of you. For especially you guys, thank you for being here despite the chilly morning and for being here first thing. I'm hoping as the hall fills up, there will be even more enthusiasm, but at least this lot which is being so enthusiastic, thank you, and I'm sure this will resonate through the day. So my name's Pooja Kothari, and I am your host today along with this dashing, handsome fellow, Dr. Arjun Dang, and he's also the CEO of Dr. Dang's lab. And it's not just looks, it's also brains. He's also a liver and GI pathologist by training.
Pooja, so firstly, you're very kind. And thank you everyone for being here. It's an absolute pleasure. There have been days and nights of planning and contemplating and discussions that have gone behind this. And I think to start off, a big round of applause. It helps us warm our hands and also cheer up the audience that we have here. And so without much ado, it is indeed a pleasure to see so many brilliant minds and dedicated professionals come together for the International Symposium on Gut Health and Lifestyle Disorders. In a world that is rapidly advancing, our understanding of the intricate relationship between our gut and overall well-being has never been so crucial. Today's symposium promises to be a melting pot of ideas, fostering collaboration and knowledge exchange among experts from various corners of the globe.
Over the next few hours, we'll embark on a journey of discovery, exploring the latest research, innovations, and breakthroughs in the field of gut health. From microbiota to dietary habits, from cutting-edge technologies to holistic wellness approaches, our agenda is comprehensive and promises to enlighten, engage, and inspire.
We encourage each one of you to actively participate, ask questions, and share your insights. I think, Pooja, since the hall is not too full right now, we'll have to repeat this later. But the true success of the symposium lies in our collective commitment to advancing our understanding of gut health and its profound impact on our overall health and quality of life.
So Arjun, there may not be enough participants, but I think there is enough intellectual energy that is filling this room right
Absolutely.
now. So we are going to seize this opportunity in any case. And please do connect with fellow participants. And what's bringing us together is our common passion to unravel the mysteries of the gut. And to do that, we actually need to put our phones on silent first. So I would request all of you, please take a moment and put your phones on silent. It helps the speakers and doesn't break their train of thought. And yeah, let's...
Thank you. Let the symposium begin.
This is for your benefit, Mr. Manu, but in India, what we do is we begin any day or a intellectual gathering like this with an invocation to Goddess Saraswati to seek her blessings. And as all of you know, she is the Hindu deity of knowledge, wisdom, and the arts. So beginning an event with a Saraswati Vandana is thought to usher auspiciousness, kindle the spirit of learning, and create an atmosphere conducive to the pursuit of knowledge. Therefore, I am going to request Miss Alka Vikash. She's a vocalist in the Hindustani classical music tradition. Alka, please come and start the day with a positive and a spiritually charged tone for the rest of us. Come. Is the mic okay for you? Yeah.
कुंदिंदु तुषार हार धवला या शुभ्र वस्त्रावृता या वीणा वरदंड मंडित करा या श्वेत या ब्रह्माच्युत शंकर प्रभृतिभिः देवे सदा वंदिता सा मां पातु सरस्वती भगवती निशेष जाड्या पहा. मेरे कंठ बसो महारानी, ओ मेरे कंठ बसो महारानी, मेरे स्वरों को अपना स्वर दो, मेरे स्वरों को अपना स्वर दो, गाँव में तेरी वाणी, गाँव में तेरी वाणी, मेरे कंठ बसो महारानी, महारानी मेरे कंठ बसो महारानी. जीवन का संगीत तुम्ही हो, आशाओं का दीप तुम्ही हो, जीवन का संगीत तुम्ही हो, आशाओं का दीप तुम्ही हो, शब्द सुधा से दामन भर दो, शब्द सुधा से दामन भर दो, मैं याचक तुम दानी, माँ मैं याचक तुम दानी, मेरे कंठ बसो महारानी, महारानी। ले और ताल का ज्ञान भी दे दो, स्वर सरगम और तान भी दे दो। ले और ताल का ज्ञान भी दे दो, स्वर सरगम और तार भी दे दो। मेरे शीश पे हाथ धरो माँ, मेरे शीश पे हाथ धरो माँ, सरस्वती कल्याणी माँ, सरस्वती कल्याणी। मेरे कंठ बसो महारानी, महारानी मेरे कंठ बसो महारानी। मेरे स्वरों को अपना स्वर दो, मेरे स्वरों को अपना स्वर दो। गाँव में तेरी वाणी माँ, गाँव में तेरी वाणी। मेरे कंठ बसो महारानी, महारानी मेरे कंठ बसो महारानी। मेरे कंठ बसो, मेरे कंठ बसो, मेरे कंठ बसो महारानी।
As Picasso once said, art washes away from the soul the dust of everyday life. Mrs. Alka Vikash or Saraswati Vandana did just that, enchantingly inaugurating our symposium. Thank you for your inspiring and soulful performance. Next, I invite Mrs. Mala Sekri for a welcome address onto the stage. She is a leader in the media and publishing industry, founder and CEO of Muse Music, and former CEO of India Today Group. Please join me in welcoming Mala with a round of applause.
Applause will only warm your hands up so we can get another round of applause for the symposium that's about to begin. If it could ever be said that there was a silver lining to the horrible COVID pandemic, it was the sudden focus and awareness that came about in one fell swoop across all segments across the world about health and well-being. Collectively, we were all shocked into making healthier food choices and lifestyle choices, or else face weakened immune systems, sickness, or even death. Immunity, inflammation, digestive problems, supplementation, nutrition, micronutrition were words that popped up in everyday conversations. What to eat, what to avoid, good and bad foods, alternative methods of cooking, eating, focus on foods, fruits, vegetables became drawing room conversations. Webinars, conferences, television debates, more and more space in mainstream media was given to health and health-related concerns. The world population was finally learning about how to take health into their own hands. And yet, a silent pandemic that has existed forever got little or no attention. A pandemic that led to compromised immune systems, fatigue, slow growth in children, digestive problems, mental health problems, leaky gut, malnutrition, and so much more. A pandemic where people around the world led compromised lives that affected their mental and physical well-being. For the last 18 years, the Celiac Society of India, formed under the direction of the late Professor M.K. Bhan and the stewardship of the charming Ishi Khosla, senior clinical nutritionist, made it their mission, their singular mission, to end this pandemic. It was their dream and goal to spread the kind of awareness we talked of earlier and be the beacon of light for those suffering silently due to the lack of knowledge about the devastating impact of celiac disease and wheat-related sensitivities. Also, for the last 18 years, CSI traversed this difficult path of disseminating information and educating people. It has gone through its share of disbelievers and naysayers and come out trumps. The proof is the healing of so many cases, as case study after case study has revealed. A statistic that will startle everyone: 1 in 100 Indians suffers from celiac disease, a fact that has remained largely ignored or misdiagnosed due to the lack of awareness both amongst medical practitioners and the population at large. There has also been a paucity of diagnostic tools, thus far leading to thousands of people suffering silently. Consider the story of 8-year-old Arav, whose childhood was marred with inexplicable health problems that did not let him lead the carefree life of a small child. His journey was that of misdiagnosis and despair, eventually leading him to the care of CSI, under whose guidance his ailment was finally diagnosed and dealt with a simple solution: let food be thy medicine. Or as Dr. Tom O'Brien would say, watch what's at the end of your fork. I said it first, Doc. Armed with a new guided gluten-free diet, young Arav emerged as a normal, healthy child. Him and countless others have benefited from that knowledge, awareness, and guidance provided by the Celiac Society of India into leading healthier and fuller lives. The Beat Celiac campaign, unleashed by the CSI, is a movement, a revolution that is helping unearth the roots of so many autoimmune and lifestyle disorders. From arming medical practitioners with new knowledge to educating larger populations about wheat-related disorders, to helping the food and restaurant industry think innovatively about grain and the introduction of grain-free choices on menus. The little grain symbol we see at the end of every menu is so heartening every time we go to a restaurant. For those of us who lead gluten-free lives, I think seeing all the products available today has made our lives so much more easier. The shops today are full of alternative grain flour, snacks, bakes, and so much more. The 2019 International Symposium on Wheat-Related Disorders and today the International Symposium on Gut Health and Lifestyle Disorders are an example of how the Celiac Society has taken it upon themselves to gather the wisdom from experts around the world and enlighten minds, not just of the public at large, but also medical professionals of all specialties, healthcare workers, and the food and nutrition industry. Today, I welcome you on behalf of the Celiac Society of India to the International Symposium on Gut Health and Lifestyle Disorders that has as its ambitious agenda the coming together of all medical specialties to understand and spread awareness about the connection between the gut, food sensitivities, and health problems. I thank all of you who have supported the project and have been part of this special effort. I would also especially like to thank the Government of India, especially our Prime Minister, for putting the narrative on millets as an alternative grain front and center and capturing the imagination not just of Indians, but of people the world over. With all your combined efforts, under the stewardship of the Celiac Society, this silent pandemic will die a rapid death. With better diagnostics, better awareness, and more people getting diagnosed, celiac disease, grain-related sensitivities, lifestyle disorders, and disease as a result of poor gut health shall be a thing of the past. Love your gut is the message of the morning, and we will take the whole day to tell you how. Enjoy the day, enjoy the conference. Thank you.
Thank you so much, Mala. That was, Okay, she's there. Thank you so much. Those were really, that case study specially related to the child was so eye-opening. Being the mother, daughter, and now a sister of a celiac, I have personally benefited so much from the Celiac Society of India's guidance that I'm sure a lot of you here would, the remarks, Mala's remarks would resonate with a whole lot of you. So it's only, now we begin with the first session of the day. And given Mala's case study, it's only right that we focus with our session on children. And there we've got a whole lot of them walking in. So very good timing, girls. Our children are the future of this planet and this country. So our first session is dedicated to the health of our children. I invite Dr. Neelam Mohan. She's right here. Yes. I invite Dr. Neelam Mohan, Senior Director, Department of Pediatric Gastroenterology, Hepatology, Medanta Hospital, to chair this session. I'd also like to invite her panelists for this discussion, Dr. Deepak Gupta, Ms. Ishi Khosla, and Dr. Sarad Gopalan. Please be kind enough to join her on stage. AV team, please be on standby to play the Dr. Natasha Campbell video as soon as Dr. Mohan asks for it.
Hello, Dr. Natasha. It's great to have you for this today session. Thank you very much and thank you for taking out your time from a
Thank you for inviting. Yeah, thank you for inviting.
People talk about gut-brain axis, correct? People talk about, a lot of people have been talking, a lot of evidence has been coming about gut-brain axis. So, and we have a topic on ADD, ADHD, and autism. So I just wanted to know, what is this gut-brain axis, whole thing about gut-brain axis? Can you explain to us that simply, and why it is so important?
Absolutely. Human body is a microbial community. There are more microbes inside your body than there are human cells. And the headquarters of this microbial community is in the digestive system, in the gut. More than 90% of all those microbes are in your digestive system. It's the big ministry, the big headquarters, the commanding echelons of all of your microbiome are there in the gut. The reason for it is because we put food into our digestive system. If you ask any microbiologist what is the most powerful influence on the microbial community in nature, the answer will be food. There is nothing more powerful, food. You change food supply to a group of microbes and everything will change within hours. Certain species of microbes will disappear, other microbes will appear, and the whole microbial community will change. That is why the commanding center of our whole body is in the digestive system, because more than 90% of you are microbes. And these microbes in your digestive system produce hormones, produce neurotransmitters, produce endorphins, and they digest the food that you eat and convert it into millions of various chemicals. Many of these chemicals are good for us, and as long as your gut flora is healthy and well balanced, these microbes produce good chemicals for you, and you feel well, and you have energy, and you have no illnesses. Problem is, in our modern world, we live in an environment where our gut flora gets damaged all the time. Agricultural chemicals, many of them are antibiotics in their nature. They kill microbes, many microbes. Then additives in our food, additives in our water, pollution, general pollution in the environment, all sorts of things. So they damage the balance in the gut, in the digestive system, because any microbial community functions on balance. They have to be all the microbes present there. There should be fungi, bacteria, viruses, protozoa, all sorts of creatures. And when they're together and they balance each other, they control each other. They don't allow anyone to cause trouble. But when you keep eating antibiotics, because you're buying your food in the supermarket, for example, or you're eating other chemicals which kill microbes, you're breaking that balance all the time. No antibiotic in the world can kill everything. They can only kill a certain group of microbes. And once you've taken those out, they were controlling a myriad of other creatures. These creatures suddenly are not controlled anymore. They overgrow, they take large territories in your digestive system, and the balance is gone. The harmony is gone. And what used to be good for you, the microbes that used to serve you very well in a balanced community, in an unbalanced community, start causing trouble. They digest food in their own way. They start converting it into many, many poisons. They start producing too much serotonin or too much dopamine or not enough. Or there are more than 200 various neurotransmitters which are manufactured in the digestive system and then transported to the brain for the brain to use. And if the gut flora is abnormal, unbalanced, then it produces abnormal amounts of neurotransmitters. Some are not enough, some are too much, and the whole balance is gone. When your brain receives this mixture of abnormal neurotransmitters, it responds, it reacts. So your mood gets abnormal, your behavior changes, You may become depressed, or you may develop anxiety or obsessive compulsive disorder or memory lapses or something else. So, or you may not sleep well, all sorts of things can happen. So that is one connection between the gut and the brain. Another connection is hormones. Our brain is very hormone dependent organ, and every microbe in the gut produces its own hormones. In fact, the endocrine research into gut flora now shows that it's the biggest endocrine organ in our bodies, the most powerful. So this flow of hormones coming out of your digestive system, they talk to our hormonal organs, to our endocrine system. They talk to your thyroid hormones, adrenal hormones, sex hormones, and other hormones that your body produces, and they can upset the balance in your body. Hormones are very powerful molecules. They affect every function, every cell, every organ in your body in a very complex way. And the brain is no exception. The brain is very much affected by the hormonal balance in the body. And when these hormones are abnormal, you start getting psychological problems, mental problems, and neurological problems. The brain responds. So these are just two connections. Then we have a vagal nerve. That's one of the biggest nerves in the human body. It comes from the brain down, and it goes to practically every internal organ in the body. Not only it sends commands to these internal organs how to work properly, but it also collects information from those organs. When this disaster is happening in your digestive system, that information is collected from your intestinal organs and passed into the brain, and the brain responds accordingly to that information. So that will bring more imbalances and more psychological problems and more trouble. And what happens with small children? When a child, a baby, gets abnormal gut flora, and children inherit their gut flora from the parents, from the mother and the father. We have now generations of people in the world who have abnormal gut flora because of the environment we've created, because of all the chemicals in our food, in our water, in our environment, everywhere. So the mother and the father pass damaged, abnormal gut flora to their baby. So the baby starts life from a very poor point as a result. They have abnormal gut flora, these children. What this abnormal gut flora does, lots of microbes, they become pathogenic. They damage the integrity of the gut wall in a baby, in a child, making it porous and leaky. Big holes develop in the gut wall, literally big holes. At the same time, this abnormal gut flora digests the food in the wrong way, converting it into many, many toxic, poisonous chemicals, which will absorb through this leaky gut, through these holes in the gut wall. At the same time, they produce many toxins of their own, these microbes. So this baby, instead of being nourished by the digestive system, gets poisoned by their own digestive system. This flow of toxicity, this river of toxicity coming from the gut, reaches the brain, gets inside the brain, clogs the brain with toxicity. As a result, the child cannot develop appropriately. The child's brain does not develop appropriately. The most severe situation is autism. These children are very toxic and their brains are very poisoned. From my professional point of view, 100% of modern autistic children were born with a perfectly normal brain. These were perfectly normal babies, but they got poisoned by their own gut flora. Poisoned by the food that gets digested by this gut flora abnormally and converted into millions of poisonous chemicals. Their brain is clogged with toxicity. That is why the child is autistic. If the level of toxicity is different and the mixture of chemicals is different, then the child may not become autistic, but will become hyperactive, develop attention deficit disorder, oppositional defiant disorder, dyslexia, dyspraxia, epilepsy. The list is very long, and new diagnoses come out all the time. So that is the connection between the gut and the brain. That is the gut-brain axis. Absolutely. The leaky gut is when the gut wall is porous and leaky, and things which should not absorb suddenly absorb. What happens? Our gut lining is lined by very specialized cells called enterocytes. They're epithelial cells, and these cells only live a couple of days. They have a very short life. They work very hard. They get born very deep, deep, deep in the gut lining, and then they travel up the villi, getting more mature on the way and fulfilling many functions for us. They take a crucial role in proper digestion of food, in proper breakdown of food. And on their sides, they've got like Velcro. They're attached to each other, like with a Velcro on the sides. Trouble is, these pathogenic microbes in the gut of these children and adults develop chemicals, produce special chemicals which break that Velcro. They damage it. So the cells are not attached anymore to each other. They separate from each other. And holes develop in the gut lining. Normally, food gets digested, and then these cells swallow that food inside themselves, analyze it, make sure that it's safe, and then they release it from the other end into your bloodstream to be spread out around the body. But when this Velcro is broken between them, and the gut wall opens to invasion, it becomes porous, holes develop in there. Food doesn't get a chance to be digested properly before it absorbs. It absorbs undigested. And then the immune system finds these undigested bits of food, looks at them in the blood and the lymph and says, you're not food, I don't recognize you as food, and attacks them. And this attack of the immune system manifests as a food allergy or intolerance. Many, many symptoms can be the result of this food allergy or intolerance. Can be a panic attack, can be a drop in your blood sugar level, it can be a drop in your energy. You can feel dizzy, or you can develop a skin rash, or you can have an asthma attack, or you can have cystitis, or you can have eczema, or psoriasis, or rheumatoid arthritis, or anything you like. Painful joints, painful bones, painful muscles. Any symptom can be developed as a result of this food allergy and intolerance. People go and do testing for food allergies and intolerances and find that, I should remove these foods and I should remove those foods and so on. And they start removing foods until there's nothing left to eat. And they're still reacting. Because the problem is not with the food, the problem is with your gut lining. As long as your gut lining is like a sieve and it has holes in it, you can be sure you're absorbing everything undigested.
So the full video will be available for viewing later in keeping with the time. I would request Dr. Mohan to take over the chair, introduce her panelists and get the discussion underway.
Yeah. At the onset, I would like to thank the organizers for giving this opportunity to me. And this conference goes on year after year, and we've been falling in love year after year. It's so nice to see all of you all this morning gathering. Right now, whatever specialists you are, and I can see a lot of youngsters, students, etc. By the time the next 2-3 decades, what you all will realize is that what we did was too preliminary, because the way the things are moving, we are realizing many of the chronic diseases, we were very effective in taking care of so many other infections, etc., vaccines, antibiotics. So we don't see so many infections now in children, like bacterial pneumonias and diarrhea have been come down. But what we are seeing is a change. We are seeing a change into what we call as a non-communicable diseases, where this is progressing and incidence of diabetes and heart disease and fatty livers and issues are increasing. And we now try to recollect what our Nani ke nuske they used to say, is most of the time our ancestors used to talk about a healthy lifestyle and eating, and the way they took care of their life was much different from what we are doing today with modernization, the way we eat, the way we live, the way we sleep, the way we see screen. Things are changing, so it comes at a cost. And I must give the credit to Ishi for having thought about this more than a decade back. If I'm not, it's little less than 2 decades when you thought about that it's time to have a society called the Celiac Disease Society, because at that time we started realizing that there were a lot of patients who were coming with celiac disease. And celiac disease, as you go through the conference, you'll realize it can manifest right from head to toe. In the sense, you can have problems relating to your hair loss, a face, glow, whatever you want to say, to anything, whether it's abortions, infertility, diarrhea, constipation. Now we are talking about the gut-brain axis, people presenting to you with joint problems. So there are a plethora of ways that celiac disease can present to you with. And as we are understanding, and thanks to Ishi, because she was one of the first ones who started talking about the non-celiac gluten enteropathy, where we are trying to say it's not only the celiac disease where you have a positive serology or a biopsy, but its effects are more. In short, cutting it short, what I want to say is that a fact anybody in the hall can say, what is the total number of gut microbiota that you have? Okay, a simple thing. Are they more than your cells? Backbenchers, students. Do you think the bacteria or the gut microbiota in your body is more than your own cells? Yes, they are nodding. You're right. So are you living with them or they're living with you is a matter of debate. So you have trillion, like 10 to the power of 13 cells and 10 to the power of 14 microbial cells in your body, predominantly bacteria. And so besides viruses and a little bit of fungal, etc. So that composition, if it gets disrupted, it's called as dysbiosis. Living in harmony with those bacteria or the microbiota is called eubiosis. So, Dr. Deepak, I just want to understand, we get to see a lot of patients whom we say we never used to see so much of autism and ADHDs, and the spectrum is increasing. And is it true if I tell you that if I was practicing in USA and I had to practice gastroenterology and I was interested in autism, then I would do nothing except call myself as a gastroenterologist for autism. Is that true?
I'm not practicing in USA, but I'm practicing in India. So saying yes, absolutely. I can't say that, but yes, what I see children with autism, I see majority of them have gut issues. And some of them who don't have gut issues also, you work on the gut as the first line you start. That's what my approach is. Along with other interventions, you see them, they're starting improving. So indirectly, I'm saying yes, yes.
Yeah,
that
so
is one of the...
basically what Deepak, we all know Deepak is one of the most popular child psychiatrists that I know of. And he's been doing a lot of work in ADHD, and he runs a lot of associations and regular meetings and conference. What I wanted to say was that 70% of the autism children have psychiatric issues, majority of which is anxiety and behavioral other problems, which Deepak would say. But you'll be surprised, one of the earliest studies on autism said 7 out of 11 have GI disorders. And these GI disorders could be anything, could be pain, could be constipation, could be feeding intolerance, could be allergies, could be reflux, could be diarrhea, and abdominal discomfort. So what Deepak is trying to say is that what he finds in his, like the child getting more anxious, getting behavior disorders and all, is some way related to the comorbidity which is being found in this is a GI disorder. So Ishi, when I talk about this GI disorder, and he thinks that he sees a lot of patients of autism which have GI disorders, what is your experience in treating, and how do you manage to be successful in treating them, and what exactly do you do with these kids?
Thanks, Neelam. Really, some of the things that I see in my clinical practice also surprise me. And the case in point is not even, I mean, obviously things begin very early. We keep saying, for instance, constipation. If a child comes with a diagnosis of constipation, the first thing is change his diet. Mom, please feed more fiber, more vegetables, more fruits, etc., etc. But what about a child who has not even reached that stage? The child who is being breastfed and has severe constipation, and how did that child reach me? Because obviously that's not the first line of intervention for most people. So this was a mother who came to me. She was in her late 30s. She had delivered a baby, and she came to me primarily for weight loss. And she goes, I am fed up with my child. I can't manage him. He's crying morning and evening, and at night I don't get to sleep. I'm going crazy. I can't lose weight. So I said, but wait, why is your child crying all the time? Why does he have colic? Yes, ma'am, he has colic. So I said, let's treat that first before we treat you. So that's how that child came to me, right? That it didn't come to me. I got a chance to treat this situation. So I told the mom, just do one thing. And her history showed she had a hypothyroid condition, which was an autoimmune condition. So my mind went back to her gut. And obviously, this was a 4-month child, exclusively breastfed. So something was being transmitted through the breast milk, which was not okay for the child. That was my line of thinking. And I just said, change your grain. And don't have the rotis that you do. You have jowar rotis instead, which is a millet. And she said, but that'll be hard in the house, etc., etc. But I said, just do it for a week and come back to me. And she came back saying, ma'am, the colic has gone. So I said, well, that's great. She says, but ma'am, I forgot to tell you that my child is constipated and the constipation hasn't gone. So I said, okay, maybe we'll need to change the dairy in your diet. And she said, oh my God, that's not possible. I'm lactating and my mother-in-law is going to completely freak out. Is not going to be able to do this. So I said, well, just tell your mother-in-law that the milk that is being produced by the animals is not after drinking milk. So maybe she'll understand. And so it was, and she changed her milk, and she came back. The next visit was, ma'am, the constipation has gone completely. The first 2 days, this child passed 12 motions a day, where the presentation was, he passes a motion in 10 days, and sometimes even 12 days. The constipation in this child was so severe, once a week. And they were so, so grateful. She says, there was a celebration in our family group that my baby is finally passing stool. So it was so bad. And this patient, every time she ate wrong, the baby was affected and the baby got colic and constipation on those very days.
So I think what you're saying, it's again going back. There are a lot of parents who come and ask, what should I eat? What should I not eat when they're lactating? And earlier days, I remember when, I had my baby and I got married in a Kashmiri family. And I was like totally surprised when my great mother-in-law gave me a list of what not to eat. And I said, oh my God, I'm a doctor, I can't do this. So
exactly.
I can now correlate that the way they come up with, they don't want you to eat so much non-veg, this and fiber, probably that goes.
Traditional wisdom.
So I want to just go into a scientific manner of what she was saying. What exactly has been shown, in fact, there was a study which was talking about constipation, and they took 79 children who were very small, like 6 months to 36 months and all that age, before the toddler age. And out of the 79 children, half of them were constipated and half were not constipated. And what they realized was there was no difference in the bifidobacterium. That's like a bacteria which is seen in the stool. But there was a difference in the lactobacilli. The lactobacilli was much less in the constipated baby. And also they noticed that the intake of milk was higher in these babies who were constipated. So I mean, just I recollected that study and wanted to correlate. But I don't want you to go with this message outside that every child who's constipated, you need to, who's been on a breastfeed, you stop mother's milk and you stop the diet. You need,
absolutely.
You need that was just a way to set the discussion on that you need an expert to understand. And similarly, because if the calorie intake of the mother decreases, if she's changed her diet and all, so you need to ensure that the mother is taking the adequate calories and she's taking the adequate proteins if she's not taking the milk, and all that balance needs to be looked into by an expert. Sarath, now while we are talking about fiber, the first thing I wanted to say was, she started saying that most of us start saying by change your diet, vegetable and fruit. So is it a myth that the fiber is in just vegetable and fruit? There's something very common like dal that you eat, and you'll be surprised that the amount of fiber in dal in a katori is probably 8 grams. So it's like very high as compared to, because once I remember a mother was giving digestive biscuits to a baby, and I made her look into that digestive biscuit. The fiber was not even 0.5 gram. And if she would have given a katori of dal, the fiber was much, much better than it is going to be. But is it true that fiber is a double-edged sword, Sarath? Yeah. That while we are talking about low fiber, there are issues with high fiber. What is your take on this about fiber and constipation and diet.
Thank you, Neelam. Well, if you look at the daily fiber intake a child needs, it's usually age of the child plus 5 grams as an approximation. But fiber, we need to understand, is more of a preventive strategy to make sure that constipation does not develop. In a situation where the child is badly constipated, starting off with fiber when the child is acutely constipated and bloated will be counterproductive. It will make the situation worse. So the first thing to do is to evacuate the bowel and also make sure that the excess gas which gets produced in these constipated children, because of the bad bacteria, they are the ones producing the gas, so the dysbiosis is there along with the constipation. So when you treat the constipation, eliminating the stool and addressing the dysbiosis both go hand in hand. Talking of fiber, it should be ideally about 4 to 6 weeks after you start the initial treatment for constipation to make sure that it's maintained and there's a good roughage in the diet and constipation does not keep happening repeatedly.
So the message what he wants to give, and I think I would like to re-emphasize on that, is majority of the time that the constipation that you see is due to a low fiber diet. However, there is a condition called a slow transit where the movement of the bowel is slow. And in this condition, if you give high fiber, your further movement of the gut would decrease. So you would need an expert to understand what is the right fiber. Because I had a mother of a young girl. She was like 4 years. And the fiber that the mother was giving her was practically 27 grams. So that is also a message we want to deliver, is that you need to keep a balance. So coming back to you, Deepak, when we talk about, like I worked with you in a couple of cases and where, sorry, I forgot to introduce myself, I'm not sure. I'm a pediatric gastroenterologist, hepatologist, now working at Medanta, the Medicity, and I've been working in South Delhi too. So Deepak, what I wanted to ask is that we ask a lot of, in these ADHD patients, we try to understand their problem, we look into the allergy test, or we look into the constipation, we try to look into the food aversion, and you try to change the diet, you suggest that we should start some more supplements and all. What is your logic? Can you expand a little more about the dysbiosis and gut-brain axis?
See, when I see children, whether with autism spectrum disorder, other neurodevelopmental disorders, the first of the things when I'm taking history, my thing is to take a good history, which is about the gut. And what comes out is that most of them, as I was saying, they have gut issues. So my thing is to first start, and we know about the gut-brain axis, which Dr. Natasha also was talking about, and there's enough evidence, there enough papers are there, people who believe into it, that yes, how gut-brain axis is important, how gut is a second brain. We talk about the leaky gut, how toxins are going out, how they're causing a reaction, inflammation in the brain, how everything is causing a chaos in the brain. So my thing is that the first thing I always tell to the parents, can we go with the diet? Correct. We know that every diet will not work. We know that no diet is 100%. So I tell them, and then we start with the diet, correct? And then we start with the diet, and gradually I try to cut in the diet. I try to cut down all the processed packaged foods. I cut down the sugar. I cut down the soyas, and then gradually, if they're ready for it, and a lot of them parents are not ready. So then gradually I work with I tell them that yes, other diets are also important, and then they think. Second thing is that as you said about that, a lot of these kids have the constipation, other thing is there. And then, yes, so in that case is that already they would have been going to the gastroenterologist, I usually tell them, please make sure that we are able to make sure that the gut is healthy. I tell them that please make sure the gut is healthy. And then I also introduce the probiotics, which is one of my, I've seen is that, which the probiotics I start with, and that's the second option I start with. And then if required in some of the cases, I use digestive enzymes. So this is usually I start with. And then once the gut is healthy, and then I go, the gut is healthy. And then where I find I need more expertise, I need more my other colleagues, I involve my pediatric gastroenterologists in various capacities to work with it so that we work as a team and to work with that. So my first thing is that the gut should be settled. The gut should be well taken care of. It should be well addressed. Along with that, other interventions, that is all parallelly going on with the child with this spectrum disorder. And I tell you, the parents who are very diligent, the parents who are strictly following the diets and who have followed, they've been able to follow these diets along with the probiotics and along with other interventions for the gut. I've seen them that we are able to get very good results. Their sleep becomes better, their gut is far better, their sleep is far better, the irritability has gone down, they're more settled, less tantrums, and the self-injurious behavior. One thing which I see, the self-injurious behavior. Nothing works out. You settle the gut, the self-injurious behavior, including head banging, including biting, getting up in the middle of the night middle of the night awakenings, and then crying and creating a chaos in the house, all that starts settling down. That's another thing is that. So that is what we are also seeing. Also, what also have seen along with that in gut dysbiosis is that when we address these children who have various parasite issues, who have various yeast issues, you address them through diet and other various other agents. Then also you start them. They're laughing to self. They're self gratification symptoms, self-stimulating behaviors. They're other biting, other symptoms also start, and they start getting more and more better. So that is what has been my experience is that in working with these children.
It's a beautiful discussion, and it feels really sad to see on the right side somebody trying to say. Anyway, so another good news I wanted to share with you is that the weight of the gut microbiota is more than the weight of your brain. They are almost 2 kgs weight of the gut microbiota. This was just an initial discussion, and picture abhi baki hai mere dost, because there's so much to talk about it, what gives rise to. And I'll request Ishi that next time it should be a 1-hour discussion on the role of gut and dysbiosis. But we just wanted to say that whenever you're dealing with any chronic diseases or any of these behavioral issues and all, remember that we are talking about dysbiosis, the leaky gut, what they talk, and it affects not only the various organs in your body and brain, and it's not so easy. You need to work hard to understand how it's been doing, and always connect to an expert, because there are very lot of centers who are working now in understanding all this and doing it. So that was keeping the thing to start with. And I thank my panelists, Dr. Deepak, who's a psychiatrist, South Delhi, Dr. Ishi Khosla, she's a nutritionist, President South Delhi, Sharath, and myself, Dr. Neelam Mohan, signing off. Over to you. Thank you.
Thank you so much, Dr. Mohan. And you wove that really beautifully together. The whole thing between autism and then, bringing in the whole digestive thing, and Sarath, that was very well done. Not that I'm an expert, but as a mother, I could relate to some of that. So thank you so very much for that. Can we have a big round of applause, please? Yes, sir. We will just organize that for you, sir. I wish we could have...
Thank you so much. My name is Dr. Pandav. Very exciting, very absorbing session. Dr. Ishi and I have been thinking for the last few months to compile a book on frequently asked questions. That's what we did in the Ideal Story. We identified 20 questions to begin with, and then we kept on going. So I would suggest, Dr. Ishi, at the end of the symposium, that we try to compile 20. 20 is not a precious number, but 20, 40, 60 frequently asked questions, which will go a long way in terms of raising awareness. Thank you very much.
I'm happy to be a part of writing. Yes, absolutely. I think that's very important because the whole thing is changing now. I mean, when do I need to ask for a skin prick test? What do you mean by allergy? What do you mean by reflux? What do you mean by constipation? What is the definition of constipation? Is constipation just meaning less frequent stool? There's so many things that we can go on answering, but then probably there's so much to cover and it's not. We will come back again, hopefully. Yes, would anybody want to ask any question, please? Yes, please. Introduce yourself. Ji. There's a mic there, sir. On the right side.
मैम आपने बात की लैक्टोबैसिलस बैक्टीरिया और बिफिडोबैक्टर. मेरे फादर को डायरिया रहता था अक्सर थोड़े दिन बाद, तो मैं बहुत कुछ ट्राई किया, प्रोबायोटिक दिए, VSL3 और बहुत सारे. मेरे फ्रेंड है गैस्ट्रोएंटरोलॉजिस्ट, उन्होंने भी, फिर आखिर उन्होंने एंटीबायोटिक लिख दी. तो मैंने कहा कुछ भी हो जाए मैंने एंटीबायोटिक नहीं देनी, मैं इनके गट को ठीक कर रहा हूँ, एंटीबायोटिक तो जो मैंने इतने दिनों से मेहनत की है सब बेकार हो जाएगा. तो मैंने पढ़ा फिनलैंड एक देश है क्लीनेस्ट नेशन ऑफ द वर्ल्ड. जैसे सीलियक सोसाइटी है ना, तो सीलियक डिजीज़ की वर्ल्ड कैपिटल है, वो बन गया पिछले कुछ सालों में. और टाइप 1 डायबिटीज़ की भी वर्ल्ड कैपिटल बन गया. उसके ऊपर रिसर्च पेपर है कि क्यों बन गया. क्योंकि क्लीनेस्ट नेशन ऑफ द वर्ल्ड में के कारण उन्होंने क्लीननेस के लिए इतने सैनिटाइज़र और इतने सारे इस्तेमाल किए, माइक्रोब्स ही सारी अपने ख़त्म कर दिए उन्होंने सारे जगह सारे अपने. तो उन रिसर्च हुई तो उन्होंने कहा ये जेनेटिक इशू होगा. फिर उन्होंने आगे देखा कि फिनलैंड के साथ रहने वाला एक जो पड़ोसी देश के उनके लोग हैं, जेनेटिक मेकअप सेम है और वहाँ वर्ल्ड का लोएस्ट है सीलियक डिजीज़. तो उन्होंने देखा वहाँ के बच्चे जन्म लेते ही खेलते हैं मिट्टियों में, भेड़ बकरियों के साथ, याक के साथ, ऐसे सब जैसे गांव जैसा माहौल होता है, वहाँ है ही नहीं. तो मैंने कहा क्यों ना ऐसा ही किया जाए. मैं अपने पिताजी को भी गौशाला, क्योंकि गाय भैंस तो है नहीं, हम दूध बंद कर रहे हैं, तो दूध में मैंने बहुत काम किया. कैमल्स मिल्क है ना, जो कैमल को शेफर्ड्स हैं जो कैमल ऊँट को पालते हैं, वो ऊँटनी का दूध पीते हैं, उनमें इंसुलिन लाइक फैक्टर है और उनमें डायबिटीज़ 0 है जो ऊँटनी का दूध पीते हैं. लेकिन ऊँटनी का दूध उन्हीं को हजम डाइजेस्ट होगा जो ऊँटों के साथ रहते हैं, वो बैक्टीरिया भी वहीं से आता है. तो ऐसे ही हम दूध बंद कर रहे हैं, दूध का बैक्टीरिया, क्योंकि हमारे हर घर में.
आई एम सो सॉरी टू इंटरप्ट. आप प्लीज अपना सवाल पूछें.
पूछ रहा हूँ ये सब
ये बहुत लंबा सवाल पूछ लीजिए प्लीज.
ये सब बैकग्राउंड में नहीं होगा तो सवाल का जवाब नहीं आएगा. हाँ मैं पूछ रहा हूँ, बस 1 मिनट में पूछ रहा हूँ, 1 मिनट में पूछ रहा हूँ. ये जो मैं बातें बता रहा हूँ ये भी नहीं है, किसी को नहीं पता होंगी. और सवाल ये है कि मैंने फादर को मैंने कहा ये पहले गाय बांधते थे अपने घर में, हर एक घर में होती थी, पालते थे, गोबर का पोचा लगता था रसोई में, गोबर की पाथियों पे दूध को काटते थे, वो बैक्टीरिया सारा था. तो मैं फादर को गौशाला ले गया, 2 ही दिन में ठीक हो गए. उनका डायरिया मुड़ आज तक नहीं जिंदगी में हुआ.
जी आपको नमस्कार. आपने पहचान लिया, मैंने पहचान लिया.
डॉक्टर इसी खोसला के गुट में हूँ, मैंने गट में नहीं गुट में हूँ. और इसीलिए मैंने गेहूं खाना बंद कर दिया. क्या मेरा ये फैसला सही है? इसमें कॉन्सेंसस आप में होना चाहिए, ये नहीं कि आप कुछ सोचें और वो कुछ सोचे.
नहीं ऐसे नहीं है
गेहूं स्टेपल है. गेहूं के बारे में 5 तरह के विचार क्यों हैं, कॉन्सेंसस क्यों नहीं है? मैंने तो इनके कहने पर गेहूं छोड़ दिया और बहुत फायदा हुआ है.
क्या फायदा हुआ?
जी मेरा हैप्पीएस्ट मोमेंट जो होता है दिन का, जब बाथरूम जाता हूँ ना, वो कॉन्स्टिपेशन की बात की ना, जीवन में सबसे बड़ा सुख है कि आपको कॉन्स्टिपेशन ना हो.
जी बिल्कुल सही.
उससे बड़ा सुख नहीं है.
नहीं.
तो इनकी वजह से मैं तो ट्रांसफॉर्म हो गया हूँ, लेकिन दूसरे को लोग बहका भी रहे.
तो आपको वैलिडेशन क्यों चाहिए? बट आई नीड टू ऐड समथिंग धनंजय जी. खाली गेहूं छोड़ना एक अपने आप में सोल्यूशन नहीं है. आप क्या और चीज़ें खाते हैं, आप फल सब्जी खाते हैं, अच्छे फैट्स खाते हैं, बाकी चीज़ों की कमी नहीं होनी चाहिए न्यूट्रिशनली, तो ही आपकी डाइट को 100% फ़ायदा मिलेगा आपको. एग्जैक्टली जी. बट अगर आप खाली ग्लूटेन फ्री की बात करें तो उसमें हम बहुत गलत चीज़ें भी ले सकते हैं. सो दैट इज़ द पॉइंट.
थैंक यू फॉर दोस कमेंट्स. Quick one.
Very quick, or maybe offline. Our panelists will be stepping down.
Yeah, hi. I'm dietitian Poonam, and I have a grandson, and he is now 1 year old, and 6 months तक वो पूरा breastfeed पे था, and उसके बाद उसकी mother, मतलब my daughter, उसने proper वो baby led weaning करती है, and उसने उसको wheat नहीं दिया, and she was giving her sprouted ragis and fruits and vegetables, everything. But he is highly constipated. Like he does, you know, he poops only after 4-5 days, and that too very hard. So I don't know like what's going wrong.
I would suggest that you need to meet a gastroenterologist like me.
Okay.
Because itna agar simple hota, so it's not so simple. You need to understand lot more into constipation and whether it's organic, whether it's functional, whether it's diet related, whether it's... So I would like to suggest you to meet a pediatric gastroenterologist and then take it forward from there.
Okay, so if I can add here, so pediatric gastroenterologists, they have shown, and they mostly recommend some probiotic as that is fine, or they prescribe some depository. So I mean everything is going in vain for him. So I just wanted to get a,
I'll work with you outside as she suggested, and I'll follow the boss's order.
Okay, thank you.
Please, अगर आपका individual किसी
मैम हमने सारी चीज़ों के बारे में बात कर ली, मैं हिंदी में बोलना चाहूँगा। क्या एक चीज़ और छूट गई है, क्या होता है कई बार जब माँ अपने बच्चे को जन्म देती है उस दौरान माँ की डेथ हो जाती है, तो बच्चा किस तरीके से क्या खाए क्या पिए कि वो स्वस्थ रहे, क्योंकि माँ का दूध ही सबसे सर्वोत्तम माना जाता है आहार, तो उसके बारे में भी आप लोग कुछ बात करें तो अच्छा होगा।
इसमें कोई दो राहें नहीं है कि माँ का दूध ही बेस्ट है. सो देर आर टू थिंग्स. आजकल ब्रेस्ट मिल्क बैंक्स भी हैं, सो दे कैन कंसिडर. Second option is going for a breast milk bank. Breast milk bank is like mothers who are lactating, they donate their milk. That's called breast milk bank. Let me finish it. And then along with it, when you don't have, the ideal thing कि क्या आप उसको गाय या भैंस का दूध दें या फॉर्मूला दूध दें. In that case, जो breast milk के करीब आ रहा है for the first 6 months would be a formula milk and not a cow milk or the buffalo milk, because उसका renal load इतना ज़्यादा होता है कि that it will be not good for the baby. So number 1 breast milk, number 2 breast milk, number 3 breast milk. When you are not able to give, then think about a breast milk bank. Still, if you don't have option, then instead of animal product, formula would be better, close to the osmotic load which the breast milk has. Further discussion outside, sir. Thank you so much.
Thank you so much. I'm really sorry, we cannot take any more questions. We have a long day ahead of us. Can we please have a big round of applause for our panelists? They've been very patient with all your questions. Thank you so very much, doctors, for your valuable time today. Can we please have a photograph here? I think he's just stepped out. There he is. Please come forward. Say cheese. Thank you so much, Dr. Mohan, again, for chairing a really interesting session and giving us such a participative beginning to the day. Ishi, may I request you to stay back, please? We now move on to our inaugural session. Arjun? Thank you so much. You were very good.
Thank you. I'm going to address the time issue also. Thank you for such a splendid panel discussion. So there is something that I want to share with all of you, and we have a lot of mentors and colleagues and friends here. But one person who's not going to be our friend today, it's stuck there on the wall, and that's the time. So you have to help all of us and try and also reduce the Q&A, but we have something really cool. Behind your badge, you have a QR code. This is a Linktree QR code. So if you scan it, there's a feedback form, and in that you have a space where you can write down all your questions in whatever language and way you want, and it's our surety that we'll get back to you with the answers, and also the chairpersons and the moderators to keep it as short as possible. So without much ado, I'd love to thank the panelists on stage for this wonderful discussion. And moving ahead, I feel privileged to be calling upon the stage Ms. Ishi Khosla for her remarks as the President of the Celiac Society of India. As most of us are already well aware, Ms. Khosla is the founder and President of the Celiac Society, a practicing clinical nutritionist, columnist, author, an entrepreneur, researcher, welfare worker, and a stalwart in a field of clinical nutrition. Also, along with her, I would request the COO of the Celiac Society, and more importantly, the powerhouse of today's conference, Ms. Anju Khosla, on the stage. A big round of applause, please.
Mr. Sukumar Ranganathan, Dr. C.S. Pandav, Dr. Srinath Reddy, Dr. Naveen Dang, Dr. Harsh Mahajan, Dr. Anupam Sibal, Dr. Sarath Gopalan, Dr. Tom O'Brien, the esteemed faculty, and our distinguished audience. Good morning and a very, very warm welcome to you all on this very cold January morning. I'd like to thank you all for making it today to be here with us and to be a part of our journey at the International Symposium on Gut Health and Lifestyle Disorders themed Millets for the Microbiome, Your Way to Wellness, ISGH 2024. To deliberate on the importance of the gut microbiome, its profound connection with health, ill health, and the transformative potential of millets in building a healthy microbiome. Exactly 5 years ago, I stood here to open the International Symposium on Wheat-Related Disorders, the ISWD 2019, our first flagship event with nearly over 1,000 attendees and experts from 14 countries across the globe. The event concluded with the white paper being submitted to the government, which helped put the spotlight on, number one, the importance of the choice of grains and its impact on non-communicable diseases like diabetes, heart disease, cardiovascular disease, autoimmunity, cancer, skin issues, sleep issues, and even mental health. And number two, our major public health problems which are burdening our healthcare system and also affecting the future generations ahead of us, like anemia, malnutrition, stunting, and diarrhea, that could be addressed through the right choice of grains. No mention of the ISWD 2019 is complete without acknowledging 4 members of the Celiac Society who were present here in the last inaugural and are missing and not here with us today. Sadly, we lost Professor M.K. Bhan, who was a patron of our society, Dr. K.K. Agarwal, Dr. Rakesh Tandon, and Dr. Rajiv Khosla. We miss their presence immensely and salute their contributions. A bit about how we've reached here. As a matter of fact, as I mentioned even earlier, I have been seeing transformations in my clinical practice, treating not only obesity and weight-related issues, but things I could never imagine intervening with IUGR, intrauterine growth retardation, diabetes, depression, anemia, liver disease, chronic kidney disease, etc., etc., etc. Who could have imagined that diabetes could be reversed? That heart disease could be treated through the gut? That anxiety could be managed through the gut? That thyroid nodules or polyps could shrink with the right diet? Or for that matter, how would you build immunity through the gut? But yes, that was happening. However, I wondered how my learnings and my triumphs in my clinic would ever be scaled to a community level. How would it impact public health? This was a really anguishing question. And then, providentially, a few years later, our Honorable Prime Minister declared 2023 the year of millets, with 70 countries and the United Nations. It almost seemed like there was somebody listening to me up there. Just what we had set up to do through the Celiac Society's vision. Our mission overnight and suddenly began to become a reality. The strong mandate and the directives by the Prime Minister has changed millets from the poor man's grain to a gourmet grain, reaching the White House menus to exotic cuisines. Millets have been uplifted to the divine status as Shri Ann, unprecedented in the history of any nation. Thanks to this monumental work, today, celiac disease, gluten sensitivity, gut health have assumed mainstream recognition. I am sure today's deliberations and learnings will reach far and wide through each one of you. And to the researchers here, to the healthcare professionals here, and the policymakers present, let millets not be just a theme for discussion, but a catalyst for positive change in our global approach to health and lifestyle disorders. And together, we can make India and our world a healthier place. The grain changer is indeed the game changer. That's my tagline. And like Hippocrates, the father of modern medicine, said 2,500 years ago, that bad digestion is the root of all evil and that all diseases begin in the gut. The Celiac Society has taken up the Mera Millet Magic campaign, which will aim to ensure at least one millet meal a day for all. So let's take a pledge, Ghar Ghar Shri Ann, Har Ghar Shri Ann. I would now like to acknowledge the support and help and thank all those who have made this happen and supported this cause, especially Mrs. Lekhi, Mr. Sukumar, Dr. Tom O'Brien, Dr. Pandav, Dr. Sarat Gopalan, Naveen and Arjun Dang, always with us, Dr. Anupam Sibal, Dr. Ajay Bhalla, Dr. Ashima and Ashutosh Shukla, Mr. Anil Rajput, and a big thank you to all our faculty members who have taken out time from their busy routines to be a part of this symposium and share their learnings. Dr. Nija Hajela and Dr. Vijay Dhawan are a part of my dream team. So my dream team includes many names, and I'm going to read them very quickly, but Neeraj Arora, Ishita Jain, Aarti and Pooja Kothari, Asha Chandra and Bharat Gauba, Hema Bhatnagar, Reema Mehta, Mini Seth, Mala Sekri, Swarnik Singh, Anandita, Tawfiq, and Shiza and Prashant Joshi. My office, Shivani, Priyanka, and Navneet. And last but not the least, Gagan Khosla, my pillar. And ladies and gentlemen, a special thanks to the one who actually did it, Miss Anju Khosla. Anju, can we have you here? An Iron Man and an ultra athlete who has tirelessly worked for the 9 months and more and strung this event together. Without her, this would not have been possible, and I literally now call her the Sherpa of the ISGH. Special round of applause. Once again, thank you all for being here, and I hope you enjoy the deliberations, the millet lunch, and a unique Good Gut Expo you must visit, and with millet golgappas. Thank you for your attention, and I hope you all enjoy the day ahead. Thank you.
Thank you, Ishi. That was wonderful. Thank you, Ishi. Now I have to compete with the image of Golgappas in everybody's head. Tough task. Okay, for the inaugural session, I'd now like to invite a few people on stage. If you could please come up and take your seats. Dr. Harsh Mahajan, Mr. A.G. Amano, Dr. Anupam Sibbal, Mr. Sukumar Ranganathan, and Dr. Srinath Reddy. Since you'll all be speaking one after the other, I'd request you to please come up and take your seats. In the meanwhile, please allow me to introduce the first speaker, who's going to be making his remarks in the capacity of an advisor to the ISGH, Dr. Harsh Mahajan. I think we all know him, right? He's a distinguished figure in the field of radiology and diagnostics. He's the founder and managing director of Mahajan Imaging, which runs diagnostic centers all over Delhi, and I'm sure some of us have visited it one time or another. Dr. Mahajan, right here. Come on, guys, let's welcome him with a round of applause.
Thank you very much. Good morning. The very fact that the hall is filling up rapidly shows the interest that exists in lifestyle diseases and gut and the microbiome. And really, I must congratulate Ishi Khosla, who's been a crusader for over a decade in this field, and slowly what she has been saying is coming true. Having said that, the fact that this was also there in our Vedas, and I quote from an article in the Indian Journal of Microbiology of 2021 on Suksham Jivanu in Vedas, the forgotten past of microbiology in Indian Vedic knowledge. And this has brought home the fact that thousands of years ago, we in this country knew about it, and we need to re-embrace it. India, and I quote, is a treasure of traditional knowledge which has been disseminated through non-institutional means from generation to generation and is for the most part undocumented. In this context, the invisible world of microorganisms inhabiting different components of the biosphere is also not an exception. Indian ancient Vedic literature reveals the presence of these tiny creatures named as krimis, a term coined by Rishi Kanav, and as well described about their beneficial and harmful effects. And today we see that the gut appears to be the center of the universe, at least as human beings are concerned. And the discoveries of Rishi Kanav and his descendants, Atri, Yamadagni and Agasti, against microbial infection are highlighted in Atharva Veda. So let us also go back to our roots, which told us about what the gut is all about. And today, seeing the interaction we've already had in the first session, there is a lot of interest in learning and also in sharing one's own experiences about the gut and the benefits and the adverse effects that can come. And I thank all the luminaries who are going to be speaking today, and hope that, as Ishi just now said, millets and their coming back into our day-to-day life probably will be transformational, and this conference and symposium will be a catalyst to make that happen. Thank you very much, and enjoy the whole day.
Thank you, sir, for those very insightful remarks. Always in awe when I hear you speak. I would now like to request our special guest for the evening, Mr. I.G. Amano, to please come up on stage and share his comments and remarks. Mr. Amano is the Managing Director of Yakult India and comes with a wealth of experience in the probiotic nutrition and gut health industry. Welcome, sir.
Namaskar, good morning everyone. As introduced, I'm A.G. Amano from Yakult Dano, India. First of all, I'd like to thank you very much, Ms. Ishkosra, for your warm welcome. Warm invitation to me here. And I'm very honored to be part of the inaugural session. And I'd like to congratulate the Celiac Society of India session and India for organizing this very meaningful international symposium on gut health and lifestyle disorders. We, as an organization, we promote the concept of prevention is better than cure, and healthy intestines lead to a long life. And our mission in India is to contribute to the health and the happiness of people by improving their gut health, and I believe this will also help improve the nutritional status of the Indian populations. We like to continue to support Celiac Society of India, and we will work close together because we have a common goal of promoting better health and well-being. Thank you very much once again, and I hope this conference will be successful in discussing emerging trends and exploring innovative solutions in this critical area of health and wellness. Love your intestine. Thank you.
Given that you began with a namaskar, I should say dhanyavad. That's a new word for you to learn, Mr. Amano. Next, I'd like to call upon Dr. Anupam Sibbal. Morning, sir. He's a renowned pediatrician and healthcare leader, standing tall at the forefront of child health and medical education. His unwavering dedication to pediatric care and medical innovation has earned him widespread acclaim. So it's very, I think all of us will say he's everybody's child's doctor. Right, Dr. Sibbal? Yeah, over to you.
Good morning, namaste. Thank you very much for that kind introduction, Ishi, Dr. Reddy, Dr. Mahajan, Dr. Dang, Dr. Srinivasan, Mr. Amano, Tom, distinguished colleagues from the field of medicine, from nutrition, friends. It's indeed a privilege for me to be here this morning, and I intend just sharing my thoughts with you through a brief PowerPoint presentation. Could I have the slides, please? Thank you very much. Harsh talked about the Vedas, so I would like to start with the Gita, chapter 6, verse 17. The one whose diet and movements are balanced, whose actions are proper, whose hours of sleeping and waking up are regular, and who follows the path of meditation is the destroyer of pain and unhappiness. And I think diet is central to what this verse says. We go back to the 4th century BCE, Charak Samhita. All diseases originate from wrong foods, poor digestion, weakened elimination. And we look at the Shushrat Samhita, 6th century BCE. One whose doshas are balanced, whose digestive fire is balanced, whose bodily tissues and elimination processes are functioning normally, and whose senses, mind and self are filled with bliss, such a one is called a healthy person. So to be healthy, your digestion has to be right. And Hippocrates in 460 BC said, a bad digestion is the root of all evil. So this is something that we've known for millennia, the importance of digestion, the importance of gut. Good health begins in the gut, and quite often we forget that most diseases also begin in the gut. Now all of us have had butterflies in the stomach, and we've had that gut instinct, and we get it often. And of course we've had that gut-wrenching experience. And when our instincts tell us to go with our gut really is trying to tell us something, but quite often we ignore it. Because in today's language, the brain and gut are besties. As a pediatric gastroenterologist, I have this large cohort of children with functional gastrointestinal disorders. And they will vomit before every exam. It's a ritual. It has to happen. They will vomit, they will settle down, and then go take the exam. Or they will get severe pain before anything that has any element of anxiety associated with it. And sometimes it'll be diarrhea and pain, sometimes it'll be just pain. Now, why does this happen? This is because we now understand that the enteric nervous system, 100 million neurons, more than the neurons present in the spinal cord, is rightfully now referred to as the second brain. And there are as many as 30 neurotransmitters that are produced in the gut, and very importantly, most of the production and storage of serotonin, the happy hormone that really makes us feel good, is in the gut. So this brain-gut connection, which has now been studied extensively, is really a matter of intense research, because when we are stressed, the brain sends out a signal to the gut, and when something's not right within the gut, a signal goes to the brain. Turning to the microbiome, it's 1,000,000 times larger than all the stars in the universe. There are 10x number of microbial cells in the human gut than there are in the whole human body. We have 100 trillion microbes, and they are from 5,000 different species, and if we total the weight, it's as much as 2 kilograms. Of course, the number, the species all varies. In the stomach and the duodenum is the first part of the small intestine, there are fewer, and as we go into the jejunum and the ileum, the second and the third part of the small intestine, they increase in numbers. And then of course we have very large amounts of microbial agents in the colon. And when we get dysbiosis, which means that the balance between the good and the bad bacteria is upset, either we have fewer good bacteria, or we have large number of bad bacteria, or their metabolism gets altered. This dysbiosis then has an impact because of the gut-brain axis, the gut-brain endocrine axis, gut-heart, gut-lung, gut-liver, pancreas, bone, muscle, skin, reproductive system, bladder, kidney, you name it, and there is a connection. And therefore, it's not surprising that gut bacteria have a role to play in obesity, diabetes, cancer, liver disease, inflammatory bowel disease, rheumatic disease, heart disease, sleep disorders. The crosstalk that happens between the gut and the brain is extremely important, and 70% of the body's immune system are targeted to the digestive system, and this is something that we have now begun to understand. And if there is disruption in the health of the gut microbiome, there will or there can be a trigger in the immune response, which can then lead to inflammation. We know that the incidence of heart disease is increasing. We have a very distinguished cardiologist among us, Professor Srinath Reddy. Diabetes is increasing. And if we look at data, and this is pre-COVID, and of course after COVID, this has become an even bigger problem. 1.9 billion adults are overweight, 650 million plus are obese, 39 million children less than 5 are overweight or obese, and approximately 20% of all cancers in the world are thought to be linked to the gut microbiota. In India, and especially in children, we are now seeing an increase in ulcerative colitis, a form of inflammatory bowel disease. Crohn's disease, a condition we never used to see 25 years ago. We are also seeing Crohn's disease in very young children, and we are seeing more and more functional gastrointestinal disorders. So I think the time has come for us to understand, and not just understand, we in the field of medicine and nutrition really need to play Cupid. We need the gut and the brain to fall in love with them all over again, because if we do that, we'll have healthier lives. And if our gut heals, we'll have a better mood every day, we will have less anxiety, we'll have a decreased risk of non-communicable diseases, we'll have more energy, and I think our cognitive function will also improve. So how can we feed the gut right? We must drink more water, we must drink green juice, we must have fermented foods, we must eat millets, whole grains, lots of vegetables, fruit. We should have foods rich in polyphenols, and we need to remove inflammatory foods. And we must always remember, what is food to one is to others poison. Thank you very much.
Thank you, sir, for those very thought-provoking comments. Next, I would like to call on stage for a few words Mr. Sukumar Ranganathan, who is our guest of honor for the evening. Mr. Ranganathan, please come up and say a few words for us. Mr. Ranganathan is the editor-in-chief of Hindustan Times. He was previously the editor of The Mint and has previously worked in editorial leadership roles at The Hindu, Business Line and Business Today. It's an honor to have you here, sir. Thank you.
Good morning, Dr. Khosla. Thank you for inviting me here. I'm what in legal terminology would be called Exhibit A, right? Because you're seeing before you, I ran into some people I know who were unable to recognize me as I walked in this morning, and I think this is a change that's happened over the last 9 months. It's happened thanks to Dr. Khosla, and it's happened primarily because of the theme of this conference, right? And I think it's, and you know, it's only when something happens to you at a very personal level that you realize what else matters. The link between, you know, all of us, especially many of us who are reasonably educated, or at least, you know, we have degrees from good colleges, we get taken in by fads. So we read indiscriminately online, we pick up lots of things, we sometimes lean on the scriptures, which, you know, is good from the perspective of faith, but very bad from the perspective of science, in my opinion. So we do a lot of things that I think we shouldn't be doing. And I guess I was also guilty of doing a lot of those things. And I thought I'd tell you 2 or 3 things about my experience with Dr. Khosla, which I think has a lot of bearing on the proceedings of this conference, and which I think are good thumb rules for anyone to have. The first one is to simply follow the science. It's not to follow established practice. It's not to follow tradition. It's not to follow native wisdom, but to follow the science. Because science will tell you various things that you should not be doing, right? For instance, and I'm guilty of this, I used to have green juice every morning till you learn that they have something called oxalates, and which are not particularly good for various internal organs of your body, right? So, and the good thing about my consultation with Dr. Khosla over the last 9 months has been she's always followed the science. The second thing that I've learned is that what's good for one person need not necessarily be good for another person, right? I mean, all of us have these biases about, oh, this worked for me, so it has to be good for you. And in my case, I think all my problems started 15 years ago when I moved to oats for breakfast. And so I've always been fairly active and fit, used to run, used to play tennis. I just thought I was big built. You realize, and when I met Dr. Khosla and went in for a series of tests, she discovered that I was allergic to the active ingredient in oats, which is something called lecithin. Seemed to have caused inflammation. And so it's your gut which really affects the rest of your body. And it then translates into a variety of other ailments. So I had cholesterol, I had blood pressure, and many of those things are under control now. In fact, I'm off medication, some of them. But again, the important thing is, and this is the third thing, which again I learned from Dr. Khosla, is do not do things on your own, because even when you have to go off medication, she insisted that I consult the specialist and see whether it made sense to go off the medication before I went off it. Because a lot of us seem to, we are by nature and by culture, we love miracles, right? I mean, we like to believe. We are all Indians are fundamentally believers. So we believe that, okay, I'm doing this so I can just stop doing everything else, and it doesn't really work like that. The fourth thing, which again I've learned from Dr. Khosla, and this is the last thing that I'm mentioning, is it's very, very important to back up or to back what you're doing with your food in terms of everything else. This includes sleep. None of us gets enough of it. I probably get a lot less than anyone else in this room, but that's how it goes. Exercise and diversions, right? I mean, all of us need to have things that we do to relax. It could be reading, could be listening to music, could be walking your dog, and I think it's important to do all these things. Once again, Dr. Khosla, thank you very much for having me here. Like I said, I'm Exhibit A. I didn't know we were allowed to make presentations, otherwise I would have done a before-after picture so that you could have seen the huge difference. But thank you, and I hope that today proves to be a learning experience for all of us gathered here.
Thanks, Sukumar, so much. I think I'm one of those who wouldn't have recognized you either after ages, having worked in the media industry. Dr. Reddy, I'm going to ask for your forgiveness and a little bit of tolerance. I need to swap things around. Our chief guest has arrived and I'd like to welcome her.
It will be a privilege to listen to her.
Thank you so much. Could we please invite, Ishi ma'am, could you please escort Ma'am Meenakshi Lekhi to the stage?
A big round of applause, please. Meenakshi Lekhi ma'am is the current Minister of State for External Affairs and Culture of India. She is a Member of Parliament and also a lawyer in the Supreme Court of India. Besides writing articles in journals, periodicals and newspapers on socio-political issues, she participates in various television shows on matters of national and international importance to create awareness amongst the public for very integral issues. It's an absolute privilege and an honor having her here with us. Another round of applause, please.
Good morning, Dr. Reddy, Yakul's MD, Mr. Amanul Hassan, and Ranganathji, Dr. Ishi Khosla, Dr. Sibyl, Dr. Mahajan, ladies and gentlemen. Today is not the right day to say what good health I possess. My throat is packed, but considering the awful lifestyle I lead, I must show off that I still maintain a very, very good health. Working for 16 to 18 hours a day on regular basis with no weekends, I can only credit that lifestyles can be managed very easily if we understand a couple of things about ourselves, and each body is different from the other. So I would say that the way Ayurveda works and the way Ayurveda was understood earlier as compared to now is what has led to so much of misery in the world. Ayurveda was considered voodoo, while voodoo was considered science. And that is what was the distinction, and I think that's what needs to be bridged. All the ancient food systems that we have, or the body types we have, if we understood it right from the beginning, whole lot of things would change and would have changed in our respective lives. I have been through it. I'm sure whole lot of us would have been through it. And the alteration and changes like Mr. Ranganath explained to us, I would also explain a few things. When you're crossing 50 and you're little in the senior category, a whole lot of body changes happen. Before that, there is very little realization. So I must say, before 2014, I've always kept very, very busy, more stressed than normal all my life. But 2014 just changed it all. And 2014, the change was, I was little less than 50, it was about 48. And certain bodily changes happen with that time frame, along with the stress levels, because I had just kind of won elections and things. So what elections can do and what post-election stress can do is unimaginable even for people who have overworked all their lives. And that's what happened with me. So aches and pains and a whole lot of lifestyle disorders. So I was eating my dinner at midnight and I was not eating for hours on, completely irregular lifestyle. From there, the things kept dipping down till say 2-3 years ago, post 2019, my children only walked up to me and they said, "Mom, you have your Prime Minister for your example. Why are you not following those footsteps? If you want to work longer, you need to look after yourself. And this can't just go on." And my son fixed my appointment with Ishi. I've known Ishi for a very long time, but I never consulted her for my own fears. But finally my children fixed the appointment and they called her up, and then I was kind of forced to go and see her. When I forced to meet her and the conversation we had, I virtually understood everything she said. If I'm not mistaken, I can take that credit of understanding. So whatever discussion we had, and it was a bit of an informal conversation, along with certain blood types and blood work which we got done. And the understanding post that what was developed is that we need to understand our body's function. We need to understand how each food impacts us, how gut is relevant for all of us, which at times we end up messing out. And all, again, Yakult is there, nothing against Yakult. I think they're doing a fabulous job in bringing good microbiome to our system. But the understanding is that most of the time, our elders and the ancient people ate fermented food. You call it kimchi, you call it onion salad, you call it vinaigrette dressing, you call it chach, you call it kanji. Kanji, both the northern way and the southern way, you put the rice overnight and then you consume it in the morning. Idli, fermented food in terms of appams and everything else. These were all foods so some level of understanding existed with our people that microbiome needs to be upgraded, updated, and we need to develop a system which can take care of a happy microbiome, and certain foods add to that and certain foods kill that. And then balancing of Agni within the system, that on one side you're trying to get the microbiome working, on the other side you have to reinvigorate Agni within your system. And the Agni is, of course, Jatar Agni, which is the fire where while eating food, why we should not drink cold water while you're eating a meal, and several other types of Agni which make you run, which make you work, which keep your brain working. So all these energy forms which keep us running need to be also understood. And I've experimented quite a bit with myself and I've understood. So, for example, I've started a fast from today. And then I know that my brain needs ketones. And I also understand that up to what level I can go, along with the fact that electrolyte imbalance can cause all kind of depletion. So I need to balance the electrolytes in the system. I'm not saying, please do not replicate me, I'm no doctor. I just keep working on myself, but please consult a doctor for your body type, for your kind of issues, what all needs to be done. I have had a hard learning and much later in life, but if you act in time, I think things can work out really fantastically well. And in addition to all these types, I think what one needs to understand, why cleaning up the system becomes important. We can call it detoxification, call it by any name, but certain rest needs to be given to the gut as well. It's like overworked machine all the time. Why meals need to be controlled, why we don't, we feel that post sunset, your body gets sluggish, metabolism gets sluggish because sun is not there. And like we use the lenses, we use the glasses, photochromatic cells operate differently, and that's why plants also go to sleep. The body also goes into a different mode while sunlight, and all those with sleep disorders, the doctors will say, please switch off the lights, don't use blue lights, don't use yellow lights, to only put us away from, do not allow cells to awaken at that hour so that the body gets rested. With all this mechanism, adequate rest, good food, very good cycle, understanding the impact of oil on our system, understanding the microbiome, and understanding that each individual prakriti or nature is different from everybody else. We have a special DNA. Let's understand it. We have special thumbprints. And if we have special thumbprint, that means we are very special people individually. And individually, if we are very special people, what works for me need not work for others. What works for X need not work for Y. And that understanding, we all need to develop our own system, our own method. So I would say I never got into the area of, say, diabetes or those horrible things, but I could have reached that. I could have, if things were mismanaged. It's very simple. One can understand that if your HbA1c is borderline, if it's reaching 5.8, 5.9, it doesn't take much for it to become 6.2. And how important it is to bring down to 5.2 or still lower. And that is doable. So I have reached the stage of 5.8, not 6.2. And I've made from 5.8 to 5.2. I've not been able to bring it down, but 5.2 is what I have managed. With my lifestyle, I'm managing that. And I know I've been told not by one person, but by all people that your cortisol levels are too high. So you need to rest and you need to calm down. And I say, look, my kind of business, I just can't be calm. I can't allow my other Agni to go down so much that everybody else takes over, because there are enough reasons to keep it going. So, but the ideal most form, I know it'll come down like this only if I had rested more. So I understand that. But each one needs to understand their own physiology, their own mental strengths, and their own requirements, food requirements. In terms of food, I must say I have come to a conclusion in life that you really don't need a lot. Seriously, I've overeaten all my life. But my conclusion and decision in life is you really don't need a lot. It's all overrated. Food is overrated. Why? Because if you understand your sugar levels and you understand cravings and you understand timings, can I just show off a little? I live on 1 meal a day. It doesn't work for everyone, but it works for me. And why I'm saying this realization happens very late in life. It happened very late with me. I was 50 plus when this realization came in. But I feel if I had ordered my life earlier, in my 30s, in my 40s, when things were going wrong, I would be probably in perfect health, because that time I wasn't overweight, that time I was fine. All the overweight issues started in my 50s. So if I had balanced it earlier, the stage wouldn't have reached. And now to shed down is an impossibility. It just doesn't happen. So I keep looking at Ishi all the time. And I keep saying, yeah, I'm fine. I work a lot. I'm balancing. I'm doing okay. But my weight doesn't go. What do I do? She says, let it be. It's okay. You're doing fine. But those are the challenges. So I suggest all my young friends to learn a lesson from my mistakes. That earlier you learn to decipher your body types. Earlier you learn to decipher the kind of food which suits you, the kind of gut microbiome we need, the kind of energy levels we ought to have for doing the work that your profession or work requires, or the family, or the food types that are regulated. Or easier your life will be, and longer you will be able to work and sustain yourself. Coming to the food types, 1 meal a day is what I have discussed. But in addition to that, I must also say I'm off wheat and I'm off corn. Why? Because something happened and one realized a patch on the body came, and we tried to figure out why this patch and allergy tests and this and that. It turned out that it can happen at any age. You don't need to be born with it, but a long misuse of your body, it can just come up at any point in time. It need not be of the order of a celiac disorder, but it can happen like a rash, like stubborn metabolism. It can be in any form. And the reason I'm going to discuss the scientific reason, all the food that we have been eating all these years, especially the wheat, because I don't think we are corn eaters. We eat sarson ka saag, makki ki roti only once or twice in a year, like in 1 or 2 months in a year. So which is not the cause as much, because we are eating it less. But the wheat which we are eating, and everybody tells you that rice has a higher glycemic index, so it's bad for you, whereas wheat has higher fiber and it is good, so start eating wheat. I don't want to name, but one American, very senior guy, was having a dinner at one place, and it was an official function. This guy came and sat next to me, and I had ordered, like, the hotel knew my food preferences. So I said, gluten-free meal. So they all said, yeah, ma'am, we know it. This guy said, same as ma'am, same as her thali, I want the same food. So I looked at him and he said, you're also gluten-free? I said, yes. He said, I have celiac disorder. I said, no, I don't have that, but I just, as a preference, I don't eat. Look what we did. The guys who gave us Green Revolution, we gave them Nobel Prize. But this is the cost we pay. And now I'm coming to the scientific reason. Indians used to eat, and the ancient most food for us has been what the Prime Minister calls Shriyan, the millets. All the Indus Valley civilization, the granaries which we read in the schools in class 6th or 5th onwards, the granaries were full of millets, not wheat, not rice. Though rice is also an ancient meal, but it was mainly millets. Because millets grew of their own. They did not require cultivation and agriculture and things. Of course, with population growth, cultivation had to happen. And these millets is what humans learned to eat. So the microbiome, the genome, our genome, is used to their genome. And the genetic is not anti each other. So we digest the food better, it's long lasting and sustainable. So in favor of Shriyan, I'll say 3-4 things. One, it requires less water. So it's a sustainable agriculture. Second, it's low on glycemic index. So your sugar levels don't just fluctuate high and low, and so you're full for long. So if you've eaten 4 rotis of millet, probably you won't eat till 24 hours. Third, genetic mutations have not happened. So the ancient food form is what we continue to eat. Whereas in case of wheat during Green Revolution, this is the food what we used to eat before we were imperialistically taken over. So all the food habits also changed. The refined maida and bread and white bread and all became fashionable. This is not what Indians ate, by the way. This is part of impact of imperialism on our food habits and the kind of work, especially Calcutta and other places, the bakeries, the work which you did in the morning and there was nobody cooking. So all the white bread is an addition to what we used to eat earlier. On the scientific part, the wheat what our ancient ancestors ate was still better because that had 12 chromosomes. The wheat we are eating today has 24 chromosomes. So I call it COVID. You've genetically mutated, you brought a new thing, which you call wheat, but it is not wheat really, because any genetic mutation is a new being, it's a new organism. What happened during COVID? Some bit of tuberculosis DNA, some bit of some other DNA. So when you mix the DNAs, you get a new organism. Precisely what happened. So you were eating wheat with 12 chromosomes, which is now 24 chromosomes. Fusion of nuclei or whatever else. So it's scientifically a new thing. Looks like wheat has higher yield, but I don't know what to call it, because it's like mixing 2 humans. Your genetic makeup will be double than what it is. So nuclei fusion probably, or sorghum with something else. I don't know what happened, but genetically it's a different food than the ancient wheat which our ancestors ate. So that's the scientific part of it. Without dwelling deep into it, or without getting into those nuances. I would say when PM's call for Shri Anna came, for me it was like I said, I was so thrilled. I said, look, somebody's talking. Somebody's making sense and is kind of turning it into a people's movement, Jan Bhagidari as he calls it, that normal people, common people on the street has to understand. And while our tribal brothers and sisters did not understand the so-called science of it, but that's what they were eating. Kodu, then kuttu, and ragi, and I mean, pearl millets, bajra, so many different types of millets is what was eaten and is being eaten. And those people are very, very fit and very healthy. So in terms of nutritional density, that's a better food to eat. Nutritional density is higher. It has greater sustainable effort because it's consuming less water and is resilient to climate change. The life cycle of millet, when the sowing of the seed to complete harvest and cultivation, is done only in 2.5 months, as compared to wheat, which takes 4 months. So almost half lifetime, and you get the whole crop. So International Year of the Millet came out of this thought, and it was persisted with, and is making, in terms of food security also, it works well for everyone, except people need to maybe change the palate a little. Just a little practice will do wonders. I just feel many a times people are addicted to the sugars in other cereals. So when you start eating the sugar which is going into your gut and your tongue, it savors that without one understanding that it's the sugar which we enjoy. But if we go to the nutritional part, millets are far, far, far superior as compared to any other cereal or grain. I'm sorry to sort of keep coming back to myself because that's my learning. If I have bored you, my apologies. But I thought best way to explain your own experience is something which one can sort of relate more, that look, it has worked for me. I'm not saying it'll work for you, but maybe some bit of experimenting will help. So not to say the medicines, the herbs, the food types, lifestyles do not have impact. All that is also needed in case of any kind of medical condition which one may have developed. I'm speaking just from personal experience with I wouldn't say there's no science behind it, but the science does not come from me, it comes from reading others. And by reading others is what I have tried to explain. I wish everyone a very good health. And in India, we have, and I often say it, I say, which country in the world can claim that the religion has science as part of it? So, Atharved's one Samhita is Charak Samhita. So, no religion in the world will have a scientific book which describes the plants, their roots, their shoots, their taxonomy and their usages as part of your religion. But Atharved is that religion. Atharved is one Ved which has science as part of its existence. And thus all that was done by our ancestors, the rishis and all, was basically science. It's just that we lost track of ourselves as a civilizational body, and thus everything Indian became useless and became voodoo for others who had to rule over us. And they became the more dominant voice, and because that became the dominant voice, the pride in our own heritage and culture went away, and we went on a different track and considered everything coming from the other places superior to what our own science had to teach. I think the modern science is now working towards establishing scientific principles, researching on gut health, researching on how gut is the second brain, how energy systems or energy channels within the body operate, how different types of Agni, what we call Agni, how they are, metabolism is what the new word is for new, because when I say our science, I'm talking of 5,000 plus years. So 200, 300, 400 years is new comparatively for us. So from our perspective, these are new concepts. But working on ancient concepts and making life still better for all of us, giving us deeper understanding of the scientific principles is what will help. I mean, one example which comes from reading about a description of Krishna Deva Raya. So Krishna Deva Raya was the king in Hampi and probably one of the greatest kingdom in southern India and last one to exist after Chola dynasty, Krishna Deva Raya. So I was reading somewhere about Krishna Deva Raya. And they said, and the descriptions by in Veda, they say he drinks, I don't know how many, I don't know the measure, but almost a bottle of sesame oil, and then exercises physically in the morning. And that's what makes him strong. So I tried to analyze that. I said, so basically this guy is making his body undergo ketosis without knowing that's what he's doing, and also detoxifying his system. And a whole lot of people will say, oh, if you drink or eat oil or desi ghee for that matter, your cholesterol is going to go up. But the science is the opposite. I think let the doctors do that conversation. I will not do that conversation. I don't want people to get sick, and explain it scientifically and talk better with scientific evidence, and also how the body metabolism, sugar versus fat, etc., operate. But I leave it to the doctors to do that conversation. I'll only do the social bit of it. But with these words, may everyone get good health. May we all work towards good health so that we can work longer and last longer to do the good things, and keep our brains in order, because good health takes us away from various negative things, greed, and because eating impacts this thinking as well, and it's what you eat is what you think as well. So eat well so that we are able to think well, work well, and help India become a developed nation by 2047, and away from this mindset of slavery. All that is possible only if we know exactly how our society operated in the past and what all changes we need to make it work better. Thank you very much. Jai Hind.
Thank you, ma'am. Thank you so much for that dive into religion, science, diet, dietary habits, good health habits. If eating one meal can give us skin like that, I think all the women here are game. Anyways, to move on, ma'am, we'd now like to invite you to light the lamp. I'll just get everybody on stage and then we could do that. May I please invite Dr. Naveen Dang, Dr. Tom O'Brien, Ms. Ishi Khosla, Dr. C.S. Pandav, and Dr. S.K. Sareen, Dr. Ajay Bhalla. Dr. Khadar Wali and Dr. Raj Bhandari. Dr. Kochar, may we please get you up on stage for the lamp lighting? Dr. Reddy is already here, right? Yes. Ishi, may I request you to take ma'am up to the lamp, please? Dr. Gopalan, you're not up on stage. I called out your name. Please come up. I called out your name. Dr. Dang, please take Dr. Ryan and Tom, please go ahead. Please, all of you.
Shubham karoti kalyanam arogyam dhana samprada shatru buddhi vinashaya deepajyoti namostute. Samprada Shatru Buddhi Vinashaya Deepajyoti Namostute. Shubham karoti kalyanam arogyam dhana samprada Shatru Buddhi Vinashaya Deepajyoti Namostute. Karoti kalyanam arogyam dhana samprada shatru buddhi vinashaya deepajyoti namostute. Shubham karoti kalyanam arogyam dhana samprada shatru buddhi vinashaya deepajyoti namostute.
Thank you so much, ma'am. I'd request all of you to stay on stage, please. I would now invite Dr. C.S. Pandav to preside over the launch of the book. Dr. Pandav is a public health expert and a member of the National Council for India Nutritional Challenges. He has served as a consultant to WHO and UNICEF on iodine deficiency disorders for more than 60 countries since the 1980s. He was conferred the prestigious Padma Shri Award in 2021 for his exceptional and distinguished service in the field of medicine. Dr. Pandav will be presiding over the launch of the book. I would also like to invite Dr. Deepti Naryani, Mr. Jagdish Saini, and Mr. Neeraj Arora. Dr. Deepti from Agilus, Mr. Jagdish Saini from Morpen, and Neeraj Arora from First Medical Diagnostics to come up on stage for the launch of the book. Shall we go? Yes, please. Let's have everyone with the book in their hands. So please come forward. Sorry, we're being a tight fit today. Could we move up a bit? Yeah. And here is a photograph we are all looking forward to, with that book in hand. Many, many congratulations, Ishi, once again. Nobody, I mean, you wouldn't have hoped for such a fantastic photo shoot with the book again. Thank you so much, everyone. Ma'am, thank you so much for your time again. Thank you again, ma'am. Dr. Reddy, thank you for your patience. I know we interrupted your session. So to get things back on track, Dr. Reddy is already here with me, but his full name is Dr. K. Srinath Reddy. He's a Padma Bhushan, and he's an honorary distinguished professor at the Public Health Foundation of India. He has previously served as the HOD of Cardiology at All India Medical, and he is currently serving as an advisor on health to multiple state governments. Most recently, Dr. Reddy was a part of the Government of India Technical Task Force on COVID-19. Over to you, Dr. Reddy, for your keynotes, please.
Maybe we should let the minister is still here. She's leaving, I think, as a matter of courtesy. We should wait for her. She's still.
Ishi ma'am, sorry, because of lack of time we couldn't do that, but we have a little memento for ma'am Meenakshi and the people on stage. Ma'am, it's a little bag of goodies, you might enjoy it. All right. Okay, thank you so much, ma'am. And to the speakers as well who were on stage, my sincere apologies. But due to lack of time, we had to skip that part. We'll be handing this over to you now. Dr. Dang, could I please request you? You'll have to do this down because we're really running on time. Yeah, sure. Could you please hand over the memento to Ma'am Meenakshi Lekhi, to Sukumar? No, can't do it on stage. No, it has to be here. You have the list, Arjun. Can you get it done, please? Dr. Gopalan, you also have to give it. Yeah. Dr. Reddy, are we ready? No, they are. Okay, let it be done. All right. Thank you so much. Guys, can we have the mementos, please? Acha. Then Dr. Dang to Sukumarji, Sukumar Ranganathan. He's right there, right at the end. Sirs, we'll do after his speech. Ishi, could you give the memento to Dr. Sibbal, please? Guys, can you go up, please, with the mementos? Dr. Anupam Sibal. Ishi for Anupam Sibal, please. Dr. Sibal, now we are asking you to do the duty for us. Dr. Sibal, if you could please hand over a memento to Dr. Tom O'Brien. And Dr. Harsh Mahajan. Swarnik, could we have a memento to Dr. Dr. Anupam Sibal? Couldn't know, time's running so late. It's Dr. Reddy's kindness. He's saying, no, do it. Otherwise, I was just going to say informally, you do it and then we move forward. We have to break for tea, Sarah. No, Dr. Mahajan? He's not here.
He's not here.
And Tom O'Brien? I think they've just stepped out of the hall. I need to get started on Dr. Reddy's session. We come back to the rest of the felicitations after this. Yeah? Please, sir.
Dignitaries and luminaries gracing the occasion, and dear friends. Since morning, we have had a remarkable coverage of the importance of the microbiome, its relation to human health, the importance of diet, with millets as an important component. We have had in the preceding session the connectivity between science and society clearly explained, but also with an element of spirituality. And we have had personal experiences and policy narratives detailed. Let me start by touching upon what Mr. Ranganathan said, that we must be guided by science. To me, the greatest scientist that we have ever known is nature. It is nature which has experimented with myriads of life forms as well as inorganic forms, and found out through those experiments, refined in the crucible of evolution, what best suits the human body. Yet, we have violated some of the harmony created by nature by our own habits and have flouted that ecological balance which has established that harmony across all life forms on Earth. But the microbiome brings us a very timely reminder of that continuum that has existed since life first appeared. We recognize that that continuity exists from soil health to plant health to animal health to human health. Indeed, it is not just the inorganic components of the soil that matter, while they do, and we know that the nature of nutrition that we get from plants is quite dependent on the nature of the chemical composition of the soil and it varies from place to place, and therefore the microbiome also will, and so will the plant nutrients. But the remarkable balance that's created by nature is also seen by the fact that the plant roots depend upon a number of fungal connections in the soil, the mycorrhizae, which provide it supplementary water and nutrition, which the roots themselves then cannot harness. So we see this thread of life going in since evolution from the soil to the plants, to the animals, and to human health, and the microbiome is an important and integral part of that. Yet we have ignored that, and we have violated that harmony in so many other ways. We know from all the science that has been detailed since morning that in terms of human growth and survival, the microbiome is an important intermediary and enabler. It actually ensures our access to nutrition, it fights infections, it provides immunity, and it has been called by Catherine Nagler as the gut peacemakers. They make the microbes that reside in our gut are the peacemakers for the body by preventing inflammation and insult from a variety of diseases. But the question arises is, by changing our dietary habits in a very drastic manner, by pumping it with ultra-processed foods and sugar-sweetened beverages and a variety of other types of harmful foods, are we drugging or poisoning our own security guards? But one of the biggest lessons for me from the microbiome is a lesson in humility. Because if the microbiome in our large intestine constitutes 10 times more than our own cells and 100 times more than our genes, then we are a minority shareholder in our own body, even though the nameplate is ours. So it is that lesson in humility that we must learn. Therefore, the microbes actually preceded us and co-evolved with us, and while we might consider the human being to be the pinnacle of evolution and the acme of civilization, it is a lesson in humility that we are tremendously dependent on all other life forms, especially the microbes that reside in our gut. And that's the lesson that we learn from our nutrition and health. Indeed, in July 2021, Japanese researchers found that persons who lived beyond 100 years, and Japan has many of those centenarians, they had larger number of types of gut bacteria that produce chemicals which can fight serious infections, and these are secondary bile acids, and these can keep dangerous bacteria like Clostridium difficile and vancomycin-resistant Enterococcus from growing or replicating. Now, clearly, if for the elderly, to become elderly up to 100 years, they have survived several insults and several challenges, especially serious infections, but it is the microbiome and the chemicals produced by the microbiome that have been very protective indeed, and that's a lesson that we must learn for our own longevity. But we also know that even during COVID-19, there are studies that suggest that the microbiome was seriously disturbed by the COVID, not only by the antibiotics that were erroneously given, but by the virus itself. So we know that there is a tremendous amount of relationship between the microbiome and our ability to combat or succumb to infections. We also know that metabolites from the mother's microbiome travel to the fetal brain, that we know that breast milk is an absolute important element of ensuring not only transfer of immunity, but the close contact with the mother, as well as the passage to the mother's genital tract during the process of childbirth, gifts the child immunity through the microbiome. And yet, we go for milk substitutes in preference to breast milk, which is a travesty. Low diversity of the gut microbiome of infants is now related to connections between different brain structures, and especially the brain structures and the amygdala, which is the emotion center of the brain. And you've already heard about the number of neuropsychiatric problems that can result from a disturbed microbiome. Depression, autism, Alzheimer's, dementia, Parkinson's, schizophrenia. Now, the gut microbiome metabolites, which can actually irritate and transmit through the vagus nerve, which is widely distributed, and the cranial nerve, the vagus, carries them back, the signals, back to the brain. So the brain is indeed responsible for what we call the gut feeling. Now, clearly, inflammation is one of the most important underlying factors for a variety of diseases, whether they're cardiovascular, neurological, or allergy and autoimmunity, cancers. And if inflammation is the common cause, then we know that basically it is something that can be stoked by a disordered microbiome. And these diseases of maladapted modernity principally derived from deranged nutrition and the effect of that deranged nutrition on the microbiome. So from harmony, we proceed to harm. So gut immunity provides, also endothelial stability, gut-brain interactions, all of these are dependent upon the microbiome. And you also have a variety of gastrointestinal disorders, which you'll hear about in the subsequent sessions, irritable bowel disease, the celiac disease, antibiotic-induced colitis, esophagitis, and so on. And of course, cardiovascular diseases, diabetes, obesity. And now we have been talking about fecal transplantations and microbiota restorative therapy, but clearly it's a balanced diet, a diverse diet, which is going to be the most protective, because when we sit down to eat, it's not only what is good for our palate, but what is the taste of the microbiome? What is it that our bacteria, the microbiome, prefer to eat? We have to really take that into account, and perhaps in the future we'll learn what kind of a microbiome each one of us has and what kind of food the microbiome eats, because the fiber that we cannot digest is digested by the microbiome and is converted into other nutrients, like, for example, vitamin B complex and so on. So we know that. But let me conclude by saying that one of the important things is not merely to generate science, which we have done in abundance, but to ensure that science translates into guidelines for clinical practice, but more importantly into public knowledge and public health policy. And that is where I believe meetings such as these must actually advance further into ensuring that popular beliefs are conditioned by the wealth of science that is being produced by way of popular dissemination of knowledge and guidelines. But we have an eminent policymaker sitting here, and therefore I would like to say that policy is basically dependent upon, enlightened policy is dependent upon scientific credibility, financial feasibility, operational steerability, and political viability. And for that, we require multidisciplinary research. While we must have nutritionists, we must also have economists to find out whether a particular agricultural crop can be produced in sufficient amount to make it affordable to people. We also must have social scientists to understand cultural beliefs and culturally adapt whatever messages that we are giving, and political viability to see who is likely to be actually supporting this and who is likely to be opposing this in the public domain, particularly when there are industry interests involved. And therefore, the work of this particular symposium does not stop here. It has to proceed very much into public policy and public dissemination of messages, and that is where we need to build coalitions, and I'm sure the start of that particular campaign has begun today. Thank you very much.
Thank you so much, Dr. Reddy. My apologies once again for the delay in inviting you to share your thoughts. I'd now like to invite Dr. Naveen Dang to give a token of our affection to Dr. Reddy And Dr. Sibal, Dr. Pandav is still here. We couldn't felicitate him because he was here. If you could please do that for us. Dr. Serene, may I invite you to the stage because you're up next. Dr. Sibal, please. This is for Dr. Reddy. Yes. Dr. Sibal, if you could also give a token to Dr. Serene for us, please. Thank you so much, Dr. Sibal, for doing that duty. And Dr. Dang, may I invite you to introduce Dr. Serene to the audience, please? So it'll be great if you keep sitting here, if you don't mind.
I'm quite sure Dr. Serene needs no introduction. A friend of nearly last 50 years, whom I had the privilege of meeting when he was doing his DM in AIMS. A man whom I call a fire of energy, an energy wall, and beyond that, a knowledge beyond compare. A leader, a teacher, also a student to the last day, because he still reads a lot, like what my favorite line is, a doctor is a doctor as long as he's a student, and Dr. Serene always fulfills that. Rest of everything you know about Dr. Serene, but just for the sake of saying it, I'll say Dr. Serene is a gastroenterologist, hepatologist, translational scientist, researcher, and teacher. He has set up this Institute of Liver and Biliary Sciences. He is the recipient of the Shanti Swarup Bhatnagar Prize and the Padma Bhushan. He served as chairman on the Board of Governors of Medical Council of India. He was the president of the Asian Pacific Society for the Study of the Liver and founder of Asian Pacific School of Hepatology. And before I end, I can say this, that even till this day, when he was coming out here, he remembered something, and he went back to look at the patient. He is a doctor first, a doctor last, a compassionate human being, and of course, a fantastic human being. And that's what matters. Thank you, sir.
Do I load my slides here? I have my slides.
I didn't realize. Dr. Dang.
Thank you, Dr. Dang, and thank you, Ishi, for inviting me, for your kind words, and also to have the pleasure of coming together. इसमें कितने सारे लोग पेशेंट्स हैं? आप प्लीज़ हाथ उठाएं. So celiac patients or their relatives, please हाथ उठाएं. Okay, all right. So I will try and give you some thoughts while the slides are getting ready into two things. मुझे कहा गया कि आप obesity पे बोलें और फैटी लिवर पे बोलें. तो मैं जानता हूँ आप सबको पता है ओबेसिटी क्या होता है. एवरीवन नोज. आई एम नॉट गोइंग टू डील एक्सेप्ट वी गॉट इट द स्लाइड्स. So I bring greetings from the institute where I work. It is set up by the government of Delhi, and I have nothing to disclose except that our students are smarter than the teachers, and they place it at next to All India Institute Delhi. So this is what the latest map in Lancet is, and it tells you that Delhi, where we live, you can see in the center, Delhi is 50% visceral obesity, and I will tell you what is abdominal obesity. बहुत ज़रूरी है. हम लोग क्या करते हैं, we start with obesity first, कि आदमी मोटा है और उसके लिवर में फैट है और उसके कारण उसके कोलेस्ट्रॉल ज़्यादा है, फैटी है तो उसका डायबिटीज़ है, और फैट से आर्टरीज थिक हो गई तो ब्लड प्रेशर है और हार्ट डिजीज़ है. वी स्टार्ट फ्रॉम ओबेसिटी. लेट मी टेल यू डिफरेंटली, लिवर इज़ द कोर. कन्फ्लिक्ट नहीं है बिकॉज आई वर्क ऑन लिवर, बट दिस इज़ वॉट टुडेज साइंस इज़ एवरीवेयर. सबको पता है लिवर क्या करता है, पर दो चीज़ें शायद नहीं ध्यान देते होंगे कि आपका चेहरे का रंग, आपकी इम्यूनिटी, योर एबिलिटी कि आपने बाहर जाके समोसे खा लिए और फिर भी बीमार नहीं हुए. दैट इज़ द जॉब ऑफ लिवर. इट इज़ द टॉलेरोजेनिक ऑर्गन. इट टॉलरेट्स ऑल इंसल्ट्स. एंड नंबर 2, आपका ब्लड शुगर. हम सोचते हैं पैंक्रियास कंट्रोल करता है, बट दैट्स नॉट करेक्ट. इट इज़ द लिवर विच कंट्रोल्स योर शुगर एंड फैट. आई विल टेक यू थ्रू. सो इफ देयर इज एक्स्ट्रा फैट, देयर आर 2 parts. First, swelling in the liver, inflammation, and second, harm to other organs. Please remember, every part of it, it will change your life. Normal liver 5% से कम फैट होती है. अगर 10% से ज़्यादा हो जाए, either because of your calories or your genes, you get fatty liver. Now I heard Professor Shirina talking about gut microbiome. I am not discussing, but what you eat, you do not eat. It is your bacteria which eat and process. तो अगर आप कैलोरीज ज़्यादा होंगी तो बैक्टीरिया भी बिगड़ जाएंगे. Now this is important slide. Complicated नहीं है बिल्कुल. तो ये नॉर्मल लिवर है और ये फैटी लिवर है. वाइटिश, थोड़ा सा बड़ा. दिस इज़ योर फैटी लिवर, मोर देन 10% फैट. अगर हम इस लिवर का सेक्शन काटें, बायोप्सी करें, then you will see all these white cells. So this white is not supposed to be the liver. White means every cell of the liver has fat. अगर वो फैट होगी तो बॉडी कहेगी दिस इज नॉट ए नॉर्मल सेल. दे विल सेंड देयर lymphocytes टू किल इट. दैट इज हेपेटाइटिस, फैट इंड्यूस्ड हेपेटाइटिस. सेल मरेंगे तो आपका ब्लड में SGPT बढ़ जाएगा, ALT या SGPT. फिर हीलिंग होगी क्योंकि इंजरी हुई है, उससे स्कार बन जाएगा. दैट इज फाइब्रोसिस एंड इट कैन प्रोग्रेस, can cause cirrhosis and liver cancer, and some people may need transplant. Diabetes is a liver disease. Let me show you and you remember it for remaining period. जब liver में ये fat है, all these cells which are white here you see, insulin cannot get into that cell क्योंकि cell में fat है, insulin आएगी नहीं. Once the insulin does not come, more insulin is produced. More insulin is produced by pancreas, and your pancreas gets exhausted and you get diabetes. It's not as simple, but in very broad basis, insulin resistance starts from liver and of course on the muscles. Now in India, diabetes is the commonest cause of liver cancer. It may be shocking to many of my friends. 40% of liver cancer today in India is in diabetics. This was published last year by us. Now is very important part. ये बड़ी interesting story है और ध्यान से सुनिएगा. You have high cholesterol. आपने टेस्ट कराया, कोलेस्ट्रॉल 250 है, ट्राइग्लिसराइड 300 है. आपने एक दवाई खाई, डॉक्टर रेड्डी ने प्रिस्क्राइब करी, हर्ष ने टेस्ट कर दिया. But not asking from where has this fat come? Where has this triglyceride come? So once the liver fat is full, it will spill into the blood. So remember, cholesterol or triglyceride high in the blood are part of fatty liver. And then this fat goes and deposits on your arteries. Arteries hard ho gayi, you get blood pressure, heart disease. You may also get cancers because of the inflammation, stroke. All non-communicable diseases are a result of starting from fat in the liver. And this is the basis of changing, and I'll come back how life is changing today. और इसको रीड आउट कैसे करेंगे? सिंपल ब्लड टेस्ट है, ALT, SGPT. अगर ये हाई है, एक 20 रुपए का, and then you say, well, and Dr. Dang would be more than happy to do it for all of you free of cost. Am I right? All right. Now part 2, obesity. As I said, excess calories, our lifestyle following the West, sedentary environment and genes. And all this is part of obesity. Insulin resistance, high lipids, blood pressure, diabetes. आप खर्राटे ले रहे हैं रात को, वाइफ दूसरे कमरे में सो रही है, बड़ी प्रॉब्लम. All this is part of your obesity, but core is liver. But every fat person is not bad. This is Mona Lisa from the eyes of Fernandez. Still looks beautiful to him. Now this is a very important slide. I want each one of you to understand. Now there is a guy who is obese. This guy has more visceral fat, abdominal fat, than the subcutaneous fat. He is metabolically unhealthy. He is obese. His muscle mass has gone down, so he has sarcopenia and he has insulin resistance. If you understand this, he is a bad obese guy. But there can be a good obese guy like Mona Lisa, whose visceral fat, abdominal fat is less than this subcutaneous fat. His muscles are okay. He is not insulin resistant. Put it simply, हर हलवाई के fatty liver नहीं होगा. But the second part is more important. Here you have a normal weight person. BMI 23 से कम है उसका. But he is unhealthy because he has more visceral fat than subcutaneous fat. Let me explain this to you. So this is a study where you see both these people have BMI of 22, दोनों का. एक healthy है, एक lean fatty liver. Now ये healthy वाले में आप देखेंगे red color is muscles, ये सारी muscle है. Green is subcutaneous fat और blue is visceral, बहुत कम abdominal fat. But the other guy has everything is blue. Now this guy, the visceral adipose tissue is 5 times more than the normal guy. So he is lean, but he is metabolically unhealthy. भाई पता कैसे लगाएं? This very simple body composition analysis, very easy to do. Now here is a guy who has a BMI of 26. He looks all right. But if you calculate, I am not going into details, he has about 16 kilograms of extra fat and his muscles are 5 kilograms less. 1 minute, it is impedance, and by this you can find. And his abdominal part has 136, is almost like 36% more abdominal fat. His muscles are less and his total fat is more. And of course, you have to do waist and hip ratio. Why I am telling you this today? In India, liver cancer I told you, but these are normal weight people, and in India, liver cancer and metabolic dysfunction related liver disease, in India, normal lean weight mein, India is 30% or more. So 30% of Indians may have metabolic dysfunction, liver cancers and other problems, although they are lean. तो बड़ा मुश्किल काम है, समझना पड़ेगा, अपने आप को समझाना पड़ेगा. So I'll now go on to the terms NAFLD, MAFLD, non-alcoholic, शराब नहीं पीता फिर भी लिवर गड़बड़, मेटाबॉलिक डिसफंक्शन है या MASLD है. What is there in a name? This is not important. I was given to speak on this, but I am not going to spend time on this. The current terminology is metabolic dysfunction, associated fatty liver, or steatotic, which is also fatty. कई लोग है ना कहते हैं यार फैटी मत बोलो, बड़ा इंसल्टिंग है. तो अमेरिकन्स ने कहा अच्छा भाई चलो नाम बदल के स्टीएटोटिक कर दो, हैं दोनों फैटी. अब क्या हुआ इसमें, ये टर्मिनोलॉजी पहले नॉन अल्कोहलिक थी, वर्ड अल्कोहल आते ही लोगों के कान खड़े हो जाते थे वो. तो अब नॉन अल्कोहलिक से मेटाबॉलिक डिसफंक्शन एसोसिएटेड फैटी लिवर बना. एंड so don't worry about it, fatty liver is fatty liver, let's go. But how do you suspect fatty liver? ये एकदम क्रक्स है, आप एकदम याद कर लेंगे, कभी नहीं भूलेंगे. Anybody who has diabetes 80% है फैटी लिवर. तो मुझे किसको टेस्ट करना है? हर डायबिटिक के. दूसरा जिसका वेट ज़्यादा हो, ओबीज हो या अबाउट 23 हो. और तीसरा जो सबसे इम्पॉर्टेंट है, मैंने कहा लीन पर्सन जिसका बीएमआई 23 से कम है. अब नाउ इंडिया इज गोइंग टू हैव न्यू बीएमआई एंड डॉक्टर रेड्डी विल करेक्ट मी, इज 19.7 बीएमआई एंड इशी फुलफिल्स दैट. सो नाउ अगर वेस्ट ज़्यादा है, बीपी हो गया है, टीजी हाई है, एचडीएल कम है, A1C हाई या फैमिली हिस्ट्री. सो नाउ whom to suspect fatty liver? All of you can diagnose? जनरल पब्लिक से हैं, हाथ उठा के बताओ. एवरीबडी कैन डायग्नोज फैटी लिवर? नहीं नहीं, अभी हाथ नहीं उठे हैं. ओके, ऑल राइट. सो नाउ हाउ डू यू, सॉरी इट डजंट शो यू. ऑल राइट, डजंट मैटर. व्हाट हैपेंड टू दिस स्लाइड्स? So this is the nomenclature the Americans gave. I will just jump onto this. Something has gone wrong. Okay. Is my liver healthy or on fire and inflamed? Now you can see this guy, जरा रो रहा है, लिवर भी रो रहा है, तो पिचक गया. और ये आदमी पतला है तो लिवर हेल्दी है इसका. तो हाउ डू आई डू द टेस्ट? सो फैमिली हिस्ट्री, जीन्स कहाँ से आते हैं? फैमिली. और सेल्फ, तो ओबेसिटी है, डायबिटीज़, बीपी, हार्ट, किडनी और लिवर, cancers, polycystic ovary. So these are walking genes. Walking gene theory is you get inheritance. So अगर है तो fatty liver है. Second is your height and weight. Please remember, height minus 100. अगर 170 height है तो weight 70 होना चाहिए. पर अगर फैमिली में किसी और को ये सब था तो हाइट में से 105 निकाल लें. तो मेरा वेट कितना होना चाहिए? टेल मी. 170 हाइट पे वेट कितना? 65. और गड़बड़ है, अगर आप लेडी हुए तो क्या होगा? 5 और घट जाएगा. सॉरी अबाउट, समटाइम्स फीमेल्स आर एट डिसएडवांटेज. सो 170 सेंटीमीटर लेडी with a family history should weigh 60 kg. How do you test? Simple, ultrasound or a fibroscan or a blood test. Dr. Dang will do for everybody free of cost. ALT, high lipids and sugars. Is that right? All right, done. आज कल ही करा लेना आप. Fibroscan is a low frequency ultrasound. It sends the sound waves, but it gives you important reading. Fibroscan is a sound wave which hits either a hard surface or a soft surface. So normal time for sound to come back is 60 milliseconds. पर ये तो 40 मिलीसेकंड में आ रही है. मिलीसेकंड यहाँ लिखा है. तो it means the surface is hard. It means this liver is scarred. So anything above 8 is grade 2 fibrosis. भाई मोटापा है या पतले हैं पर फाइब्रोसिस ग्रेड 2. अगर लिवर में फाइब्रोसिस है, हार्ट में भी है, किडनी में भी है, लंग में भी है. दिस इज स्पेक्यूलेटेड. वेरी इजी. Number 2, and Dr. Harsh does it with another technique. Without using the fibroscan, they use a ultrasound based technique which is also equally or maybe even better. And this is about fat.
कंट्रोल्ड अटेन्यूएशन पैरामीटर, साउंड गई पर वापस नहीं आ रही है. It tells you about fat. Now it should be 220, it is 250, 10% fat. 250 to 290, about 30%. Above 290, your liver has 40% or more fat. 100 ग्राम में से 60 liver, 40 fat. Not a good idea. You can't donate your liver. So, how should we process? Everybody doesn't have. आप लोग simple blood test कराएंगे और ब्लड टेस्ट में एक टेस्ट होता है FIB4. FIB4 क्या होता है? आपकी एज, डॉक्टर डैंग की रिपोर्ट में आएगा AST, प्लेटलेट और ALT. सिंपल कैलकुलेशन, आपने वेब पे गए इंटरनेट पे और पता लग गया. अगर FIB4 मेरा 1.3 है, सिंपल कैलकुलेशन, मेरे लिवर में कुछ फाइब्रोसिस हो सकती. लेस देन 1.3 आई एम हैप्पी. After 2 years only I will visit a doctor if advised. But अगर मेरा FIB4 फाइब्रोसिस स्कोर के 4 पैरामीटर्स गड़बड़ हैं, फिर मैं फाइब्रोस्कैन कराऊंगा. एंड फाइब्रोस्कैन अगर मेरा 8 से ऊपर है तो स्टेज 2 फाइब्रोसिस हो सकता है. फिर मुझे डॉक्टर के पास जाना पड़ेगा. अब करें क्या हम लोग? डू हैव 5 minutes or so more or it's over? I am running late. Yes, 5 minutes. So first is अपनी अप्रोच बदलनी पड़ेगी. अच्छा, सामने सपोज आग लग जाए तो आप क्या करोगे? भागोगे. तो सिमिलरली थिंक फैट इन लिवर इज एन अलार्म. अगर वेट कम करें, दिस गाय हैड 13% फैट, 600 कैलोरी विच she will prescribe, and in 4 weeks time liver fat has gone down. And पर होता क्या है? दिस इज जस्ट टू टेल यू दिस कंप्लायंस इज ओनली सीन इन 10%. 90% लोग बदल जाते हैं क्लिनिक छोड़ते ही, वेट नहीं भूल जाते हैं. बट दिस इज इंपॉर्टेंट स्लाइड. आई टोल्ड यू लिवर फैट, नाउ इट इज द मसल फैट. सपोज यू टेक शुगर, दिस ग्लूकोज गोज इनटू 2 places. One, it goes into your liver, utilized, extra is stored, and it goes to muscle which is sensitive and utilizes for your work. But suppose you are inactive, पड़े हुए couch potato, so your muscles are not working, they are insulin resistant, so all the sugar will now go to liver, which has too much of sugar, it converts it into fat. That is the genesis. But more important is, if you exercise for 30 plus minutes in a day, your muscle which is resistant can become sensitive. कितना आसान तरीका है, करना मुश्किल है एक्सरसाइज, बट आपको फैटी लिवर से बचा देगा. What to eat, they all will tell you, not my job, but just to tell you, plant-based diet, and if you use all these plus coffee, walnut is very good, and millets, Raj is here who will tell about it. Millets are extremely helpful. How you keep your gut bacteria unhappy and you happy, this is the way. Bacteria may not be happy. So be a true Jain or a Jew. Now, this is an interesting slide published in one of our best journals. So timing of food as a risk factor. अगर आपने रात को खाया, देर से डिनर लिया, all that will lead you to fatty liver. But this is what the world is. It is not intermittent fasting. This is called time restricted eating. Suppose आपने सुबह खाया, दिन में खाया, रात को खाया, आपकी बॉडी की रिदम से ये खाने की रिदम मैच नहीं करती. Metabolic rhythm and your body rhythm, they don't match. But if you eat from, let's say, 6 in the evening to next 6 in the morning, you are not eating and you are eating in the daytime, your time restricted eating will help you. Just remember, be natural, dincharya. I will not go into details of managing fatty liver, but just to say they have differences. Even if you are lean, lose 3%. If you are obese, 10%, and you can have coffee. And of course, never use stairs when you are going to a building.
always climb. Lift is for patients, stairs for healthy people. All these policies were included by Government of India in 2021, and fortunately fatty liver is now included into the national program. I will end up, because there was a book release, I just thought I'll tell you, you might get some of these ideas. My first maiden attempt, it might be released in February 24. With this, no conflict of interest. Thank you.
Thank you, sir, for those very interesting and insightful remarks. I think most of us now are going to try and diagnose ourselves and our families. I know that wasn't the message, but we've understood very, very well. And thank you so much for that. Throughout med school and then later, I've had the privilege of learning the same thing through books and teachers. But right now I was sitting here and it was actually as entertaining as any other movie or TV show I have seen. Thank you so much. A big round of applause for sir. So I have some bad news. You know, I told you about that friend. Thank you. So I told you about that friend who's not our friend today, and that's time. We are way behind schedule. My superiors have told me that we have cancelled tea for today. And I'm sorry, that's the only option that we have. Pooja, I told you this will happen. Yes. So so what we'll do is that we will carry on, but we'll have a quicker lunch, and there are just a couple of more sessions before that. So with this, I'd like to call Dr. Tom O'Brien on stage. I think all of us already know Dr. Tom O'Brien quite well, but I would like to have him here to set the context for the upcoming sessions with his insights and experiences. Tom, we are delighted to have you back with us this year and cannot wait to hear what you have learned in the course of the pandemic when the gut became the focus of discussions on immunity. We've been in touch. I am an avid follower on the social media platforms as well, but I think the people here really need to understand from you about more about the topic and learn more as well. Maybe we can start in a couple of minutes. Okay. Thanks.
All right, fellas, let's move it along.
Please.
Okay. Good morning. Thank you all so much for being here. This is a game-changing event. Our job today is to stimulate you in ways that you will be thinking about for weeks and months to come in the future. A lot of gratitude to the Celiac Society of India for hosting this event, and for all of our speakers and all the preparation, the hours of preparation to be here today. This is my boss. I believe the only way we're going to change the world and the direction the world is going in is to raise a generation of children who think outside the box. They think very differently. Einstein is attributed to the quote, "If you always do what you've always done, you always get the same results." And the problems we've created today cannot be solved with the same level of thinking that created the problem. You have to think differently. And we as adults are not going to think differently. We're locked in the ways that we think. We'll expand a little bit, but we need children to think outside the box. This is my son, and he's my boss. I'm here to dedicate this talk to him and to all the children and the future children, to the young women who want to get pregnant so they learn how to prepare for a pregnancy before they get pregnant. And they learn how important it is to detox from the chemicals that have been absorbed in your bodies over the first 25 years of your life that affect babies' brain development. Just read the science. Why is it that autism's going through the roof? And in the US, I don't know about here, but in the US, so many children are on antidepressants and anti-anxiety pills. Their brains did not develop properly in utero. Just read the science. The higher mom is in phthalates in her urine during pregnancy, the lower the IQ of the children at 7 years old. Just read the science. We need to raise a new generation of children whose brains are functioning optimally. But to do that, moms have to learn to detox before they get pregnant. And it takes 6 months to a year. It's not a pill that you take for 2 weeks that detoxes you. You have to learn how to do this. And that's not in my talk today, so I better get going because I have to stay on time. Millet porridge. This conference today is dedicated to millet. It increases the level of good bacteria. It decreases the level of bad bacteria. And this premise, I think, is so important for all of us. Everything should be made as simple as possible, but not simpler. There are some basics we have to know. And what I'm going to talk about is how do we identify the primary development in chronic inflammatory diseases. And I'm going to ask that you consider this action step. When you hear something today that captures your interest, give yourself permission to just let it kind of develop in your consciousness, in your subconscious. Just see where it takes you, what ideas come up. In my career, for years and years, I see a study that would capture my interest. I would tape it on the ceiling of my bedroom, literally. The front page of the study. And when I go to sleep at night, I'm tucking in, I say, oh yeah, oh, right. And then during night, sometimes I'd half wake up and I'd have an idea. And I'd say, oh, I'll remember in the morning. I never remember. So I got a little device that's got a pen in there, and when you pull the pen out, a soft light comes onto the paper, and I would write down without having to wake up completely. And in the morning, I'd see, oh, that's right, yeah. And then I'd be driving down the road, and that thought that I recognized from last night develops. And I'm understanding a little bigger picture of whatever that topic was. We need to give ourselves permission to think outside the box. I think it's the only way you expand your horizons professionally. Consciously give yourself permission and set yourself up. Tape the front page of a study onto the ceiling so that it reminds you. And then maybe you'll dive in. Maybe you'll explore that concept and really spend time on it. I just met a young woman in the hall. She's a nutritionist, and she loves and she's focusing on renal nutrition. And I said, so wonderful. It's wonderful that you've got a passion within the world of nutrition, because you read 3 or 4 studies over the course of a couple months. Now you are the expert compared to your colleagues in that topic because you've read the current studies. And they ask you for the advice as to what this is. And an example that fuels my personal passion in emphasizing the gut in my teachings. We all know there's 100 times more bacterial cells than human cells in the body. We all know that. My friend and mentor, Dr. Jeffrey Bland, told me last year, Tom, in 1 teaspoon of stool, there's more bacteria than all the stars in the known universe. And that's like, what? What? It's a cute little fact, but when you think about it, it's a what? What does that mean? We know intestinal bacteria produce short-chain fatty acids, vitamins, polyamines, secondary bile acids. The list goes on and on. Mrs. Patient, if I exercise too hard and the next day my muscle is sore, we know that's lactic acid. And just drink some water, extra water, and in a day or two, the soreness will be gone. Lactic acid is the exhaust of your muscle cells. Your bacteria in the gut produce exhaust. Patients understand that. You give them simple examples, they understand it. Now that exhaust is all of these technical names like short chain fatty acids and all of that. It's just exhaust. And the size is between 20 to 200 nanomolars in size, which means it goes right through the lining of the gut into the bloodstream. It doesn't require permeability. The exhaust of the microbiome has direct access to the bloodstream. And when it gets in the blood, phew, there it goes. Your bloodstream is just a highway. Everything's going in the same direction, but it's just a highway. And the bloodstream, I never thought of this, the bloodstream is like driving in Delhi. There's no rules. Everyone's bouncing into each other, right? I won't drive in Delhi. I'll drive anywhere in the world, but I won't drive in Delhi. And I'm from Detroit. I grew up with muscle cars, but I won't drive in Delhi. I won't do it. But that's the bloodstream, but all these short chain fatty acids and the other byproducts and breakdown products of our microbiome get into the bloodstream very easily. Yehuda Schoenfeld, the godfather of autoimmunity, has so many credits. He's from Tel Aviv, Israel. The one that captures me the most is that 26 of the MDs, PhDs who went to Tel Aviv for their PhD in immunology, 26, there are many, many more, but 26 of them chair departments of immunology in med schools and hospitals around the world. They're his students. This is the godfather. And we, in this textbook that he published a couple of years ago, he tells us that 36% of all the small molecules in healthy blood are the exhaust of the microbiome. 1/3 of everything in the bloodstream, of all the small molecules in the bloodstream, are the exhaust of the microbiome. Is that a mistake of nature? Of course not. They're messengers. The microbiome is sending messengers. It was Michael Gershon from Princeton, I believe it was Princeton, in 1999 that wrote the book, The Second Brain. And in that book, he told us for every one message from the brain going down telling the gut what to do, there are 9 messages from the gut going up telling the brain what to do. The ratio is 9 to 1. So who's the boss? Who's regulating neurotransmitter production and balance? Your microbiome. And how does that happen? The exhaust of the microbiome are messengers activating genes throughout your body. They modulate your heart rate. They modulate liver function. They modulate lung function. They modulate brain function. And modulate, Mrs. Patient, means has their hands on the steering wheel as to where the car's going. And just turn your car 5 degrees, turn the steering wheel 5 degrees to the right, and the car is off the road very shortly. Have a dysbiotic microbiome, and your physiology is off the road. It's out of balance very shortly because the messengers of a dysbiotic microbiome activate the genes of inflammation. And when you read the science and you see this, you go, wow, wow. You put this study on your ceiling, wow, over a third of all the small molecules in the, why? Why? Wow. And you're driving down the road and you go, wow, again and again. You're expanding your consciousness when you give yourself permission to just think outside the box and let it come up. Let your ideas come up, whatever they are. Professor Schoenfeld and I shared the stage in Rome last month, and he said this there, and I said, what? And we are born 99% human, and we die 90% microbial. Is that not true? Isn't 10 times more bacteria in the human body, in the adult body, than human cells? 10 times more bacterial cells? Well, we've heard that many times today already. Well, what does that mean? It means you die 90% microbial. So who's the boss? And those microbes are sending messages. Over one third of all the small molecules in the bloodstream are the exhaust of the microbiome. They're sending messages into the bloodstream, activating genes of action. Whatever the action is. The more dysbiotic you are, the more dysbiotic you are, the more functional loss you have, the more dysfunction you have. It's the gut. All disease begins in the gut. At the Institute for Functional Medicine, we have a 5-day course. Doctors and healthcare practitioners come for 5 days. We've got them from 7 in the morning until 6 at night for 5 days. And the first day is in the morning, it's welcome, good you're here, this is how the week's going to go. We're going to do case studies, and we show them the protocols, then we have lunch. The first one they get after lunch is me, talking about this concept, because this is where it all starts. Your microbiome is the boss, whether you like it or not. It's the boss. So how much attention are we putting on our boss to build a healthy, diverse microbiome? At the end of the day today, I'm going to take quite a bit of time. How do you build a healthy, diverse microbiome? After we've had this whole day, then that's how we're going to end. Critically important when you want to enhance the quality of your health. We're born 99% human. Infants have a small amount of microbiome already from utero, and then the birth process is where they really get inoculated. Unless it's an unfortunate C-section birth, then you have a big job in front of you. You've got a 3-year window to rebuild a healthy microbiome. After that, it's pretty much set for life. Some minor changes can be made, but the foundation is set by the age of 3. So C-section, my son, unfortunately, was an emergency C-section birth. And I captured some of the amniotic fluid when my wife's water broke, and I had it analyzed so we knew what the microbiome was of the amniotic fluid that he was developing in. I captured his first stool sample to see what happened with a C-section birth. It was the bacteria of the emergency room was dominant in his gut. That's normal with C-section babies. And then I went to work. Now he's got a normal, healthy, diverse, vibrant microbiome. It took, well, I don't know how long it took because I only checked him once at 1.5 years, and it was heading in that direction, but it wasn't there yet. But at 3 now, it's a normal, healthy, diverse microbiome. So it can be done. It can be done. If 36% of the small molecules in the bloodstream are the microbial DNA, the proteins, the lipids of the microbiome that are distributed throughout the body, that is not a mistake of nature. We must ask, why is this normal physiology? What's the purpose of this normal metabolic process? My first mentor was Dr. George Goodhart, the founder of applied kinesiology. And I have many, many sessions sitting in the chairs listening to him speak on stage. And George would always, when you'd see him lift up his right leg, he'd lift up his leg and his right arm, and you knew it was coming, he would go, "Why, doctor?" And he would slam the stage. Why does a patient have that? And we all go like this. But it got imprinted in us. Why does the patient have what they have? And what you're going to learn today is that all disease begins in the gut. It does not matter what the disease is. All disease begins in the gut. So here's a patient who suffered from psoriasis for 22 years. Steroid therapies, multiple therapies were tried, alternative treatments were tried, nothing helped. And he had significant widespread psoriatic lesions, peripheral edema, iron deficient anemia, low folate, B12, vitamin D, leukocytosis. Antibodies for celiac were negative. Antibodies for sensitivity to wheat were negative. Total immunoglobulin IgA was increased, and he had osteoporosis. He had already lost over 50% of his bone. But they did an endoscopy anyway, and he was a celiac. The blood work was negative, but he was a celiac. The doctors were smart enough to say, you know, you fit the pattern. You've got malabsorption, B vitamin deficiency, fat-soluble vitamin deficiencies. Let's just check anyway. And he was a celiac. They put him on a gluten-free diet and discharged him from the hospital. Nothing else. Here's how he presented. Here's the result in 1 month after 22 years of psoriasis. You must identify the triggers of inflammation, whatever they are. You, of course, want to deal with the symptoms and bring symptomatic relief, but you must identify the triggers of inflammation. And Professor Schoenfeld, once again, the godfather of autoimmunity, he published this paper last year. Gluten-free diet can ameliorate the symptoms of non-celiac autoimmune diseases. And he said the 3 autoimmune diseases that respond the best to a gluten-free diet are psoriasis. 61% of psoriasis patients get better on a gluten-free diet. Thyroid, 87%, and inflammatory bowel disease, 60%. They all get better on a gluten-free diet. And he showed us this drawing in that paper, which is all of the autoimmune diseases they looked at. And just to save time, that's all the autoimmune diseases that he identified may get better on a gluten-free diet. Maybe. More than half the time they get better. And this was confirmed in 64% of the studies that he reviewed. So most of the studies show that the majority of people get better on a gluten-free diet. This case study and report are excellent examples of how a food environmental trigger in a genetically sensitive individual can activate a systemic autoimmune inflammatory disease with the comorbidity, so celiac with the comorbidity of psoriasis. I don't know of anyone that gets one autoimmune disease. You may have one that's stronger symptomatology and you get diagnosed with, but if you check, they've got antibodies to other tissue that are elevated. It's so very common because the autoimmune disease you're diagnosing is not the problem. That's just the weak link in the chain. You pull at a chain, it always breaks at the weakest link. It's at one end, the middle, the other end, it's your heart, your brain, your liver, your kidneys. Wherever your weak link is, that's where the chain's going to break. The weak link is determined by your genetics and your antecedents, how you've lived your life. You eat tuna fish 2-3 times a week, you likely have mercury toxicity because most of the tuna in the world is high in mercury. That's an antecedent. So, what? What? Every autoimmune, every autoimmune disease. The mechanisms are very, very similar. It just depends on where the weak link is in your chain as to how it's going to manifest. I hope this is a concept that you dive into, is where does the development of autoimmune diseases come from? What's the most prevalent pathology at the root of practically every disease? We know, of course, if you think about it, it's always inflammation that dominates morbidity and mortality. It's always inflammation. Chronic inflammatory diseases have been recognized as the most significant cause of death in the world today. And the Center for Disease Control tells us 14 of the 15 top causes of death in the world are chronic inflammatory diseases. The only one that's not is unintentional injuries. Everything else is a chronic inflammatory disease. How important is it to deal with the inflammation? Well, it depends, if you've got joint problems. No, it doesn't depend. Every disease is a disease of inflammation. So you have to ask the question, where's the inflammation coming from that's pulling on the chain? It's inflammation that pulls on the chain, that breaks at the weak link, wherever the weak link is, and that's the disease you develop. So where is the inflammation coming from? Mrs. Patient, your immune system is just the armed forces in your body. It's there to protect you. You've got an Army, a Navy, an Air Force, a Marines. We call them IgA, IgG, IgE, IgM, cytokines. They're just different branches of the armed forces designed to protect you. So when your immune system gets activated and you have a highly active immune system, is it an immune system that's gone crazy? No. It's an immune system trying to protect you. So the question is, what is it trying to protect you from? Is there anyone in this room that doesn't think they have high levels of inflammation right now? Is there anyone? I hope not. Well, a couple of people raise their hand. Really? So are you walking around with an oxygen mask all the time and you're not breathing this air 24/7? You're producing inflammation constantly. Constantly here. It's always inflammation. And you can't do anything about the air, but you can do a lot about your home environment where you're breathing many hours a day and sleeping. You can do a lot about your work environment to increase the quality of the air. But we're not doing it. But everyone in this room should be learn those simple things you can do in your home environment, work environment, to reduce the level of toxicity you're being exposed to 24/7. In Mexico City, every child that they check for biomarkers of the mechanism in the development of Alzheimer's are elevated. Every child has elevated biomarkers for beta amyloid plaque production because they're breathing that toxic air. I just haven't seen the studies for Delhi, but I'm sure it's the same. Which means your brains are on fire because you're breathing this toxic air that goes right up the nose, right up the nasal cavity, right up to the memory center of the brain, the hippocampus. You know, your olfactory nerves go right to the hippocampus. And so you're triggering an inflammatory state in the hippocampus. And if you don't recognize that, just look at the science. And when you read it, say, oh my God, what do I do about that? Well, you clean the air as much as you can around your environment, and you reduce other triggers of inflammation. There's a whole protocol to do that. When your immune system gets activated, it's a message. We're under attack. Fight and defend. Your immune system doesn't go crazy on you. It may be very, very active, but there's a reason why it's been activated. And you have to identify what is the reason for the inflammation. We've heard some testimonies this morning about wheat already. And that's why millet is so important. It's part of your history, your culture, but it's an excellent grain. And it's an excellent grain to have on a very regular basis. I love this drawing from David Furman at the Buck Institute because it says it all. It says it all. It's everything on the left side of the drawing. So it's chronic infections, physical inactivity, obesity, dysbiosis, food selections, increased stress hormones, not enough regenerative sleep, and accumulation of chemicals in your body that activates the immune response, turning the wheel of inflammation production in defense against what you've been exposed to, that then turns the wheel in the production of whatever degenerative disease condition you're genetically vulnerable to. The mechanism in the development of cardiovascular disease is very, very similar to the mechanism of the development of rheumatoid arthritis, or to MS, or to Sjogren's. Doesn't matter. They're all inflammation. And we don't think about that. We're so locked into our area of expertise, which hopefully we're really good at and we help our patients with, but aside from the symptomatic relief, we have to think the bigger picture. Where is the inflammation coming from? So you can take some protocol, pharmaceutical or natural, that reduces the symptoms and the patient feels better, but if the lifestyle exposures are continuing, they're still degenerating. That symptom pattern has just been quieted down for a while. It's like putting a Band-Aid on an oozing wound. You must address the triggers of inflammation. If the cause of inflammation persists, the inflammation persists, usually with low intensity and is called low-grade chronic inflammation. It's characterized by the long-term unresolved inflammatory condition in which pro-inflammatory and anti-inflammatory factors are both being released and they fail to cease their actions. Because you're being exposed to this thing on a continual basis, so your immune system is going to continually try to protect you. That's its job, to save your life. Chronic low-grade inflammation. Could everyone please turn your phones off? Thank you. Chronic low-grade inflammation across the lifespan has been associated with the development of both age and diet-related non-communicable diseases across the lifespan. If 14 of the 15 top causes of death are chronic inflammatory diseases, what percentage of people in this room would you suspect have chronic low-grade inflammation? You just put the study on your ceiling in your own way and just think about this, and you realize we're all inflamed. Why are autoimmune diseases going up 4 to 9% a year, every year? Every autoimmune disease, 4 to 9% a year increase. Because there's more toxicity and more inflammation we're being exposed to, and that's accumulating in our body. How might we measure this ongoing low-grade inflammation? That by definition is damaging more tissue. Many of our doctors will do a test for thyroid. You look at thyroid antibodies. Well, they're only a little elevated, Mrs. Patient. You know, the normal's up to 60 and you're at 84. That's just a little elevated. Let's just watch it. Let's just wait and see. Because I see people at 500 or at 1200. You're only at 84. What are you waiting for? They're elevated. By definition, you're destroying more tissue than you're regenerating when you have elevated antibodies or elevated ANA antibodies. Everybody should check their ANA antibodies. They're just going rampant around the world now that people have elevated ANA antibodies. What does that mean? Well, it means your immune system is producing antibodies attacking the nucleus of your cell. What cell? Every cell, any cell. Why would the immune system attack the nucleus of the cell? Because that's where mercury goes. That's where volatile organic solvents go, just down inside the cell, into the nucleus of your cell. And your immune system, trying to protect you, is going after that mutant cell. So you get elevated ANA antibodies, but we don't know what to do about it. And so we watch it and we wait and see. Growing evidence suggests that elevated antibody levels precede the onset of symptomatic autoimmune disease by many years. Why and when do antibodies get elevated? This is an article, it was a game-changing article, went on the ceiling in my bedroom. This was in 2003 in the New England Journal of Medicine. Maureen Arbuckle is at the Veterans Administration Hospital, and she looked for people with lupus. She found 132 people with lupus in this one hospital. Now, if they're in a veterans hospital, they're veterans, which means they were in the armed forces. If they were in the armed forces, they had their blood drawn many times over the years while they were in the armed forces, many, many times. And what most people don't know is the government's been saving and freezing almost all of that blood since 1978. They've got tens of millions of samples of our service people's blood. Well, Arbuckle knew this, so she asked for permission to look at the frozen blood of the veterans currently diagnosed with lupus from when they were healthy in the Navy or healthy in the Army. And what did she find? Every single person, antibodies are present years before a diagnosis, and they follow a predictable course of increasing with a progressive accumulation of these antibodies before there's any symptoms. Why? Because symptoms are just when you've destroyed so much tissue, now the tissue can't function correctly anymore, and now you've got dysfunction, and now you start getting symptoms. And we think that's when it begins. No, it began years and years ago. Killing off tissue, killing off tissue. And here's the drawings that she showed. The top one is diagnosis. The bottom one is symptoms, when the first symptoms came. The 0 line is normal levels. And every one of the 7 antibodies of lupus were elevated 5 years before they ever had a symptom. Killing off tissue, killing off tissue, killing off tissue, again and again and again and again, for years, until you kill off enough tissue that now you have elevated antibodies. Some of the antibodies were elevated 9 years, 11 years beforehand, but for all 7 of them, it was 5 years beforehand. And she made up this drawing. She said, first you have normal immunity. That means your antibody level's in the normal range. Then you have benign, elevated antibody levels. Benign meaning there's no symptoms. Then you get symptoms, so she called it pathogenic, and then you get diagnosed with the disease. This is the development of autoimmune diseases across the board. They all develop like that. Nobody wakes up with rheumatoid. you wake up with the symptoms one day when you've crossed the line of tolerance and you've killed off too many cells. But no, they're all decades-long diseases. And we have to start thinking this way about reducing the inflammatory triggers that are activating the immune system, trying to protect you, that eventually cause the tissue destruction and tissue disease that we're diagnosed with. We suggest that what determines the organ specificity of the autoimmune inflammatory process may depend on food antigens resembling proteins of the organ being attacked. Just Google rheumatoid arthritis and gluten. Here come the studies about molecular mimicry. Rheumatoid arthritis and Hashimoto's thyroid. It's the not rheumatoid arthritis, thyroid disease and gluten. It's the most common disease that responds to gluten-free diet. 87%, according to Schoenfeld, get better on a gluten-free diet. Recent evidence suggests that chronic systemic inflammation may result from a persistent intestinal inflammation spreading through the intestinal barrier so as to cause a systemic inflammatory immune response. It's the microbiome that are sending out these messages into the bloodstream, activating the genes of inflammation. If 36% of the small molecules in the bloodstream are the microbial DNA, proteins, and lipids of the microbiome that are distributed throughout the body, can you see how they can act as messengers, activating either genes of inflammation or the genes of anti-inflammation? Thus, what's the dominant message circulating through your entire body when you have a dysbiotic microbiome? The dominant message is one of inflammation. There are very few people that could raise their hand and say, no, I don't have any bloating or any GI symptoms. I don't have any gas. I don't have any cramps at times. No, I don't have GI symptoms. There are very few. Most of us have GI symptoms. That's indicating dysbiosis, that we've got dysbiotic microbiomes. That's how very common it is. How many people in the room can say, I have no GI symptoms ever? We have one person that raised their hand. Thank you, sir. Just think about that. Everyone raises their hand. Everyone does not raise their hand. Just think about that. When your patients come in, how many have a dysbiotic microbiome? How does propagation of this low-grade chronic systemic inflammation occur? The gut constitutes the biggest endocrine organ, meaning producing hormones. 30 hormones have been identified in the GI tract, and therefore the intestine represents an incredible reservoir of peptides acting at distance from the gut. We have about 6 more minutes, if that's okay. Thank you. How important is the gut? Let's go to Professor Alessio Fasano at Harvard. Professor of Medicine, Harvard Medical School, Professor of Nutrition, Harvard School of Public Health, Chief of Pediatric Gastroenterology at Harvard, Director of Mucosal Immunology at Harvard, Director of the Celiac Research Center at Harvard. 5 titles. Any one title is a lifelong dream for someone at the top of their field. He's got 5. We think he'll win the Nobel Prize. We truly do, because it's him and his team that identified the protein zonulin as the mechanism in the development of leaky gut. Back in 1999, they identified that, and they've been publishing on it now for 25 years. And look at the title of this paper he wrote. All disease begins in the leaky gut. All disease begins in the leaky gut. The role of zonulin in the development of chronic inflammatory diseases. 14 of the 15 top causes of death are chronic inflammatory diseases. And he talks about the perfect storm. I love this picture because when you're a doctor or a clinician and you understand the perfect storm in the development of chronic inflammatory disease, it doesn't matter what comes into you. You know that you can help them. You know you can. You see how his left leg is bent, his knee is bent, foot's on the wall, hands in his pocket, relaxed in the midst of the chaos. I love the picture because of that. The 5 factors in the development of the perfect storm. First is genetics. Can't do anything about the deck of cards that you were dealt in life. But genes operate on dimmer switches. And you can dim down genes of inflammation. And you can ramp up genes of anti-inflammation. That's the secret to deal with the inflammation that people have. So, okay, how do I turn on the genes of anti-inflammation? Number 2 of the perfect storm, environmental triggers. It's the environmental triggers that have their hands on the dimmer switches, turning them up and turning them down. This is what they're teaching at Harvard Medical School right now. This is cutting edge. This is how the development of chronic inflammatory diseases occurs. And 14 of the 15 top causes of death are chronic inflammatory diseases. Number 3, when you've got too many inflammatory environmental triggers, you alter the microbiome, you get dysbiosis. Number 4, when you get dysbiosis, you get a leaky gut from the inflammation in your gut. And when you have a leaky gut, macromolecules, big molecules, get through the leaks in the gut into the bloodstream. It could be chicken, it could be healthy foods, but get through the leaky gut into the bloodstream, activating your immune system, trying to protect you, and you get number 5, systemic chronic inflammation. This occurs in every person that has a chronic degenerative disease. So Fasano's article, all disease begins in the leaky gut. The most common source of triggers of inflammation is what's on the end of your fork. It's what we choose to eat that is the most common one. And Fasano tells us in that article, the 2 most powerful triggers creating leaky gut are LPS from pathogenic bacteria and gluten. They're the most common. And Maureen Leonard at Harvard did a literature review on this topic, and she published in the Journal of the American Medical Association that previous studies have shown that gliadin in wheat causes immediate and transient increase in gut permeability. This process takes place in all individuals who ingest gluten. If you read this study, you can't argue with this. This is a life-saving mechanism inherited from our ancestors. In every human, when you eat wheat, you create this inflammation and leaky gut. So the science is very clear. You can arrest and reverse the development of chronic inflammatory disease. This event today, focusing on millet, is to give you pearls that hopefully you walk out with a number of things that you say, wow, I need to think about that one. Wow, I'd like to think about this and this and that. Wow, I'd like to explore that a little bit more. And that you dive in. You dive into the components of what you hear today that really capture your interest. And if you do that, All Disease Begins in the Gut is a great place to start. This is an excellent article to begin with because it sets the stage. It doesn't matter what they present with. Reducing exposures to the triggers of inflammation, foods, chemicals, toxic air, and stress, the left side of that diagram from David Furman. When you reduce the exposures to these triggers, you reduce activation of the immune system, which reduces production of inflammation, which reduces one's tissue damage, which reduces the dysfunction, the symptoms, and the development of disease, and which gives us a higher quality of health throughout the lifespan. This causes this, causes this, causes this, causes that. Step by step by step. And I'm hoping that you will dive in to this concept and want to learn more. And with that, I wish you great joy and happiness on your journey to better health. Thank you so very much. Thank you.
Thank you so much, Dr. Tom. That was really, as usual, last time as well, you had us completely with the examples and everything riveted to this whole thing. You'd be happy to know, since we last met, I have given up gluten. I've been completely gluten-free now for a year. And first I heard about the whole thing, that gut permeability, whatever, from you on the presentation. So fantastic. Thank you so very much. I wish we could have asked you all to, we had time to let you guys ask questions of Tom. I'm hoping you'll take it up later with him. We unfortunately just have enough time before lunch to have our next panel discussion on bringing back the story of millets. I'm just checking in that all the speakers are here for that. Tom, you'll be chairing the next session, so we'll have to have you back up. And Dr. Khader Wali, Dr. Raj Bhandari, Dr. Tara Satyavati. Yeah, there you are. Please welcome. Dr. Khader Wali, Dr. Raj Bhandari, Ms. Ishi Khosla, Ms. Asha Chandra, and Dr. Tara Satyavati. May I please ask you to take your seats on stage?
Madam, I'm just confused. I have a first 30 minutes of speech, is it?
No, sir. You have about 20 minutes. And then Q&A. What has happened, sir?
No, I'm supposed to. I need minimum of 30 minutes. I mean, it's panel discussion. What can I speak?
No, sir. First you are going alone. And then there is a panel.
Madam, I cannot speak in 15-20 minutes. Please give me 30 minutes.
Okay, sir. Okay. Thank you for taking your seats. Tom, of course, is Dr. Tom is chairing the session. Yes. May I introduce our next speaker, Dr. Khader Wali. He's someone who's dedicated 2 decades to figuring out how millets, or Shri Dhanya, as he likes to call them. Am I right, Dr. Wali? Shri Dhanya? Shri Dhanya. Yes. And he's spent 2 decades figuring out how Shri Dhanya can help us prevent diseases. He's come all the way from Andhra Pradesh, from Mysore. And he's pioneered jungle farming, which is also called Kadu Krishi, to naturally cultivate these millets. Beyond health, Dr. Wali educates on sustainable farming, water preservation, and nature conservation. His talks draw huge crowds in Karnataka, Andhra Pradesh, and Telangana, reflecting his holistic vision for a healthy and sustainable society. Over to you, Dr. Wali, for your presentation. Let's welcome him with a nice round applause of... Is that fine? Help with something?
No, nothing. Can you play the video?
Welcome to Dr. Khader Lifestyle. Hi, I'm Shruti. I'm from Bangalore. Last year, my son was diagnosed with type 1 diabetes in the month of September. He was barely 13 at the time. He had to be rushed to the hospital. He was in the hospital for about 7 days, where his medication or treatment included him taking insulin injections. And even when we got back, we were told that, this is how his life is going to be, where he has to manage his blood sugar levels only with insulin injections, and that he had to take it for about 4 to 5 times a day. And not just that, in the middle of the night, we had to check his blood sugar levels every day so that he doesn't enter a hyperglycemic state. And that is very painful to see, right? Thankfully, on the 9th day after his discharge, our very close relative, because of his experience with Dr. Khader, recommended us to go consult him. So I took my son along to Mysore, and we saw Dr. Khader. Dr. Khader immediately put us at ease. He said, my son does not have to be dependent on insulin injections for the rest of his life, that there was another way that included switching to a millet diet, stopping anything that was processed, stopping milk and milk-related products, switching to an organic diet, and following a good physical regime, that is a good exercise routine. And immediately we started that. Also, Dr. Khader, in his disease protocol, he recommends, for diabetes, he recommends taking concoctions of certain leaves in the morning, And having bull-driven oils, there are 5 types that he recommends for diabetes. So we started doing that for my son. And in a week's time, we could see how his insulin dosage had to be reduced, right? For every meal, in fact, we had started giving him lesser and lesser because his blood sugar levels were getting controlled with lesser dosage of insulin. And believe it or not, at the end of 1 month, we could, stop his medication completely. He was just managing it with whatever Dr. Kader recommends, with the millet diet, with drinking the concoction of certain leaves, with the bull-driven oils, and following a healthy regime. So we are extremely indebted to Dr. Kader for his timely help. We are grateful to him because he's been our savior. And I recommend that everybody follow Dr. Kader's protocol. Even if you're healthy, please switch to a millet diet. Stop eating gluten and rice because it does more harm than good to our bodies. All of us at home eat whatever my son has to eat to manage his health, and that is great support when you do that. And we can see the difference even in our health. So
thank you.
Thank you again, Dr. Kader. You've been our savior, as I've mentioned time and again.
Can you stop
and
there?
I recommend that everybody follow.
I request all of you to switch off your phones. It is irritating for Tom. We need to be a little more sensitive. Thank you. When food is right, there is no need of medicine. When food is wrong, no medicine works. This is the statement on which I started working on. Sadly, the human race is on a wrong path because of the West, for its vested interest, introduced the so-called rice and wheat in the name of green revolution to sell their pesticides, fertilizers coming from the war technology. This is the history in short, because I am given only 30 minutes of time and I have 30 years of work to tell you people. So now today FDA, the so-called apex body of the world, writes on a grain grown in Colorado in lot of tons, not for human consumption. This is for bird feed. Do you know the grain? It's the brown top millet. Sashtika Shali is how it is recognized in our Purana Grandhas, supposed to be the best grain for the human consumption. And all this leaky gut, all these kinds of names of diseases, scores of all this, can be just fixed in a matter of 3 weeks. And how do you do that? Just get back your symbiotic gut microbes on its right path. So simple. Take any millet, and I will let you what the definition of millet is soon. Can you please switch on that PDF and start scrolling? Scroll, please. Just scroll the book. Yeah. We'll get back and forth in this book. Please go ahead. Slow. No. Get back to where there is a mud pot. Just go down. You're almost at the end of the page. You need to have 8th page or 9th page. That's it. That was that mud pot. One more page, I think. Mud pot. Yeah, great. That's it. This is how you get back your gut microbes. As simple as this. So there is no point in saying your guts microbes are important, this and that. How does a common man get back his microbes back into his gut? Or the so-called biggest Nobel laureate on this planet. It doesn't matter. Just take millets, soak them for 8 hours, add lot of water, maybe 10 times to 20 times. After soaking, just boil on a slow flame for 20 to 30 minutes. And make sure it is still thin porridge. After it gets cooled, tie a cotton cloth, khadar cloth. Keep it for 8 hours. It gets fermented. Why only mud bath? Of course, you can have big fermenters and all that. These so-called processing units and all these so-called food processing scientists do all that. All that garbage don't go into. And I like to correct your word, it's not microbial exhaust. It is prasad. We call it prasadam, something that is good. Of course, dysbiotic, I use the word exhaust. Okay? So this wonderful process can be done in any part of this planet. Poor people can also do it. And there is no need for any big inventions. And this has been done thousands of years ago. In North India, they call it basi. Basi. Even before they had these pots, mud pots, even before that, the tribals put it in बांस का bottle में a porridge डाल के बांध के ग्राउंड के अंदर रख देते थे 8 घंटे के बाद आके पीते थे. After 8 hours, you take thin porridge, drink. You drink the fermented porridge. You don't eat. Why? If you eat, the stomach to the small intestine is not going to open immediately because there is a small valve. If it is a food, it wants to digest, so it takes time. So if you drink, you can fool that valve and it opens. And it is in the gut, all the microbes start to inhabit and start doing their wonderful job called symbiosis. So eubiosis, dysbiosis, symbiosis. Eubiosis is, these guys do not know whether to go this side or that side. Symbiosis is, they are sure for you to be helped. They help you. They do all the good job that you need to, including vitamin B12, which is a very complicated molecule, which no one does. No animals can make it. It's only the microbes help you do that. And there are many more things that they do that we cannot do. Because their short lifetime, they can adjust, the genome can read and want to do whatever you want to do. It is connected and all that. I don't want to go into details, but it's a simple, practical way of anything can be done. So you have this 8 hours, and mud pot is needed very simply because there are micropores in the vessel. So when you tie it up and cup, you have oxygen going in from in and out, and there is no pressure developed. When the fermentation takes place, there are gases released, this and that happens. So there is no need even for you to stir. In a fermentation of steel or anything like that, you need to keep stirring around all that thing, so that the pressure doesn't develop. So when you tie with a cotton cloth, it might just, everything is perfect. And after 8 hours at room temperature in India, 26 degrees, and of course in summer it's 30, 40, so maybe 5 hours your fermentation is done. And if you keep it for longer period, sorry, I am just hurrying up because 30 minutes time. If you keep for longer time, you make beer. You don't want to do that, okay? So, people are happy when I say alcohol. Keep that porridge, fermented porridge, it's called basi. Thousands of years ago, even before the mud pot was there in the human's hand, they used that. That's why it's called basi. Baas, मालूम है आपको? Bamboo bottle. Okay? Why bamboo bottle? Bamboo bottle में भी pores होता है. Oxygen gets in and the so-called carbon dioxide can get out, whatever. There are many more gases that can develop. If it is anaerobic fermentation, it's dangerous, all that happens. So that's why don't have your fermentation in a steel vessel. So you cannot say, I have cooked in my pressure cooker, push. So throw out your cookers from your kitchen. That's not the way you cook food. Okay? Ridiculous. Most unscientific thing. So take that ambali 3 weeks before every meal, 5 minutes before every meal, drink 200 ml to 300 ml, and that's how we cured that stupid type 1 diabetes. We have healed thousands and thousands of these kinds of cases. There is nothing that cannot be cured on this planet if you have your gut microbes set. Period. No discussion. Only thing is, how do you get it? How can a common man get it? This is how a common man gets it. Simple. And all the millets are blessed with this diversified microbes being pumped into your gut. And if you have 20 millets, please every day rotate each millet, because the fiber in each millet is little different from the other, and they can host a different set of microbes. So you have any day, I care 2 hoots about the names of the disease. I care 2 hoots. Just do this, you will be healthy. It's a matter of time, depending upon your name, lupus, autoimmune disease. All things can be corrected. So any disease who come to our clinic, first thing we do is make ambali, drink ambali. After that you eat. And next most, the whole group of people have not touched upon, it is the sugar that is more dangerous than your wheat. And the world makes 180 lakh tons of sugar every day, every year. And the whole real estate, sugar estate has spoiled the planet already. The California is burning and the Everglades of Florida are disappeared because of sugar. So this is all because industry and the corporatization of food. Even doctors do not talk about this. And that's a sad story. Okay, anyway. So sugar is the main enemy. Not even 1 milligram we need, but we are producing tons and each and every kilo of sugar you spoil 28,000 liters of water. And it is the sugar basis of all diseases. Fatty liver, this liver, rheumatism, glaucoma, everything is sugar turned into that particular disease. So it is the sugar, excess sugar, trying to manage the liver and pancreas together. It is not the liver alone, it is both together. So this combination, the symbiotic functioning of liver and pancreas, trying to adjust, cope up with this stupid intake of glucose, high amounts of glucose. Glucose is sucrose, fructose plus glucose. So the sugar is the danger. Gluten comes next actually. And it is rice and wheat that are chosen by these green revolution experts saying that brown top millet is bird feed, and the whole bloody world said, yeah. So premium food, rice and wheat is premium food and millets are primitive food. Janvaron ka aahar hai. This is what exact words these guys used, coarse grains. There is no research on millets. There is no one who has done work on that, because corporatization of food has resulted in all this. So all the so-called allopathic domain is talking about so many things, and then they have been only successful in selling tablets, nothing else, because they have not cured a single disease. Sorry for all my so-called blunt statements. Because we have not managed the gut microbes. It is the gut microbes that keep assisting you, every disease. So first thing we need to teach to be healthy is to maintain the gut microbes. All diseases are celiac diseases. It's where the nutrition, it's where the managing, it's where the regulation, it is where the tempering, everything happens there. And people call, they have brains here. It is not here. This is actually second brain. This is the first brain. This works if this is right. It is not the other way around. So, the first brain is celiac area. After your tummy opens up, the small intestine, and of course, doctor has told you, till your anus. So, that's where everything is. And how do you do that? This is the simplest. This costs you 5 rupees per meal. 5 rupees per meal. First drink this, and whatever you eat next will be, you are better off, because that will start regulating. And it regulates your glucose. It regulates everything. So I call it is the doctor within 24/7 working for you. And all us MD, MS, all this, we are all bogus bakwas fellows. That's the real doctor. Because they know how much amount of this particular transpirator is needed and where and when in many dimensions. And they make all the adjustments. So without gut and without gut microbes. And people, there's a wrong connotation. Diet is not your food. It is the food that makes your diet. So food, by definition, should be controlling the glucose release into your gut. So glucose imbalance is the first problem human race is facing. It is not what you are more or less eating. It is how well regulated your glucose is released into your gut. That is the definition of food. If your food releases glucose slowly and steadily into your bloodstream, and that is the real food. So the definition of food is that. And then things happen. It has to manage the microbial imbalance. And then of course hormonal imbalance. Hormones are various kinds. So all these three imbalances and these words, glucose imbalance, microbial imbalance, hormonal imbalance, are termed by Dr. Khadarwali. That's me. These are the main reasons why humans have diseases. And many people ask me, who is the reference? I am the reference. No one wants to publish what I am saying. So, we need to understand the whole world of health depends on this and this and this only, nothing else. And we can harbor diversified microflora. It's okay. I have told what I have to tell in the beginning itself. So, if they still want to continue, it's their headache. The whole world of health is in the association of these wonderful gut microbes, which mother tries to inoculate, and we stupidly are encouraging cesarean births because the hormonal imbalances. So, in fact, I appreciate Tom said, if you want to get pregnant, please follow the book. We have got so many kinds of diseased conditions tabulated in this PDF. And what are the millets that help you? And what are the decoctions that are the leaves around you that help you? And we have had tremendous success in not 100, 200, thousands and thousands of people all across the globe are benefiting with this. So, with millet food, don't use the word diet. Diet is something all these fads keep talking about. This diet, that diet, fat diet, ketone diet, all that. Forget it. The real food. This is the food. Food of the human gut. It's not only human gut. There are 6,000 varieties of C4 grasses covering the planet Earth. And the photosynthesis is very specific and very different. And it is because of the genomic content of this millets is very high compared to your rice and wheat. Almost 8 to 12 times more. Yeah, please don't be taken by our policymaker. He was 12 chromosomes, 12 chromosomes. That's not true, okay. about wheat and all that. See, wheat and rice are completely, absolutely not good, or they cannot be even defined as food. It's not human beings' food at all, because they cannot have regulation of glucose into your bloodstream. And apart from that, wheat has got this gluten, small protein, 6% or so protein, which can damage your celiac. So it doesn't matter whether you have gluten or no gluten. If you are pumping high glucose amounts, that's good enough to spoil your celiac area. So it is the glucose, irregulated, non-regulated, absolutely you are flooding your blood, and that's where all the problems begin. And that's actually is the cause of all inflammation. High doses of glucose, and no one to talk about the amount of glucose and liquor we are producing on this planet. And why doctors do not talk about it? They are interested in selling only tablets. First thing you want to do, tell your patients, is stop eating rice, wheat and sugar. Of course, meat and milk and all come later. They occupy actually highest damage. 6.8 billion tons of carbon dioxide is produced per year just to produce your milk and meat. And 4.2 billion tons of carbon dioxide is produced remaining agriculture activities, and only 3 billion tons and remaining all other human activities. So it is the agriculture industry, including meat and milk production, is what is causing the damage on this planet Earth, not only to the planet reservoirs of all natural resources and to the human health. And we are all being very hypocritic, conducting symposium after symposium, not talking about the main reason. Sir Tom was very accurate in saying that if you don't remove the irritants, you will not solve the problem. So how do you do? If you do not mention this is the problem and that is the reason, you keep talking about all processes and procedures, not correcting the main problem. And the solid story, I think I have another 12 minutes, 12:50, no, 8 minutes. I have 8 minutes. The millets have got what are called fiber associated with it, and I have identified 5 minor millets: kodo, little, foxtail, barnyard, brown top. These have got 8% to 12.5% of fiber, and the upper layers of these grains have got what are called lignans, the most wonderful antioxidative processes. That means, and if you know the structure of lignan, they are actually conjugated aromatic molecules with different handles of aliphatic chains, which can actually stabilize almost all the EMF. Inflammation is due to EMF, electron motive force, which is actually an oxidative stress created when mitochondria generate ATP. So the tumbling down of electrons, the passive leakage of electronic motive force is what creates the inflammation starting in the mitochondria itself, which makes the mitochondria aged. So if you want to stop aging of the mitochondria, the best thing you can do is supply your bloodstream with the PMF. And who can better supply than millets and its fiber, the lignans, the ultimate antioxidants on this planet for human health, is to negate the EMF. See, the wood is lignin, and the prerequisite to make lignin is lignan, and to make lignan you need veratryl alcohol is the monomer, and you have resveratrol, which is actually a dimer, which is one of the most important antioxidant, anti-aging, anti-cancerous, anti-inflammatory, everything that is present. Of course, the Western world keeps talking about the so-called grape juice has this resveratrol, but we have 10 times more resveratrol in our groundnut pink peel that we throw off. that has got gram to gram 8 times more resveratrol than this so-called wine, that red wine and all that. So we have local wonderful foods that have the most wonderful antioxidative properties, and it is the antioxidants which are phytochemicals. That's why plant-based food is your food, and our gut doesn't require animal protein. This is the essence of study, and we have tabulated the whole PDF. Please go through and just browse through for fun, just browse through the. We have the so-called mental illnesses completely reversed. In fact, I had in 2002, there was a lady which has to be chained every day because she sees a sharp thing she will take and then pierce into her mother or whoever. So they used to tie her up with the chains in the night, and we have now that lady wonderfully taking care of everyone. We have reversed just by giving for 6 weeks this wonderful ambali. In South India we call ambali, khamir, basi. So there is no disease that can be reversed, that cannot be reversed if you are on millet food and millet ambali. Everyone on this planet Earth, if you are a human being, you have mouth to anus, you need ambali, period. Simple, straightforward. We have had all kinds of diseases disappear. If only you follow. But I will drink ambali and I will go and have my bagel and whatever so you call, early morning you eat donuts. These Americans use donuts, I know, tons of sugar, tons of nonsense they eat. McDonald's, I love McDonald's. You keep eating McDonald's. All these dairy products. Humbug. It's not our food. It's business. Food being corporatized has taken away the rights of the seeds of the farmers on this planet in the name of patents and copyrights. Food sovereignty of each and every nation is affected, including Americans. It is the corporates who are running the show. So corporatization of food is the source of all our problems. We need to decorporatize our food, and I do not like food technology. The processing of food has to be in your kitchens. So don't buy any processed food, including millet processed food. Processing the food is not scientific. You have to cook your food with the STP, standard temperature and pressure. You can only change temperature or pressure in your methods, and that happens only when you cook your food in mud pot, nowhere else. So cook your food in your kitchen. You have lost your health in the kitchen, but you are searching in the hospitals. Sorry. I am very sorry. You will not get any health. You will get tablets, you will get scans, you will get whatever, but never you get health. You want health? Please get back to your kitchens, start cooking ambali, drink every day, and everything will follow. Thank you. I don't want to overtime.
Thank you so much. That was a lot of food for thought, especially before lunch. I know we're running late and lunch awaits you, but we still have a few more sessions to go. So please bear with us. May I next invite Dr. Raj Bhandari. Dr. Bhandari is a member of the task force on millets set up by the Government of India, and he's a technical advisor to the Indian Institute of Millets Research. He's here to talk to us. Thank you so very much.
Where's the presentation?
I will just get them to. Could we please have Dr. Bhandari's presentation up next?
So thank you so much, and thank you, Ishi, for giving this wonderful opportunity. You see, real food. What is real food? That is, nutritionists and everything is so divided. But real food is something which, either gives us energy or for growth that we use. Millets, I like to show some slides which at least many of the young people would never have seen what a millet is. So we'll try to introduce millets over there. And we want to make millets as aspirational food, something which belonged to the masses, to the bottom of the pyramid. We would want to see that millet doesn't have a boom and a bust like quinoa, where the local growers could not have access to quinoa and the prices shot up. So that is another challenge with millets. And here I would bring you to the first slide is millets matter. Why do millets matter? Well, they are ancient grains, and as you know, our ancestors were tall, strong and sturdy, and now we have a generation that is small, thin and stunted. With stunted children, we'll have stunted economies. Cognitively also there will be fall in their cognition. And this is what the National Family Health Survey has shown. I mean, anemia on the rise between NFHS 4 and 5, which is worrisome. The other worrisome thing that is seen is, and what Dr. Sareen also pointed out, as a public health specialist, we see diseases of adults coming, reflecting in children. And that's a public health emergency. Why? Because children don't consume alcohol, but I see children 10 years old, 15 years old, having fatty liver. And if what the statistics say is, if it is like 40% of the general population, and behold, they do not know that they have fatty liver, then it is a public health crisis. And that is the genesis of insulin resistance, as was pointed out in the morning. The other thing is that millets matter because it is a symbol of unity. 69 countries grow millets, and therefore it is a unifying factor. And these are smart foods, good for the planet. They not only consume less water, but also sequester carbon in the soil and absorb water from the atmosphere. And therefore, with a shorter crop cycle, they are good for the planet. And they are good for humans, which we shall just see. And they are also good for the smallholding farmers, because that will be regenerative agriculture. So, we have now evolved from food to nutrition science, and today we discussed about metabolic health, and that is where the action is. All the action is at the level of your cell, and specifically the mitochondria, which is the refurbished bacteria in the, as a cell organelle. That is where, you know, it produces energy, and our body has mechanism for biogenesis, mitochondrial biogenesis. And of course, sugar and alcohol and fructose, especially the sweet molecule in sugar. Sucrose is one molecule of glucose and one of fructose. So that fructose is a toxin for mitochondria, and also excess of branch chain amino acids. So with all this, I can say that millets matter, and it is important that we see what millets are. And this is for your information, you know, the millets, what they look like. The major millets, the three of them, and the minor millets, which basically are, you know, what Khadar Wali said, that they need to be revalorized, getting it back into our food system and going forward. In Ethiopia, you have teff and fonio also grown. Teff is now regarded as a super grain. I don't like to use the word super. I use smart grains. And this is a brief history that they were domesticated in Africa and 4,000 years ago. Some were grown in Africa, and then with migration, the seeds were, cultivated in other countries as well. And few of the millets, like little millets, were grown in India. So this was, India is the secondary center of diversity. And this is, you see, BP is before present. So you have the origin as long back as 5,000, 6,000 years ago. So they are called by different names, and these are heritage crops. And in India also, if you see that they are in different agroecological zones, you have different millets grown. We find that barnyard was in Japan, the origin. Proso millet was in China. Kodo was in India. Foxtail in China, and some in South India. So you have a whole range of distribution. So the major millets are whole grains. You don't have to dehull them. Whereas for the minor millets, they have a strong husk, so there is need for dehulling, and because the outer portion is not edible, and therefore some of them would need to be polished as well before we can consume it. And the shelf life could be extended by certain methods, and this is just a broad structure for you to see pearl millet. The bran, that is the outer portion, has the phytonutrients and the fiber, which is, to me, the most important thing that millets have. You saw the colors of millet, those are colors of health. These, if they are removed along with the bran, then you would not have the nutritional property of millets. So you have to be careful in the way it is processed. And some millets, like pearl millet, have more of lipids, and therefore they can cause rancidity due to aldehydes and ketones which are liberated in the oxidative process. And this is, processing, all processing is not bad. Some processing like soaking, germination, these are also processing methods which really increase the bioavailability of the minerals and the vitamins, and also the digestibility of the protein. So for enhancing shelf life, because this is a major issue, people ask me, how do we use bajra after 15 days of this thing? So roasting and heat treatment is one thing. Packaging, hermetic is, airtight packaging. There doesn't have to be oxygen which reacts to give rancidity, and protect it from light, moisture and oxygen barrier. And storage in refrigeration and dry temperature with no light is also a good way to process. So these are certain ways in which we can extend the shelf life. And this is just for your information that various processing technology, because these days people want ready to eat, ready to consume, and express foods. Express foods are like 2-minute Maggi, These are what the market forces, the demand which is growing. So we, with millets, IIMR, the director Tara Satyavati is here. They have all these technologies where they can make processed foods which are minimally processed and without adding any additives, emulsifiers or stabilizers So without all that, you can still make foods which are probably the need of what people demand. And these are certain other, so millets are a repository of nutri-cereals. And another thing is that all millets are unique. And therefore, you have to choose the right millet for the right season, for the right reason. And this we shall take up in our panel discussion as well. And we have a body of evidence, 7 papers which have been published in peer-reviewed international journals, where we show that the HbA1c, anemia, dyslipidemia, that is decreasing the LDL and increasing the high density lipoprotein, calcium retention in fatty liver, and of course now with Dr. Sareen we are having research on the gut microbiome and the correlation with fatty liver. So this is a snapshot which gives, that protein is high in proso and foxtail, and similarly pearl millet has more of lipids, and minerals, the macro minerals like magnesium, zinc and all, phosphorus, they are very rich in millets. So, and of course dietary fiber. So if you don't feed the gut, the bacteria will feed on you, and that is important for you to take home as a take-home message. And the slow digesting starch, carbs are slow digesting, they are different from rice. So we have fiber, we have slow digesting starch, and we have resistant starch, which doesn't gets broken down in the small intestine, and it will act as a prebiotic in the large intestine, in the colon. And therefore, this resistant starch is a hallmark of millets, which is not present in wheat and rice. And glycemic index, you see, all foods, all millets will vary according to the food matrix and according to the ingredients which have been added and in the way it has been processed. And that is where I would not commit that all millets are low GI. It is what we do to the millets which will retain. For example, millet ragi flakes or decorticated ragi will have high GI, whereas extruded vermicelli and pasta would have low GI, or rather moderate GI. And therefore, it is what you do to the food that ultimately determines the glycemic. Our Honorable Prime Minister, he said, food processing holds solution to nutrition security. Mind you, by 2050, our productivity will fall by 20%, and our mouths to feed the population will be 10 billion. So there will be more hungry people in 2050 if we go at the present, monocropping or the 3 majors, wheat, rice and maize, decreasing the biodiversity. And that is an alarm sign that we need to go to those 32% of areas which are arid and semi-arid, desert areas, where nothing can grow, where millets will be the last standing crop. Temperatures 55, you will have millets growing, nothing else. And you see the nutrients, bajra high in iron 6.4, zinc 2.8. Ragi, that is finger millets, has 3 times the calcium of milk and 10 times the calcium of rice, and therefore these are very much preferred as weaning foods for children. And this is where every millet has a certain dietary component which is useful, and this is the health benefits of millets that we have a study, a systematic review and meta-analysis, which you can all take a read. And to conclude, we have to take a pledge, and that millets are smart foods. They have these immune nutrients, and all these nutrients work as a team. They don't work. For example, an antioxidant, vitamin C, will give one of its electron to vitamin E, and then it becomes a free radical. Now, vitamin E will then transfer it, vitamin E is tocopherol, an antioxidant. So, all these nutrients have to be there, micronutrients, to work as a team, to act as antioxidants. So, with this, I would wish you the best. To conclude is that millet is not an option, it is an imperative. You have to diversify your diet, and this is what the National Institute of Nutrition says, that 30% of your cereal intake should come from millets. That is, if an average consumption, in words of Khadarwali, he says, don't say consumption, he says eat millets. So 30%, which means about 80 to 90 grams per day, should be from millets. With this, I thank you for your patience.
Thank you, Dr. Bhandari. We're not letting you get off that easily. You know you have to moderate the next panel discussion, right? We have 3 panelists with us. Dr. Bhandari, I'd request you to take over now. And hopefully, if we can now, I'm sure the audience has been very good, but if you can accommodate a few questions, that would be very kind.
Well,
so if you could keep it to about 15 minutes. One question.
I think this will be more of a rapid fire.
Yes.
Rather than a... So let me begin with, first of all, I welcome you all, panelists, and I think the learnings that you will share today will give a big impetus and a momentum for millets. And let me pose the first question to Asha Chandra ji. During the International Year of Millets, India has put millets on the global stage. So, measured purely by visibility and awareness, millet marketing was everywhere, from White House to the G20, and millets were, the things which India projected to the world. So what role has Mera Millet Magic played or is playing in bringing millets back to the Indian thali, that is the Indian plate?
Thank you, Dr. Bhandari. In fact, I'll take off from 2 points that you made. One was a pledge, and the second thing you said was eating millets, as Dr. Wali said, is not an option, but it is a necessity. So keeping this in mind, 3 of us, Ishi Khosla, founder of Indian Celiac Society, Bharat Goba, if he's here, founder of Shubh Group, an NGO which adds the arts to everything, any program, any project, and myself, I have done programs from the grassroots to the UN, including public policy, etc. So all 3 of us got together and we decided what should we do. So we came up with this program called Mera Millet Magic. And we decided that we should take a pledge to eat millets. How do we do that? So we did a pilot where the 1-point program was to include 1 millet meal in your daily diets. And we said, take a pledge and let us know about your recipes and what you have done, post videos. It was a fantastic effort, and we got a lot of feedback which was extremely positive, with the result that the Ministry of Culture has informed us that they are taking it to a larger scale. Crores of these pledges, and they will be applying for the Guinness Book of World Records.
Oh, wonderful. That's
That
superb.
is, yes.
And one millet meal a day
Yes.
would provide something like 30% of RDA for fiber and iron, and 40% for calcium, the recommended dietary allowance.
Absolutely.
So if you combine millets with legumes,
Yes.
because millets are rich in methionine, and the legumes are very rich in lysine. So it gives a very complete
combination,
amino acid profile.
the combination would
So
be
I'll
fantastic.
now I'll come back to you, because we have a 3 set of questions.
No, we are keeping it to one because I'm sure the audience is very hungry.
Okay.
And second thing was that this program was recognized as an official event by the Food and Agriculture Organization, FAO, which was a great boost to the campaign, and also by FSSAI, and they took it on as the Eat Right campaign, and the Ministry of Culture. So we are going about this in a big way, the pledge to eat 1 millet meal each day, and we hope for the Guinness Book of World Records and increase eating, not consumption, as you said. Thank you.
So, well, the millet magic is playing well, and I'm sure it would catch up. Dr. Tara Satyavati, who is the director of Indian Institute of Millet Research, and we work very closely. Can you share some of the key findings or breakthroughs in millet research that have emerged recently?
First of all, I would like to thank the organizers for giving us this opportunity to come and interact with you people. Very rightly said by Dr. Raj Bhandari ji and also Dr. Khadravali ji, there are enormous benefits of millets. And to take these benefits to millets and make common man use them, so we need to come up with some technologies so that they can adopt these millets and use them in their regular eating habits or in their food. First of all, as the research institute, we come up with a number of high-yielding varieties of millets, and then we are working on 9 different kinds of millets, like pearl millet, sorghum, finger millet, barnyard millet, foxtail millet, little millet, proso millet, brown top millet, and I think all 9 covered. So apart from coming up with high-yielding varieties, we also come up with technologies that will help the farmers to come up with high production and productivity. So we'll also give them the technologies for agronomy, and then if at all needed, anything related to protection, because very, very few diseases or insect pests are there in millets, unlike rice and wheat. And because these millets are resource poor, and also they don't need much of resources like you see in case of rice, wheat or maize. The water requirement is less, the fertilizer, everything is very minimal. And they form a basis for sustainable agriculture, especially in case of arid and semi-arid conditions. And again, when we talk of the nutritional benefits of millets, pearl millet is rich in iron and zinc and high amount of fat, and that too good amount of fat, you say the polyunsaturated fatty acids. Then sorghum, rich in again fiber and good amount of antioxidants. Finger millet, rich in calcium. Proso millet, rich in protein. Then foxtail millet, low glycemic index and good amount of good amount of useful material in all other millets. So making millets as part of our diet is really good, and it benefits our, whatever you say, gut microbiome or your general health. And as I've been hearing from morning, everything starts from our gut, so whatever is good for our gut is good for our health. And millets are really good for health. And people also talk many times about the acidity, and millets generally do not give you acidity. And in pearl millet, even after it enters your gut, it still remains alkaline. And people who are suffering with acidity, I think these millets are a big boon. And the kind of, the form of millets you take that matters. And Dr. Kadravali has excellently explained you the beauty and the richness of the ambali, which you can prepare from millet. And now coming to the other technologies, what IIMR has done is we have come up with primary processing facilities, because as rightly mentioned by Dr. Bhandari ji, there are 3 millet grains like pearl millet, sorghum and finger millet, which do not have outer coat to be removed. Whereas the other small millets, they have inedible outer layers which need to be removed. And that processing is not easy even for the farmers. And leave aside the busy housewives and the ladies who, because nowadays everyone is busy in their own respect. And we are moving towards fast and convenient foods. So in order to bring back these millets into our daily diets or our foods, so we have come up with technologies like primary processing, where we need to remove the outer seed coat, and that's how we have these millet rices like kodo rice, little millet rice, foxtail rice and other things. And then also we have come up with a little bit of varying the grain size, the particle size. Why it matters is, when we talk of rice, that means the millet, small round grain, but when we break it, the time required for its cooking will be reduced. And because we people are time starved, we need easy processes and easy way to come up and have cook healthy food within a short span of time. And then we also have come up with the different techniques of flour making, so that rancidity is not there and other things. Now, when we say that and talk of good properties of millets, only those people who are really conscious of their health will understand. But to attract the young generation, the adolescent generation, the teens, we also have come up with technologies for processing, like we have the extrusion technologies, whether it is hot extrusion or cold extrusion, or then flakes, so that we can come up with different products of these millets, and these are taken up by different companies, and we have these products available easily in the market, so that we can attract all age groups. If I call a teenage boy and tell him that, see, this is bajre ki roti mein, this is the beauty and this is much of nutrients are there, he'll just throw it on my face and say, bye. He will not take it. So we need to make our food also appealing. So we need to come up with those technologies where these people accept it. Acceptability, improving the taste, and reducing the time of cooking, all these are very important. We are not just food technologists. We are a research institute dedicated totally for the development of a number of varieties and other technologies for millet production and development, but also we are doing into value chain, because whether it is intentional or unintentional, during the process of this green revolution and this course of time, very effectively these millets were sidelined. And if you see everywhere in the nook and corner of the country, we have rice mills, wheat mills and all these things. But you don't find these millet mills or millet processing facilities. So we need to bring in those, and we are working on that direction also. So we are trying to bring a whole lot of variety of millet related things to the public, and also coming up with a scientific background with science based things. And recently, Honorable Prime Minister of India has elevated the status of Indian Institute of Millet Research as Global Center of Excellence on Research for Millets. So in these things, yes, sir, we are trying to march ahead and take the things.
This is great news, you know, that this will be the global hub of millets. And what really worries me sometimes is that our farmer has to be incentivized to grow millets, because the area for millets, which was 32 million hectares, has shrunk over the past 30, 40 years. And so but since the productivity has increased with higher yield varieties, we are still producing 18 million tons of millets in our country, which were produced way back in 1960. So the disconnect between the demand, while the demand is growing, while people are opting for millets, but simultaneously production and productivity also has to increase. And the other thing is that our scientists have developed biofortified millet crops, 17 of them hybrids, and these crops will have more of micronutrients. So probably these vertical programs that we are running, iron, folate, vitamin D, and all these fortificants might really, we might have to look at millets to offer a solution as a one-stop shop.
Can I add something?
Yeah.
When you touched upon biofortified things, I just mentioned that pearl millet is having high iron in gene. Whenever a plant breeder develops a variety, we evaluate only for the production, productivity, and then related diseases or pests, insect or diseases. But for the first time, we have come up with a policy decision wherein we have come up that no variety or hybrid of pearl millet will be promoted either for testing or for identification of the variety or for the release without a minimum benchmark level of 42 ppm iron and 32 ppm zinc. And this is the first of its kind of policy decision which has been taken and implemented anywhere in the world in any of the crops. So this kind of decision we have done because we are talking of food security and then moving towards nutrition security. Unless and until we have those varieties with high productivity and high micronutrients which are really good, we cannot achieve nutritional security. Whether they eat in the raw form or in the roti form or in the porridge or in the ambali or in flakes, at least some part of that will go into their tummy.
Great.
So that is what we are planning.
So now I think I'll go to Ishi Khosla, who has worked on very precision nutrition, I would say. I mean, prescribing a diet for every individual, because we are all different in some way or the other. So we would want to hear from you, in what ways can millets be a valuable addition to diets of individuals with specific digestive disorders or sensitivities, and the effect of carbohydrates in millets in diabetics.
Okay, thank you, Dr. Bhandari. I'll take this opportunity to clarify a few myths about millets, because we have learned so much about the goodness of millets, the nutritive value of millets, and somehow I also hear from various sources that millets are low carbohydrate or are low GI or are more nutritious than the conventional staples. So it's like, you're brushing everything with the same philosophy. Millets are a group of cereals like you all discussed. So one millet is not equal to the second, and there are different USPs in every millet. And likewise, for instance, even if you're looking at conventional staples, don't get me wrong when I'm saying this, that even wheat is nutritious. It's a nutritious grain. Corn is also nutritious. So the difference is, first, let's clarify the first myth, that the calorie value of millets versus conventional staples is very comparable. They are not low in calories. The carbohydrate content is also comparable. It's only a different form of carbohydrate. You may be having more resistant starch in some and more fiber in some. But if you look at the average values, they vary between 50 to 60%. So that's a big myth. And the glycemic index, it varies from millet to millet. So while jowar and bajra may be comparable to wheat, and again, wheat is not just one thing. We're talking of whole wheat and with refined wheat. So if you're really comparing it with whole wheat or brown rice, it is very, very similar. Some millets have certainly a low glycemic index, particularly the samak, the foxtail millet, is lower, like around 50. So that is genuinely low. So these are, because I find people making these comments, so I thought I'll take this opportunity to clarify. And the one thing that I'd like to say is that it is the absence of the inflammatory proteins in these millets compared to the conventional grains we've spoken about, which makes the cutting edge difference. And we've all talked so much about inflammation, and if there is no inflammation with consumption of a grain, the nutrients will be absorbed. Whereas if there is an inflammation and a dysbiosis, the nutrients, the whole dysbiosis story starts again. And we're unable to absorb the nutrients or make the most of it. And a case in example here is teff. And somebody commented to me, thank you. I shouldn't be the one who's overshooting, but very quickly I'll give you this example of Ethiopia. Teff is a staple of Ethiopia. And somebody said, oh, they have lower anemia rates than India. And Ethiopia is a far more, socioeconomically lower status than us. So that set me thinking, and I looked at the iron content of teff versus wheat, which we're comparing it with. And that lady remarked, oh, teff is very high in iron, And I said, actually, it's half the amount of iron that it has. And yet, the rates of anemia are superior, are better. It's not like they don't have anemia, but it's just a food for thought, that it is really absorption which is making the critical difference more than the content. And of course, there is no denying that these are anti-inflammatory grains, and therefore they have the power to solve, like Dr. Khadarwali said, anything and everything.
Anything and everything. That's a nice way to conclude. But yes, you rightly pointed out that the carb content would be similar to wheat or rice, 65% of carbs. But I would say that I would contest the fact that a calorie is a calorie. All calories are not same. How do we derive these calories? Because our body is not a bomb calorimeter. What was earlier seen as, we don't burn trans fat, we don't burn omega-3. Why? Because omega-3 our body needs for development of the neural functions, and our bacteria doesn't have the enzyme to break the trans bond. So trans fat will be deposited in the arteries. So how you derive these calories and what is the source of these calories does matter, and that is what should be very specifically mentioned on the label, on the front of the label, for better choices, food choices that our consumers can have. So I'll give just one last 1 minute to Tom. He's made a special request, so he has something very important to share with you.
I've learned a lot about millet here this morning, and it's very attractive. A couple things that really caught my attention was the concept of ambari, of fermented millet. That sounds like a very good idea and very simple to do. Something else that caught my attention was we should recommend eating millet every day. And my alarms went off right away. No one's going to, there may be a few, but no one's going to eat anything every day. That we are a culture and we're accustomed to a lot of variety in our diets. But my suggestion would be for our audience that if we will commit internally, I'm going to try some new millet recipes twice a week, and just begin introducing yourself to a food that you've not used very often in the past. You may find that you develop an attraction and a couple of different recipes, and it becomes a staple in your diet. My concern is that too many people here will think, well, I'm not going to eat every day, and will never try. So if you try just once or twice a week, find a recipe that you like, and give it a shot, I'm hoping it will become a staple. It is becoming a staple in our diet at home now, in preparation for this conference, as I learned more. Give it a shot and see how it is for you.
So great. We have an immunological memory that we've eaten millets, they were our staple, so I'm sure our body will accept it. But you'll have to take longer to start, having. So, yeah.
I just wanted to, if you soak the grain and prime your body with ambali, and there is a problem with every one of us here, millet means it's not one. There are already 10 millets there. So it's not that we are going to eat millet means the same thing. No, not at all. Not at all. So instead of rice and wheat, we are giving you 10 millets. I mean, it's amazing diversity by itself. So it's that you change. Every 2 days you keep changing your millets. And that's the way you eat millets. So it is not one thing. Millet, if you are grouping and considering it as one thing, no. They are very 10 distinct, different tastes and different worlds. They are beautiful, okay? Second thing is that the microbes, again I come back to microbes. Agochara, they are the things that cannot be seen. In fact, it is the microbes that run these life forms on this planet, including the absorption of water on the millet grasses, C4 grasses, hygroscopic bacteria, covering 90% of the planet is what makes the rain come. It is not the rainforest. They are secondary level. So, but for this C4 photosynthesis, there is no life on this planet. So, we better grow millets, even if you do not want to eat.
So, with that, I thank all the panelists for enlightening us with their views. And let's give a big thunder of applause.
Yes. Thank you, Dr. Bhandari. Also an applause for him.
Generation, I am known as the millet man of India.
Yay! Dr. Bhandari, thank you for keeping the discipline. I mean, clearly you're a hard taskmaster. You've kept all the trains running on time. We break for lunch 2 to 2:30. I'm sure there's a question. Feel free to ask. I'm going to request them to be here if you guys have questions. 5 minutes, please, will you just stay on the stage? But everyone else, may I please request you, because we need to be back here by 2:30 to start our next session. Go visit the expo, have some millet golgappas. And if you have a question, please stay back and ask your question. No problem.
If we had to define trust, we'd say, trust is knowing someone's got your back and always showing up for you. Trust is taking a leap of faith
The marathon number
and
one
having faith.
in Ethiopians all along the history. Number two,
Trust
we have been
is
talking
an
about
unwavering
poha,
commitment.
which is a crude, unpolished brown
Trust
rice,
is a
which has got a
heartfelt
reference only in Bhagavad Gita.
Trust is us. Agilus Diagnostics, India.
They'll come down, no? You're supposed to get to them and speak to them. Thank you.
जितनी भी टेक्स्ट बुक हैं, डॉक्टर साहब ने भी अभी वो बताया था, सारे वीट में 10-11 ग्राम फाइबर बताते हैं. ये डिफरेंस क्यों है?
There's 1.2 grams of fiber in wheat, and all other things are just bakwas, okay? Nothing else. And it's not the amount of fiber, it is how it is present. It is just one layer, so it goes off. Whereas in the millets, it is incorporated with the carbohydrate. So it is the slow carb. I call millets a slow carb, SLOW, not low You have to soak and rest the atta and then make chapati. Not like your wheat, soak, don't do that. Minimum of 2 hours rest it. After making the गूनने के बाद 2 घंटे रख के रेस्ट करके रोटी बनाना. वो तो कोई प्रॉब्लम नहीं.
Hello, sir. Hello, panel. Last question from my side. I am Arnab Guha from Impeccable Innovations. It's a startup from Bangalore. And I was there 5 years ago with Dr. Tom. I met him, and I see the same energy even in 2024. And I met him for the first time, even though I'm from Bangalore, and I know Raj. And one question which hits my mind is, I've been working in this millet for last 6 years, and our startup is alumni from IIMR NutriHub. What I see that even though sir is shouting on top of his lungs that millet should be eaten, we don't see millet being adopted in a general mass level also, even in the educated people also. And your digital videos are so powerful for people like us who understand the value. But I think where we all are missing is the marketing link of why people should eat millet. That marketing link, unless people understand, even this pandemic has gone, I don't see people as general are adopting millets. Yes, ma'am.
One is a ready reckoner of the millets I have discussed with Dr. Valli. The material is all available. You know, which millet is good for which biome, as well as where it is available, etc., etc. It all needs to be put together. So we're looking at sponsorships for putting this together. And the second thing is, and bringing it to the masses. This is all a no-profit venture, all three of us, in fact. And the second thing, we are looking at it as an entrepreneurial venture for the youth and by the youth. So we'll be working again on that, and let's see if something works out. Then it's a template for the youth to follow and for the young people. Yeah. So that is about dissemination. And see, you can bring the horse to water. Yeah. You cannot force the
Let me answer your questions. Same questions, different answer. Different answer. Is that doctors and the so-called scientists have to open their mouth. No, sir. I used still the word so-called because they are not telling the truth. They are not telling the truth. Yeah. That's it. Yeah, there it is. Okay. We have to start speaking the truth and tell the public. Because, see, the doctors and scientists have not told that sugar is the problem. Is the problem. Yes. So these problems exist because corporatization of food is the answer. Your question answer is corporatization of food, and decorporatization of food is the solution.
Thank you so much. They are available. Please circulate. Please go to the expo, try the millets and speak to them right here.
You know, Khadar Wali never gets tired, so you can, ask as many questions.
Another thing is all the experts should start eating millets first. That's what I said. I eat only millets.
That's why you have the energy.
So everyone will have the energy.
Define trust, we'd say, trust is knowing someone's got your back and always showing up for you. Trust is taking a leap of faith and having faith. Trust is an unwavering commitment. Trust is a heartfelt choice. Trust is us. Agilus Diagnostics, India's largest diagnostics company. Agilus Diagnostics.
At the colon, using novel patent coating material that forms a shell, protecting the live probiotics from heat and moisture during storage. safeguarding most importantly from gastric acid and bile salts during GI transit. They differ from uncoated or freeze-dried live probiotics, in which probiotics reaching colon drops to even 15%, as they get affected by harsh acid conditions of the GI tract, thus failing to reach the colon in viable quantities and in live form. IntelliCap's technology results are tested and approved by Symposium, Belgium, simulator of the human intestinal microbial ecosystem. World's best advanced scientifically validated dynamic in vitro model of human intestine, delivering viable probiotics at colon for optimal efficacy. The one-of-kind breakthrough for India, made by Morpen in collaboration with Visal Pharma, Belgium, together giving international patented products using IntelliCap's technology, making human lives better, now and forever.
If we had to define trust, we'd say, trust is knowing someone's got your back and always showing up for you. Trust is taking a leap of faith and having faith. Trust is an unwavering commitment. Trust is a heartfelt choice. Trust is us. Agilus Diagnostics, India's largest diagnostics company. Agilus Diagnostics.
Hello.
Probiotics have great gut health benefits. The probiotics we take should reach the colon in viable form for optimal efficacy. Now, what affects this probiotics viability? Heat, moisture, gastric acid and bile salts can destroy probiotics. That's where IntelliCap's technology comes in. This unique technology assures 1,000-fold higher concentration of live probiotics at the colon. Using novel patent coating material that forms a shell, protecting the live probiotics from heat and moisture during storage. Safeguarding most importantly from gastric acid and bile salts during GI transit. They differ from uncoated or freeze-dried live probiotics in which probiotics reaching colon drops to even 15%, as they get affected by harsh acid conditions of the GI tract, thus failing to reach the colon in viable quantities and in live form. IntelliCap's technology results are tested and approved by Symposium, Belgium, simulator of the human intestinal microbial ecosystem. World's best advanced scientifically validated dynamic in vitro model of human intestine, delivering viable probiotics at colon for optimal efficacy. The one-of-kind breakthrough for India made by Morpen in collaboration with Vissal Pharma, Belgium, together giving international patented products using IntelliCap's technology, making human lives better now and forever.
If we had to define trust, we'd say, trust is knowing someone's got your back and always showing up for you. Trust is taking a leap of faith and having faith. Trust is an unwavering commitment. Trust is a heartfelt choice. Trust is us. Agilus Diagnostics, India's largest diagnostics company. Agilus Diagnostics.
a small word with big dimensions. At Mopen, joy is a dream. To do, to be devoted to the cause of humankind, to touch lives with the power of health and healing, the joy of growing together.
Probiotics have great gut health benefits. The probiotics we take should reach the colon in viable form for optimal efficacy. Now, what affects this probiotics viability? Heat, moisture, gastric acid and bile salts can destroy probiotics. That's where IntelliCap's technology comes in. This unique technology assures 1,000-fold higher concentration of live probiotics at the colon. Using novel patent coating material that forms a shell, protecting the live probiotics from heat and moisture during storage. Safeguarding most importantly from gastric acid and bile salts during GI transit. They differ from uncoated or freeze-dried live probiotics in which probiotics reaching colon drops to even 15%, as they get affected by harsh acid conditions of the GI tract, thus failing to reach the colon in viable quantities and in live form. IntelliCap's technology results are tested and approved by Symposium, Belgium, simulator of the human intestinal microbial ecosystem. World's best advanced scientifically validated dynamic in vitro model of human intestine. Delivering viable probiotics at colon for optimal efficacy. The one-of-kind breakthrough for India made by Morpen in collaboration with Vissal Pharma, Belgium, together giving international patented products using IntelliCap's technology, making human lives better, now and forever.
If we had to define trust, we'd say, trust is knowing someone's got your back and always showing up for you. Trust is taking a leap of faith and having faith. Trust is an unwavering commitment. Trust is a heartfelt choice. Trust is us. Agilus Diagnostics, India's largest diagnostics company. Agilus Diagnostics.
small word with big dimensions. At Mopen, joy is a dream. To do, to be devoted to the cause of humankind, to touch lives with the power of health and healing, the joy of growing together.
Probiotics have great gut health benefits. The probiotics we take should reach the colon in viable form for optimal efficacy. Now, what affects this probiotics viability? Heat, moisture, gastric acid and bile salts can destroy probiotics. That's where IntelliCap's technology comes in. This unique technology assures 1,000-fold higher concentration of live probiotics at the colon. Using novel patent coating material that forms a shell, protecting the live probiotics from heat and moisture during storage. Safeguarding most importantly from gastric acid and bile salts during GI transit. They differ from uncoated or freeze-dried live probiotics in which probiotics reaching colon drops to even 15%, as they get affected by harsh acid conditions of the GI tract, thus failing to reach the colon in viable quantities and in live form. IntelliCap's technology results are tested and approved by Symposium, Belgium, simulator of the human intestinal microbial ecosystem. World's best advanced scientifically validated dynamic in vitro model of human intestine. Delivering viable probiotics at colon for optimal efficacy. The one-of-kind breakthrough for India made by Morpen in collaboration with Vissal Pharma, Belgium, together giving international patented products using IntelliCap's technology, making human lives better, now and forever.
If we had to define trust, we'd say, trust is knowing someone's got your back and always showing up for you. Trust is taking a leap of faith and having faith. Trust is an unwavering commitment. Trust is a heartfelt choice. Trust is us. Agilus Diagnostics, India's largest diagnostics company. Agilus Diagnostics.
Requesting all delegates to please move inside. We are about to start our next session. Requesting all delegates to please start moving into the auditorium.
requesting all delegates to please move inside. We are ready to start the next session.
Please move inside. The next session is starting soon. Requesting all delegates to please move inside. The next session is starting soon. Requesting all delegates to please move inside. The next session is starting soon.
Joy. A small word with big dimensions. At Mopen, joy is a dream. To do, to be devoted to the cause of humankind, to touch lives with the power of health and healing. The joy of growth.
Requesting all delegates to please move inside. The next session is starting soon. Requesting all delegates to please move inside. The next session is starting soon.
Now, what affects this probiotics viability? Heat, moisture, gastric acid and bile salts can destroy probiotics. That's where IntelliCap's technology comes in. This unique technology assures 1,000-fold higher concentration of live probiotics at the colon. Using novel patent coating material that forms a shell, protecting the live probiotics from heat and moisture during storage. Safeguarding most importantly from gastric acid and bile salts during GI transit. They differ from uncoated or freeze-dried live probiotics in which probiotics reaching colon drops to even 15%. As they get affected by harsh acid conditions of the GI tract, thus failing to reach the colon in viable quantities and in live form. IntelliCap's technology results are tested and approved by Shyam, Belgium, simulator of the human intestinal microbial ecosystem. World's best advanced scientifically validated dynamic in vitro model of human intestine. Delivering viable probiotics at colon for optimal efficacy. The one-of-kind breakthrough for India made by Morpen in collaboration with Vissal Pharma, Belgium, together giving international patented products using IntelliCap's technology, making human lives better, now and forever.
If we had to define trust, we'd say, trust is knowing someone's got your back and always showing up for you. Trust is taking a leap of faith and having faith.
Requesting all delegates to please move inside. The session is starting soon.
Trust is a heartfelt choice. Trust is us. Agilus Diagnostics, India's largest diagnostics company. Agilus Diagnostics.
Requesting all delegates to kindly move inside. The next session is starting soon.
Joy. A small word with big dimensions. At Mopen, joy is a dream. To do, to be devoted to the cause of humankind, to touch lives with the power of health and healing. The joy of growing together.
Probiotics have great gut health benefits. The probiotics we take should reach the colon in viable form for optimal efficacy. Now, what affects this probiotics viability? Heat, moisture, gastric acid and bile salts can destroy probiotics. That's where IntelliCap's technology comes in. This unique technology assures 1,000-fold higher concentration of live probiotics at the colon. Using novel patent coating material that forms a shell, protecting the live probiotics from heat and moisture during storage. Safeguarding most importantly from gastric acid and bile salts during GI transit. They differ from uncoated or freeze-dried live probiotics in which probiotics reaching colon drops to even 15%, as they get affected by harsh acid conditions of the GI tract, thus failing to reach the colon in viable quantities and in live form. IntelliCap's technology results are tested and approved by Shyam, Belgium, simulator of the human intestinal microbial ecosystem. World's best advanced scientifically validated dynamic in vitro model of human intestine, delivering viable probiotics at colon for optimal efficacy. The one-of-kind breakthrough for India made by Morpen in collaboration with Vissal Pharma, Belgium, together giving international patented products using IntelliCap's technology, making human lives better, now and forever.
If we had to define trust, we'd say, trust is knowing someone's got your back and always showing up for you. Trust is taking a leap of faith and having faith. Trust is an unwavering commitment. Trust is a heartfelt choice. Trust is us. Agilus Diagnostics, India's largest diagnostics company. Agilus Diagnostics.
To please move inside. We are starting our next session.
Hi, welcome back. Requesting everybody to settle down so we can proceed with the next session. Requesting everyone to settle down so that we can start with the next session. So our next session, that is gut and adult health, is an extremely fascinating topic. Remarkably, it is estimated that up to...
This is at Medanta. I, without much ado, will hand over the mic to him as the baton and will apologize for leaving because 3 o'clock is my to leave because there is another meeting I have to go to. I will miss your talk, Dandil, but then I'll catch up with you some other time. Thank you very much.
Thank you, Dr. Reddy. It was an honor to meet you. In fact, you are one of the persons I admire the most since my postgraduate days. Thank you. Good afternoon, friends. I think there are more leaky issues which people are addressing outside than the leaky gut. So possibly after those are addressed, they will join back. May I have my can I move my slides with this? Can I have the slides on, please? Yeah. So this is an area which is quasi-science, and there's a lot of it is in the realm of possibilities that it is there, and it causes plethora of physical ailments, which I'll allude to, but there is very little clinical evidence and scientific data to support that this entity actually exists, and even if it exists, it does lead to those particular disease entities which we attribute to leaky gut. That's why my title, Leaky Gut, the Science and Fiction. Well, human gastrointestinal tract is exposed to load of material. When you eat food, you have various types of materials, proteins, carbohydrates, fats, vitamins, minerals, and along with that you also swallow bacteria, viruses, and fungi and various chemicals. And in today's world, when we are inundated with all these chemicals of pesticides and all, you also ingest those. So, this particular organ is, apart from the skin, gets exposed to possibly the maximum number of, harmful agents. But the good thing is that intestinal lining is a very intelligent lining. It lets in useful substances. They get absorbed, they go into the bloodstream and, fulfill the purpose for which it is there. But there are certain factors, including stress, unhealthy diet, excessive alcohol, and antibiotics and non-steroidal anti-inflammatory drugs. These are the painkillers many of you take indiscriminately. that leads to injury to this particular lining, and this barrier gets compromised, and then it causes increased leakiness of the intestinal barrier. Leaky gut allows then entry of the harmful agents, which it is not supposed to let into the bloodstream, and that affects various organs. And this barrier dysfunction is associated with intestinal diseases, which are very objective, which exists, which there is scientific data, like inflammatory bowel disease, that ulcerative colitis, and Crohn's disease, irritable bowel syndrome, particularly diarrhea predominant, and celiac disease, which is due to gluten hypersensitivity. But it is also associated with many extraintestinal diseases like heart disease, obesity, type 1 diabetes mellitus. I'll talk about many others about which we have positive scientific data, particularly about the cause and effect relationship. Friends, there are many facts and there are many myths, and I'll try to sort them out. There is much folklore and resurgence of interest in leaky gut. In fact, you meet any nutritionist, you meet any nutraceutical person, you meet doctors, and you meet various health experts, and leaky gut becomes one of the major topics of discussion. And this has now acquired the dimension of leaky gut syndrome, because it is assumed and people have firmly in their belief that this does lead to disease entities. And popular perception is that leaky gut is like a wall where there's a door, and you kick open the door, and that lets the entry of multiple harmful agents, and this leads to increased permeability and consequent access to bloodstream of many chemicals, intact bacteria, and host of dietary and microbial components. Assumption of this is as primary abnormality is in various diseases which are diverse, like food intolerance, fibromyalgia, chronic fatigue syndrome, and autism even. The intestine is supposed to serve this purpose, that the food goes in and it gets absorbed. So this is what the intestinal lining is. This is the lumen, and through various pathways of diffusion or active transport, through the lining of the intestine, these food materials and useful substances get to the other side of the lining and ultimately into the bloodstream, which is where it serves the useful purpose. But it is supposed to stop harmful and unwanted entries, and so we must understand what is this gut-brain, what is this intestinal barrier, to understand what leads to its leaking. It's not a single wall with a door, it is a process, and it starts with even the gastric acid, bile juices, pancreatic secretions, which not only digest the food, they also emulsify and denature the bacteria and viruses which we ingest, or fungi, and various active antigens or harmful substances which are, or chemicals which are ingested. Then there are commensal bacteria. Commensal bacteria, with the bacteria which are present in your intestine are your friends who have, they are like your pet dogs or pets in your home, and they are there and they prevent the stray dogs coming in, so they do not let the harmful bacteria colonize the intestine. Then there is a microclimate on the lining of the intestine, which we call microclimate, and it is made of mucus layer. And mucus layer is like a thick, sticky solution on the lining of the intestine. It prevents bacteria, because bacteria have to stick to the wall to enter. But it prevents them from sticking, not only by physical barrier, but also because they secrete an antibody, IgA, which is a secretory antibody, which is present in the mucus and which prevents the adhesion of the harmful bacteria, and this also acts as a physical barrier provided by glycocalyx and mucus. Then after the mucus, there are these epithelial cell tight junctions, which are very important, because these are like you put bricks together with cement, and they do not let the seepage happen. Similarly, the cells of the intestine are stuck to each other, but they are not like inert like bricks. They are active substances which let the useful substances go in, but shut the door when a harmful thing is to enter. So then even if there's something enters there, there are these Paneth cells, which are like the sentry on the top of the watchtower in your boundary wall, which has the guns. So this has defensins, which are chemical substances which get excreted, and these denature any bacterial products which enter the intestinal epithelium, and then even the lining of the intestinal mucosa beyond the epithelium, which is lamina propria, has immune cells which are like the second line of defense for preventing these harmful bacteria from entering. So nature has created a huge defense mechanism in the intestinal wall to ensure that it only imbibes good things and blocks the bad things. And this is what what the anatomy of the lining is. That there is this intestinal lining which is full of these commensal bacteria which line the mucus, then the mucus which has got IgA secretion, and it is a sticky layer which prevents it, and then these are the tight junctions these are the cells which prevent it from entrance, and if they enter, there are various immune cells which neutralize these harmful substances. And if you look at the tight junctions, you see this is how normally the intestinal cells are holding hands together, so not letting anything enter. But then there are certain substances in your food or certain toxins which secrete a substance like zonulin, which loosens these junctions, and these junctions become weak. And what are these substances which secrete zonulin? These are very commonly eaten substances like sugars, fats, and then not only this loosens the junctions, then these junctions get separated, and now it's like an open gateway for entry of the harmful substances, and then this starts immune cascade, and then the injury to the intestinal wall, which leads to certain intestinal diseases. So there, in spite of a strong barrier, some harmful substances will always get through. So let's talk of substances which affect this barrier, because they are very important to know. Gut microbiota. Gut microbiota is what's the bacteria which are present in your intestine. You have more than 100 trillion bacteria, almost weighing 1.5 kilos in your intestinal tract. So we are actually teeming with these bacteria, and these bacteria are both useful bacteria and the harmful bacteria. As long as the balance in your intestinal system is towards the more good bacteria than the harmful bacteria, you will remain healthy. And this microbiome not only affects the intestinal health, it also affects the your immune system, and it is now known that it will affect practically all your systems of your body. And these can either, there are certain bacteria like Bifidobacterium, like lactobacilli, various species which strengthen the barrier, but then there are certain bacteria which are harmful, certain varieties of E. coli, and they are harmful, and they can cause damage to the gut barrier. Antibiotics, they are one of the main culprits today, which affect these intestinal bacteria and create more bad bacteria, kill useful bacteria in your intestinal tract and lead to ill health. Alcohol is another substance which is, that alcohol can dissolve fats, lipids. People who drink significant amount of alcohol, their alcohol causes damage to the mucous membrane, because it takes away the fat content, lipid content of the mucous membrane. So the mucous membrane is normally hydrophobic, that it expels the water. It sort of rejects the water from coming in contact, but when alcohol is taken, the alcohol emulsifies the lipids in the mucous membrane. Now this mucous membrane is no longer protective, and that causes leaky gut. And human studies have shown that acute stress, the stress, whether it is in terms of the physical stress of marathon running, long skiing and all, this can also cause effect on the intestinal barrier and can cause leaky gut. Even it's known that babies born to mothers who are stressed in the preterm period have different bacterial population in their guts and are prone to anxiety and depression subsequently. Diet is another factor apart from these factors which I mentioned, and diet strongly influences the microbial composition and function of the gut. And diet which is rich in carbs and the fats, which is what the modern Western diet is, causes significant effect on the gut intestinal barrier, and it causes damage to it. It produces leaky gut. Long chain fatty acids influence the intestinal permeability due to alteration in tight junctions, which I told you, the cells of the intestine which are held together. Fructose, glucose and sucrose are implicated in increased intestinal permeability and dysfunction of the tight junctions, and these are main culprits today which lead to weakening of the gut barrier. Emulsifiers in the food, we don't even realize. Outside everybody was telling me, why don't you eat the blueberry ice cream, very delicious. Now, what makes the ice cream so, so creamy? You have to add emulsifiers, because when you have to combine water with lipid, you need to put in a substance which can make it into an emulsification. These are very important. I'll just touch on that again. Then there are certain good things in your diet. These galacto-oligosaccharides, what are these? These are present in beans, chickpeas, so hummus is good, and the peas. So these are the things which have got these galacto-oligosaccharides, which are beneficial for the intestinal barrier. And then dietary fiber is one of the main things which has been shown to help in improving the gut intestinal barrier. This is just a word about the emulsifiers. I told you that whenever you have to mix two substances which very different surface tension, like oil and water, you need something to make an emulsion, and you need a substance which is emulsifier to make it into a homogenized substance. And these are food additives, preventing liquids from normally don't mix up they don't let the material separate out. If you do not have an emulsifier in a chocolate, your chocolate in the room temperature will have a white surface. You will find at times, the poor quality chocolates, which so-called poor quality chocolates, have a whitish coating after some time of storage. But emulsifiers prevent that. They also give texture to the various type of foods, and commonly used in breads, chocolates, ice cream, processed meats like sausages and margarine. And these emulsifiers not only emulsify the fat in the food, they also emulsify the mucous membrane. So they also lead to significant damage of the intestinal barrier. The 6 top triggers for leaky gut are refined sugars, dairy, gluten, medications, environmental toxins and infections. This is a slide just to show that there has been scientific data now that excessive endurance exercises like biking challenge, running challenge, they have been studied scientifically, and they have been shown that you can measure the worsening of the gut permeability after these exercises. So is with the non-steroidal anti-inflammatory drugs, and particularly in late pregnancy. Our problem is that while we talk that this is causing leaky gut, this is not causing, the instruments with which we can measure whether a substance is creating leaky gut is non-existent. There are oral saccharide probes that you give certain substances and try to retrieve them in the urine to see whether they are getting absorbed or not. They are very, they are very poor, not standardized. The endoscopic measurement with the confocal microscopy to detect fluorescein leak or impedance measurements are there. You can do it on biopsies, but overall these tests are not very reliable. So diseases associated with increased intestinal permeability are of two types. One are primary intestinal diseases, which I told you we have objective evidence and scientific data that these are associated with leaky gut. Whether leaky gut causes them, thank you, we do not know, because there is no evidence that leaky gut causes it, but the leaky gut exists with these diseases. And these I have listed here. And non-intestinal diseases, these are the ones which there is total lack of scientific data, but lot of interest in them: asthma, autism, Parkinson's disease, multiple sclerosis, eczema, psoriasis, and a whole lot of disease, including non-alcoholic fatty liver disease and alcoholic liver disease, rheumatoid arthritis, pancreatitis. You know, people believe that they are also caused by the leaky gut. How to manage leaky gut? The research at present is in treating the intestinal permeability is mostly based on avoidance of high amount of sugars and fats. If you avoid sugars and fats in your diet, you can prevent the leaky gut. FODMAP diets, I think most of you are familiar with it. These are fermentable oligodisaccharides and monosaccharides and polyols. And if you take FODMAP diets, the leaky gut can repair. Certain substances like glutamine, short chain fatty acids, and quercetin. Quercetin is present in blueberries, citrus fruits, apple, olive oil, grapes, like all dark berries have quercetin, and this helps in repair of the leaky gut. Then there are certain vitamins A, D and zinc are supposed to help in improvement of leaky gut. So these are the substances, short chain fatty acids or galacto-oligosaccharides. I'm just finishing in next minute. Fiber, they help in improvement of permeability, while the long chain fatty acids, ALA and GLA and sugars, they worsen the permeability. The other intervention you can have is probiotics. That if you give probiotics, particularly containing various species of lactobacilli and bifidobacterium or Saccharomyces boulardii, then you can actually improve the intestinal barrier function. And as I told you, at present we think that there are a whole lot of diseases which may be linked with leaky gut, but we need to produce data apart from this group of diseases which we are very certain about. Rest are all still need to be established whether they are related to leaky gut. So friends, to summarize, there is a resurgence of interest in the intestinal barrier damage by certain nutrients and stress leading to leaky gut syndrome, and this is we attribute a multitude of clinical conditions to this leaky gut. Diets rich in sugar, fat and non-steroidal anti-inflammatory drugs, alcohol and emulsifiers in your food cause leaky gut, while there is significant scientific evidence of increased permeability in IBD, and such evidence is lacking in non-intestinal diseases. Unfortunately, probiotics, FODMAP diets low on sugar and fats, galacto-oligosaccharide rich diets, fiber, glutamine and quercetin, vitamin A, D and zinc possibly will help you prevent leaky gut or repair leaky gut. Thank you very much for patient hearing. Are there question answers or?
So we'll do question answers.
Okay, at the end?
Yes.
Okay.
Thank you, sir. That was very, very interesting. And I think there was a dearth of time. Otherwise, leaky gut and intestinal permeability and zonulin, even Dr. Tom spoke about it in the morning. I myself have so many questions, but just time doesn't permit. We'll try and do a nutshell Q&A at the end. But without much ado, we have a very, very interesting panel discussion coming up. And for that, I have Dr. Vivek Nangya with me on stage. Dr. Nangya is India's pioneering pulmonologist and also the principal director and head of Max Hospitals. With him, I would like to welcome Dr. Chandrakant Laharia, who's a consulting physician and a health policy specialist. Also with us, we have Dr. Ashutosh Shukla. And Dr. Shukla is the head of internal medicine of Max Gurgaon and a director there. Also, he runs this very novel integrative health clinic in Gurgaon, one of its kind in India, and they offer holistic health solutions. Also, they use AI and other cutting-edge modalities to reverse cardiometabolic syndrome. So, a big round of applause for everybody, and I will give the mic to Dr. Nangya to take it further with the panel discussion. Thank you.
Thank you, Arjun, for those kind words of introduction, and thank you, Ishi, for inviting me here. I think it's indeed a proud moment to be a part of this, I would call a revolution that we are creating by talking about all these things which are hardly spoken. Here, believe me, leaky gut, what we're going to discuss next is all very new concept to all of us in our quest to all the time providing good standards of healthcare and improving the lives of people. We've come across a very intriguing syndrome, which is called the cardiometabolic syndrome. It is more complex than we actually think, although the name suggests cardiac and metabolism. But if you go into the depths of it, as we will in the next 15 minutes, the presentation, our discussion has been slashed down because of lack of time. But all the same, you will realize that it's really a complex interplay of so many factors in our body. And it's indeed my honor to have two very senior panelists with us, Dr. Ashutosh Shukla and Dr. Chandrakant Laharia. Dr. Alok Chopra couldn't be here due to some exigencies, but I'd request Dr. Randeep to take over his role and probably help us with some of the queries that we may have. So what is cardiometabolic syndrome? The cardiometabolic syndrome basically represents a constellation of metabolic abnormalities that are risk factors for cardiovascular diseases. The widespread prevalence of CMS has positioned it as a pressing global public health concern. It is now been recognized by WHO also, and the name has been coined by WHO itself. There's a huge surge in its prevalence, and that has been attributed to our sedentary lifestyles, obesity, which is almost like an epidemic in our country as well. According to the data from WHO, CMS affects almost 25% of the global population. The impact is not just limited to the developed world, it is also as much a part in our developing countries like our own India, the middle income and the low income group. And this again is being attributed to switch over from the traditional diets, the classical Indian diet, millet-based diet, to the Western style of diets now. This is the prevalence, as you can see. It ranges from 18% in Africa, probably because of the poverty there, to about 34% in North America, where obesity is almost like an epidemic. So the richer the country, the higher the chances that they would be having this cardiometabolic syndrome in a huge, huge number of population. So imagine 34% of the entire American population is suffering with one or the other form of cardiometabolic syndrome, which is like 1 in 3 Americans. The main link, the main pathogenesis, if you look at, the obesity plays a major role associated with insulin resistance, dyslipidemia, hypertension, and a pro-inflammatory state. I'll just come to all of these. So the relationship between obesity and cardiometabolic syndrome is bidirectional. It is obesity fostering insulin resistance and cardiometabolic syndrome promoting further weight gain. Obesity also contributes to a pro-inflammatory state. Moreover, obesity can also lead to dyslipidemia. Then you have insulin resistance, which is a hallmark feature. That means the body is secreting insulin, yet the sugars are not getting metabolized. Insulin resistance refers to the reduced sensitivity of cells to insulin. This phenomena leads to elevated blood glucose levels in the body, setting the stage for the development of type 2 diabetes. So this is typically the vicious cycle that patients follow. They feel tired and hungry, eat more food, make insulin, but there's insulin resistance. Sugar stores keep going up, they keep gaining weight and feeling tired and hungry all over again. Then is the dyslipidemia, which results in elevated triglyceride levels, increased levels of small, dense LDLs also, And it is the larger LDL particle which is more harmful. And again, dyslipidemia is related to liver, intestines, vascular pathologies, pancreas, muscles, practically the entire body. And then we have the very well-known hypertension, the increased blood pressure. The link between hypertension and cardiometabolic syndrome again is bidirectional, with insulin resistance leading to obesity, contributing to hypertension, and hypertension exacerbating insulin resistance. And then at the bottom of it all is the pro-inflammatory state, where there is a constant low-grade inflammation in the body. So my first question is to Dr. Ashutosh Shukla, that Dr. Shukla, what is the difference between good inflammation and bad inflammation, and how does bad inflammation lead to a cardiometabolic disease?
Thank you, Dr. Nagia. Good inflammation is something which is a way in which our body protects us. I mean, when you get hurt, or say if you get burned, there is some swelling, there's redness, there's tenderness. That is what is good inflammation. But as they say, too much of anything is bad. So if this good inflammation gets too much or it gets awry, then it leads to a low-grade chronic inflammation. And low-grade chronic inflammation initially starts from the gut and then spread all over. Primarily, it has multifactorial because there has to be a kind of a genetic vulnerability along with environmental factors like diet, what kind of a lifestyle you lead, and that leads to certain changes in the gut microbiome. And at the endothelial lining level, there are these about 30 neurotransmitters or hormones which are more or less the same which are there in the brain, and they are connected with the vagal nerve. And this gets disrupted by the low-grade inflammation. And this chronic low-grade inflammation starts very, very much earlier than the disease presenting itself. And that's how that kind of smolders and then starts manifesting as a disease process. And because it starts in the gut, so if you have a healthy gut, you can reverse these disorders. So what we have started using is, we have started using AI as a tool and machine learning to understand our patients' metabolic disruption in a very detailed and a personalized way. And that has helped us tremendously. And we've been able to cut down their medications, and the moment the pill burden goes down, patients start feeling better, and patient outcomes are very good.
Right. So it's the smoldering low-grade inflammation that is causing so many problems in the body. So Dr. Sood, I wanted to ask you that, do you think there's a common mechanism for cardiovascular illnesses and specific microbiota, or with the leaky gut? Is there some link between the two?
Today we implicate changes in microbiome in various disorders, and the metabolic disorders, including cardiometabolic disorder as well as the non-alcoholic fatty liver disease, has been linked to change in microbiota. It is less well understood objectively. It is cause and effect relationship is assumed rather than proven. So it definitely affects, and your diet affects, as I showed earlier, the diet affects the intestinal microbiome, as well as the ability of microbiome to affect the system. Because unless the bacterial product which can go across the intestinal epithelium into the bloodstream, it cannot affect rest of the systemic organs. So definitely there is a relationship with it.
So microbiota, gut microbiota has a very important role to play in producing this inflammation there. Dr. Laharia, what is your opinion about gut microbiota and diabetes? Is there a correlation between the two also?
Thank you. So Dr. Sood made a very comprehensive presentation. He said it's a quasi-science. I'm not sure I agree with that, but definitely this is an evolving area where there is more to be known. So what we know that gut is a multifunction organ which is supported in its function by the microbiota. So there is an important role of microbiota in any function with gut play, and gut play function in metabolism and protective function. And when it comes to diabetes, some of the people who work in diabetes often say, oh, well, diabetes start in the gut. Now, that might be exaggeration, but that is very close to the truth also. What we know that there are studies on type 1 diabetes which say that people who have type 1 diabetes have a continuous low rate of inflammation in their body. And some of the markers are also high, inflammatory markers are also high. What we also know that gut produces a lot many hormones, and when there is a dysbiosis and there is a disturbance or perturbed microbiota, it results in an imbalance of those hormones, and which influence the sugar levels. There are studies, of course, Dr. Nangia, you also highlighted about that obesity and insulin resistance is closely linked with this thing, but there are like enzymes such as fatty acid synthase, which helps in metabolizing fatty acid synthesis. And when insulin resistance is there, this decreases and it results in a more insulin resistance. So there are clear and closer linkage in gut and diabetes. There is a lot many studies going on. There is one study that microbiota and insulin longitudinal evaluation study, MILES study is going on global level, where they are studying that what are the different microbiota, especially the focusing upon those which are short chain fatty acid, and they are looking at butyrate and other things, that what is the label of butyrates and other short chain fatty acid and different microbiota, and what is the linkage with the insulin or diabetes. In short, to summarize that this is an area where we are learning a lot, our understanding evolving, but we are definitely getting a better understanding. Initial indication clearly suggests that there is a greater linkage of gut health with diabetes than we earlier thought. Thank you.
Dr. Sood, would you like to say something, sir?
There is a very interesting, small but very important study. The fecal transplant, the microbiota transplant was done from obese individual, from thin individuals to obese individuals. And there was a significant weight loss in these obese individuals. And similarly, the similar study was done in OB mice. And you see that if the microbiota is transferred from one type of phenotype to other, you can change the phenotype. So there is definite evidence that the gut microbiome is linked with the signaling which leads to obesity, and if obesity is the core of various arms of cardiometabolic syndrome, then that is how it gets linked.
In fact, I'm sure you will correct me if I'm wrong, that even for critically ill patients, there's a lot of studies which have talked about the gut microbiome and this fecal transplantation to help these patients who are in sepsis and septic shock and so on, multi-organ dysfunction especially. So this is really an evolving field, ladies and gentlemen. So these are the criteria for the cardiometabolic syndrome, which I'll just skip. The pivotal mechanisms behind this are the adipose tissue dysfunction, the genetics, lifestyle disorders, poor diet, and a hormonal dysregulation. The pathophysiology, again, if you see, it talks about chronic inflammation, insulin resistance, and adiposity. So Dr. Laharia, what is the relevance of gut health for liver? You know, NASH is something which is becoming very, very common now, non-alcoholic liver diseases. So what do you think about gut health and liver?
So, gut health and all organs of body, including kidney, liver, heart, and all of those have a relation. But in the context of liver, there are two areas which I would like to highlight. One, what we discussed about leaky gut situation, which the microbiota from gut can get translocated to the liver, and which can result in liver injury to the liver. That's the one mechanism. That second thing is that liver is also immunological organ. So whenever there is an inflammation in the body, it gets started on an innate and adaptive immunity, and then it can also result in production of some of the harmful substance, and that can also cause hepatic injury. So a dysbiosis in the gut essentially will affect the liver by translocating the microbiota to the liver and getting it activated, but also immunological injury to the liver. Thanks.
One thing that I would like to mention here is that it is not just restricted to the cardiometabolic syndrome is not just restricted to your cardiac health and the metabolic health, but also to certain autoimmune diseases, neurological diseases, even cancer. Prostate cancer has also been linked with the cardiometabolic syndrome now. And of course, there could be developmental disorders, psychiatric, socio-behavioral disorders, so on and so forth. Type 2 diabetes becomes almost 5-fold higher. Cardiovascular diseases increase by 2-fold, and there's a chance of non-alcoholic fatty liver disease, certain cancers, and sleep apnea. I'll come to sleep apnea as just a short comment in the end, which is also driving your the low-grade subtle inflammation in the body. So the approach to cardiometabolic syndrome comprises personalized medicine, lifestyle intervention, and only very few pharmacological interventions. So you need to control your weight, you need to control your insulin resistance, hypertension, quit smoking, and correct the abnormal metabolism. Dr. Sood, I wanted to ask you that what are the advances in postbiotics? A lot of people ask us that would taking a probiotic help or not? Is that good for somebody to be taking probiotics to improve the microbiota?
Probiotics can improve the microbiome temporarily. Unfortunately, there has been no studies to show that you can alter a person's innate microbiota by taking a probiotic for a very long time, unless you totally irradiate the basic gut bacteria and repopulate it with the new bacteria. This has only been done in the experimental mice, where if you give them different spores or different bacteria, you can repopulate. But yes, probiotics will help you for a period of time as long as you're taking them, but they cannot repopulate the intestinal microbiome.
It's more about the overall lifestyle that you lead. So have a healthy diet, live a physically active life, get your adequate 7-8 hours of sound restful sleep, avoid stress, practice yoga, and avoid alcohol smoking, and avoid antibiotics and painkillers if not required.
So you think those are your recommendations for reducing the low-grade inflammation?
So chronic low-grade inflammation is bidirectional actually. It starts from the gut to the brain, from the brain to the gut. So it's not only the microbiota, but it's also the kind of lifestyle that you lead. So if you are leading a healthy lifestyle, obviously your microbiota is more healthy, and the low-grade chronic inflammation tends to subside gradually over a period of time.
So Dr. Haria, do you think gut health is not considered a sufficiently big public health problem? Do you think it's being underestimated even now?
Yeah, that's true, partly because much of the work on gut health has been focused on individual health. But considering all of the individual or family member have a shared microbiota in some sense, and then entire community also shares some of the microbiota. So this is an area where we need to look at the broader public health perspective. So currently it is individual health issue, but it's time that it is seen as a broader public health issue. And also specifically in context of increasing use of antimicrobials or antibiotics. So and AMR is rising, and which is disturbing or perturbing the gut health or gut microbiota. So it is even more relevant that we pay attention as a gut health as a public health challenge.
So I think we've had a very good learning session this afternoon. I don't know about you all, but I think I am going back much more learned. Till now, I always thought it's only the sleep-related breathing disorders or sleep apnea which is causing a low-grade inflammation in the body, which was actually been linked to probably every possible disorder, including cancers, cardiac, cardiovascular, neurological, lung problems, kidney problems. But this is a new thing that is emerging now, that the gut microbiota also plays a very important role. What you eat plays a very important role. Dr. Sood did share with us that alcohol, sucrose, sugar-related foods, ice creams, all NSAIDs, all those would damage your gut, but the idea is to give up all this and live healthy. You know, I'm sure Dr. Sood also shared the healthy foods with us that we need to shift over to. So with those words, I'd like to thank my panelists, for giving their contribution and enlightening us this afternoon. If there are any questions from the audience, we could probably take one or two if Arjun allows.
Any questions? Maybe we can take three.
Dr. Sood is always helpful. One more example is here. Sir, addition of probiotics along with antibiotics, is it an eye wash or asymptomatic relief only?
Actually, there is marginal benefit, not significant benefit, and these are more of marketing gimmicks when you combine an antibiotic with a probiotic. Rather, following probiotics after taking a course of antibiotics makes more sense, because these various species are antibiotic resistant. That's why people do give them simultaneously. There's not much of evidence that taking probiotic will help you in preventing antibiotic-associated colitis.
Thank you, sir.
But just a word which I think none of us mentioned, dietary probiotics taken as fermented foods is a very important source. And even fermented pickles, even kimchi, kombucha, your curd, all this has probiotic properties and doesn't cost much. So I think introducing that to diet in reasonable amounts can also be useful. Kefir, yes.
Right. Thank you. Thank you all for participating in this very interactive session.
We should have a louder round of applause. We've all had dessert. That gajar ka halwa should be translating into some action. Dr. Nangia, that was very well done. Thank you so much. Okay, now 50% of the planet, right? So we better take up our health. I would now invite the panelists and the chair for the next session, the participants, Dr. Neerja Hajela, Dr. Neeram Kre, Dr. Raka Guleria, and Dr. Anupam Kumar Anveshi. May I please request all four of you to join us on stage? Dr. Neerja Hajela, yeah, she's right here. Dr. Neelam Clare, I can see. Dr. Raka Guleria, there she is. And Dr. Anupam Kumar Anveshi. Please join us on stage. AV team, can we have Dr. Jill Canahan's video play while everybody settles down? Very, very briefly for a minute. The longer video will be available for all of you to watch.
A very good evening and greetings to all eminence. A very
Okay, then let's wait.
Well, hello everyone, welcome back, and it is my privilege to introduce to you, for anyone who does not know, Dr. Jill Carnahan, my dear friend, Dr. Jill Carnahan. What can I say about her? We're both teaching faculty at the Institute for Functional Medicine. She is such a wonderful clinician and so knowledgeable as a teacher, but as a clinician, she has a 5-year waiting list. Patients want to see her as a new patient. It's a 5-year waiting list because everyone just loves this woman and they love the results and how they feel with working with Dr. Carnahan. There are some secrets there that I'd like to pull out here in the next 20 minutes. So Dr. Jill, thank you so much for being here with us today.
You're welcome, Dr. Tom. It is my honor and privilege to be here.
Thank you. Thank you. So people can learn, and in this conference, they're learning a lot of great information. It's overwhelming. There's so much. If you hear just one speaker, you go, oh, that's a really good idea. And then you go home, you might be able to implement some of that. But when you hear 10, 12, 15 speakers, and they all have very good points of what they're making, how do we put priorities into what to do tomorrow morning? Where do you start with the patient when you know there's so much that they have to learn about?
Tom, this is a great question because I see the patients even sitting in front of me and their eyes get wide and they're hearing all this great information and you know they want to feel better.
Yeah.
But when they hear all of these points and things, sometimes it can be absolutely too much to do. And then the easy thing to do is do nothing. So you sit there and because that's the easy answer, this is overwhelming, you shut it off and you do nothing. So what I like to do is find out what matters to you. Is it that you want to go on a mile hike with your granddaughter? Is it that you want to sleep and wake up refreshed? And it's often the simple things of life, the connections with other human beings, with our family members, with our friends, with our pets, or maybe it's you love to cook and create amazing meals for your family or friends, or maybe you love to you're a writer, or you're someone who reads and interprets, or a journalist, and I could name 100 other things. But what you want to do is find out what would make my quality of life better. And then you say, okay, this is my goal, because that goal is something you're going to allow yourself to be driven towards. It's going to be easier because you have an end goal. So let's say I want to walk a mile with my granddaughter once a month. Well, that goal requires us to put in place some habits. And what we can then do is go backwards. It's called reverse engineering. And we can say, what habits, what daily things that we put in place would actually allow me to do the things that I love in life. And often people are exhausted, or they have headaches, or they have migraines, or they have gut issues, so they can't cook the meals they love, or hike with their granddaughter, or do the creative things they love to do. So if we reverse engineer, then I can say, okay, I want to help you to your goal. And it starts with food. Food is medicine. So how do we incorporate daily habits of the things that you put as fuel into your body? If you had a sports car that was really expensive, you would not put the cheapest gasoline into it. You would choose premium fuel, and it's no different from our bodies.
That's an excellent,
Thank you, AV
overview
team.
and a way of thinking of it. So you may focus.
Thank you so very much. We'll have the rest of it's almost a 15-minute video, and you can watch it on the CSI website, as well as it will be sent to the emails of the participants. I'd now like to introduce Dr. Neerja Hajela as the person who will be chairing this session. Dr. Neerja Hajela is from Yakult, India, and we've been very, very fortunate to have her guide us on and off about all the gut probiotics and how we benefit from having Yakult and the rest of it. And she's of course here to chair and introduce her panelists. Over to you, Dr. Hajela, and I hope we have a fantastic discussion because women do make up 50% of the planet, so please remember that.
Thank you, Pooja. Thank you. At the very outset, I'd like to congratulate ISHI and the Celiac Society of India for organizing this very timely and important symposium on gut health and lifestyle disorders. So there has been immense learning since the morning. We've been hearing about the gut being central to almost all aspects of health. And while we believe that the gut was just about digestion of food, absorption of nutrients, and removal of waste material from the body, we now know that 70% of the body's immune system is found in the gut. It is the largest immune organ. It has its own enteric nervous system, and therefore it is also the second brain of the human body. About 30 neurotransmitters are being made in the gut, and it is linked to the brain through the gut-brain axis. But now what allows the gut to function? And we've also learned today that we are more microbes than human cells. We're at 10 trillion human cells, and we're 100 trillion microbes. And these microbes, most of which are located in the gut, they basically influence several mechanisms. So they tell you whether they're going to be pro-inflammatory or anti-inflammatory. They decide whether they will ensure a strong intestinal barrier or so-called leaky gut. And they also tell you whether the food that you're eating is going to get converted into a short-chain fatty acid, which is a very important source of energy, or it is going to get converted into poisons and toxins, which can then get entry into the circulatory system through the leaky gut. So while we heard today that a lot of these microbes, majority of them are in the gut, but today we know that almost every part of the human body, including the intrauterine environment, is bathed with microbes. So the amniotic fluid, the placenta, bathed with microbes, and these microbes They vary in types, numbers, species, in pregnancy, during preterm, in health and disease. And with that, I invite Dr. Neelam Clare. She is going to, so that's why this session on gut health and women. So basically, Dr. Neelam Clare is going to dive deeper into the subject. And we have her. She is the chairperson of neonatology at Sir Gangaram Hospital. And we welcome you, Dr. Clare, for a very interesting presentation on.
Thank you. And thank you, Ishi and Sarath, for inviting me here to a wonderful symposium on gut health and lifestyle disorders. Just to set the stage, and since I have 15 minutes, we have something like 26 million women who become pregnant every year. And out of them, 1 million deaths in utero happens. That's what is called as stillbirths or silent deaths, which is death in utero. And 1 million baby born after birth do not survive because of certain problems. They are born preterm, or they have infection, or they have other problems. So we are talking about the gut microbiome of pregnant women, and it not only affects them, but it also affects their offspring. So we are actually talking about 52 million lives, and it is unfortunate that I have 15 minutes. I thought I could complain on that ground. So when we talk about the impact of the gut microbiome, we are talking about not only the gut in the pregnant women, not only the gut in the health, but also in disease. Because as we know that, even in healthy women also, when they become pregnant, their gut microbiome changes. And it is not only the gut microbiome, it is also the vagina, the oral cavity, the skin, and the milk which they produce for their baby. The microbiome or the microbiota changes. As you've been hearing since morning that there are more than 1,000 species, and there is a diverse population, and the number of microbial or microbiota cells is huge and outnumbers in their genotype. So when we talk about the maternal gut microbiome and what kind of changes it undergoes during pregnancy, we know that it is not only the maternal gut microbiome which is during the health, but also when the health of the woman during pregnancy is complicated. Unfortunately, we have limited understanding of the clinical and the environmental factors that can impact the maternal gut microbiome during pregnancy and what are its consequences. Because it's just in last 2 decades that we've started understanding that the fetus is not lying in a sterile environment. Before that, it was thought that probably fetus is lying in the sterile environment, but once DNA was isolated from the placenta, it was known that the environment of the fetus is also inhabited by the microbiota. So there are a lot of factors which shape the maternal gut microbiome during pregnancy and its role in the development of pregnancy and the complications during pregnancy which could affect both the mother and the infant. So when a woman embarks on the journey of pregnancy, her womb, her system starts preparing. She starts getting the hormonal, immunological, and metabolic changes because there is a new life which is developing inside her body. There are alterations in the gut microbiome. There are downstream effects that could play a major role in the development of pregnancy-related diseases. We'll be talking about these pregnancy-related diseases and how it leads to important consequences, not only on the mother, but also on the infant's health. Gut microbiome being a modifiable organ, as you've been hearing since morning that a lot of research is going on fetal transplant and other alterations in the microbiome, it's an attractive intervention to prevent such diseases which are related to the microbiome. So as I already said, that the myth that fetus lives in a sterile environment has been broken, and we know that the infant lives in a colonized environment, and also the infant's gut gets colonized after birth, right at the time of birth by the vaginal microbiome of the mother if it is a vaginal delivery. But if it is a cesarean section, then the infant fails to get that colonization, which is not in the interest of the baby. So that is why, with the increase in cesarean sections, that opportunity of gut being colonized is missed. So if we look at what are the factors which shape the maternal gut microbiome before and during pregnancy, as we know, it is the diet of the mother before pregnancy, her weight, her exposure to the drugs, especially antibiotics, non-steroidal anti-inflammatory drugs, metformin. Many of the women are on metformin because of PCOD. If the mother has inflammatory bowel disease, like about which Dr. Sood was speaking in the morning, certain genetic reasons and her environment. And during pregnancy also it is her diet, exposure to drugs like antibiotics, experience with the previous pregnancies, and her weight, which will govern her microbiota and her healthy microbiome and dysbiosis. If you look at the gut microbiome and what are the metabolic changes which happen in the pregnancy, as you heard in the morning, that basically the gut microbiome lives on the complex carbohydrates. They digest them into short-chain fatty acids, and these short-chain fatty acids could be butyric acid, could be propionic acid, and that regulates the metabolism and the immune system, and also prevents obesity, prevents diabetes, and prevents hypertension. But if this does not happen, the gut is colonized by unhealthy microbiota, then probably the microbiota start consuming the layer, the protective layer, which is supposed to prevent the microorganisms to get into the blood and cause inflammation. So let's look at gut microbiome and obesity in pregnancy. As you know, that obesity is increasing over the years. And in India, we have a double jeopardy. We have on one side malnutrition. We have 40% of the women, especially in the rural population, who are malnourished, undernourished, and stunted. But at the same time, the incidence of obesity is increasing. And it is to the tune of 12 to 13%, which is pretty high for a developing country like India. When we talk about obesity in pregnancy, it also includes the postpartum obesity. And as you know, the adverse effects of obesity are gestational diabetes mellitus, hypertension during pregnancy, complications during childbirth like a large baby or a giant baby which can have problems at with the birth, and congenital defects. So a gut microbiome is a metabolic organ of the human body that its imbalance will not only affect the obesity, but also diseases related to the obesity like hypertension and gestational diabetes mellitus. So when we look at the criteria for obesity during pregnancy, we take into account what was the pre-pregnancy weight. So if you are already in the obese range or in the overweight range, then the allowance of the weight is much less as compared to if you are normal or you are underweight. So how gut microbiome in obesity in pregnancy affects? So there's a lot of data and a lot of studies which show that there is, with the excessive weight gain, there is increased concentration of bacteroids And this imbalance and increase in the bacteroids ultimately lead to weight gain, biochemical changes like changes in the transferrin, high density lipoproteins, cholesterol, and triglycerides, including plasma cholesterol. So gut microbiome are closely related to gestational obesity, and intestine may be an important organ for regulating the maternal lipid metabolism in obesity. So we'll be talking about what intervention probably in the future could help us. So gut microbiome is very closely related to the gestational diabetes. As you know, that gestational diabetes is the diabetes which is related to the pregnancy. And if we look at women who become pregnant and have diabetes, 80% of them have gestational diabetes. So gestational diabetes is which only occurs during the pregnancy because of abnormality in the function of beta cells. And after pregnancy, usually it settles. But minded, these women or these patients are pre-diabetic and they are prone to develop diabetes later on. In India, we have a very high incidence of gestational diabetes to the tune of 5 to 14%. And mind it, here both the mother and the baby, if a mother has developed GDM, they need attention because they have a higher risk of developing diabetes later on. So in diabetes, especially the gestational diabetes, there is dysbiosis, which leads to increase in the microbiome, which is related with unhealthy gut and gut inflammation, and decrease in the microbiome, which is related with a healthy gut. So this leads to alterations in the amino acid and bile acid pathways. This leads to more release of endotoxins, lipopolysaccharides, which leads to basically chronic inflammation and insulin resistance and dysregulation of the insulin metabolism. So the understanding of the adaptation of the microbiome and the mechanism how this can be modulated would be very helpful in the management of gestation. Another disease which is related to the microbiota is the preeclampsia. Preeclampsia basically is the second most common cause of maternal deaths and is related to increase in certain microbiota, and some of the microbiota are kind of hallmark that you can say that this woman is doomed to have preeclampsia. So if we look at the diseases related to pregnancy, whether they are gestational diabetes, obesity, preeclampsia, there is a relationship of dysbiosis and the disease pattern. One of the disease, prematurity, is the second most cause of deaths in children, is related to the gut inflammation and hyperpermeability of the gut, which leads to inflammatory gut disease, and later on make the preterm babies more vulnerable to develop the non-communicable diseases like diabetes, hypertension, and heart disease. So prematurity is a kind of a disease which is both cause and also effect. The mother's gut inflammation is related to prematurity, and prematurity is related to gut dysbiosis and later on short and long-term diseases. So if we look at the maternal and infant health outcomes, we can see that in mother, diseases related to dysbiosis are gestational diabetes, preeclampsia, and also gestation-related obesity. Whereas in infant, there can be problems with the neurodevelopment and behavior. There was a good session in the morning which was related to autism in children and gut dysbiosis. So this is also that, it is also related to metabolic health later on and to the allergies. So in short, maternal microbiome has an effect on the infant. It can mainly change the microbiome of the infant. And there are opportunities where a baby can be exposed to the healthy microbiome of the mother. And that is, one is vaginal delivery, second is exclusive breastfeeding. So if I have to give a message in one line, I would say that, if you want to give a healthy kickstart to the baby, I think most important thing is to have a vaginal delivery, give skin-to-skin care, which we call as KMC or kangaroo mother care, and breastfeed the baby. Well, as I already said, that there is a relationship between the unhealthy microbiota and the brain development, and there are experimental animal models where it has been shown that maternal microbiome has a direct effect on the brain development, microglial maturation during the prenatal development. So if it's not only that, obesity and metabolic disease predisposition is more common in these babies who are exposed to the maternal gut dysbiosis, but also it affects their brain development. Now, how does gut microbiota affect the neurodevelopment? So there are a lot of hypotheses which are given, but none of them have been proven. Now, in the end, I have to leave you with a message in 15 minutes that is there anything which can help? So can we do the modulation of the gut microbiome? So gut microbiome modulation is one of the appealing possibility, and pre and pro probiotics have been used, as previously you've been hearing about it. Though the research is still in the nascent stage and we have very limited human data, but there are large Cochrane meta-analyses which have looked at the effect of probiotics on gestational diabetes mellitus during pregnancy, effect on hypertensive disorders in pregnancy, and also on the outcome of cesarean section. But unfortunately, none of these meta-analyses have shown a positive effect. If we look at the differences, no difference has been shown in the neonatal mortality, weight of the baby, or the leptogram of the mother, breastfeeding rates at 6 months, or the quality of life. So that leaves us with a choice that are there any future perspectives which can help us? So if we look at the research up till now, because the study on maternal gut microbiome and microbiome in the pregnancy has been only for last 2-3 decades. And up till now, there is no standardization of the microbiome methodology, which is a very important issue. How much should be the dose, duration of the probiotic? What is the role of other interventions like dietary modification, lifestyle modification? So further trials are needed, and that would be my message. And in the end, I think dietary components are very important, the kind of diet you provide, because it has effect on the pregnant woman, it has effect on the mother's insulin control, on her blood sugar management, on reduction of her inflammatory response in the gut. So probably dietary components or a lifestyle management probably would be a very important area where in the future, along with the pre and post probiotics, one could work. In the end, I would like to leave a message that pregnancy is a unique event where hormonal, immune, and metabolic changes are taking place. Physiological changes and pathological disorders in the pregnancy, name it obesity during the pregnancy, name it diabetes mellitus, name it the gastrointestinal problems the mothers have during pregnancy, like hyperemesis gravidorum. The composition and the diversity of the gut microbiome is very important, and imbalance in this gut microbiome is probably related to many of the pregnancy-related complications. So association of maternal microbiome with fetal inflammation, and a lot of animal research is suggestive that the brain development, a large role is played by the gut microbiota, and the factors that influence the microbiome of the pregnant women probably could make the therapeutic target not only for the mother but also for offspring in the future. Thank you so much. It's been wonderful, and I'm just reminded of a saying which is usually used by the industry for the quality, that we are just trying to understand the microbiome. We are just at the threshold, and maybe the coming decades we'll know more, and maybe by the next conference or by the next decade we'll be wiser. Thank you so much.
Thank you. Thank you, Dr. Claire. That was an excellent presentation, and again tells us that microbiota changes start right from pregnancy. And what it really could mean for the health of the mother and child is something that we still have to unravel. But I think definitely the right dietary choices, healthy lifestyle and modulation of the microbiota at some point might be a good window of opportunity to prevent diseases. So we have time for 1 or 2 questions very quickly from the audience. If there is a question for Dr. Claire, it's a very interesting area, exciting, and something very new.
हमारी एनजीओ है लुधियाना में पीपल फॉर एनिमल्स, जहाँ बीमार जानवरों की देखरेख करते हैं। डॉक्टर संदीप जैन मेरे साथ हैं, ये प्रेसिडेंट है। मैं पिछले कई सालों से वहाँ जाता हूँ, तो मैंने ये देखा कि जैसे गायनेकोलॉजिस्ट के पास हम जाएं तो वो एक्सपेक्टेड डेट ऑफ डिलीवरी लिखेगी, अपना वो कैलकुलेशन करके लिखेंगे, तो तब भी वो डिलीवरी उस डेट पे जरूरी नहीं हो जाए। तो कभी वो रोड पे होती, कभी कुछ। लेकिन मैंने देखा जो हमारे जानवर हैं, चिड़िया है, उसको कैसे पता होता है एग्जैक्ट डेट ऑफ डिलीवरी। मैंने कभी किसी चिड़िया का ना अंडा उसके घोंसले से बाहर होते नहीं देखा कि उसको सड़क पे दे रही है। उनको कैसे पता है सब कुछ, क्या खाना है, क्या बच्चे को क्या खिलाना है, अपने को कैसे बच्चा पैदा करना है। वायरस को भी पता है, बैक्टीरिया को भी पता है, तो उनको कैसे नॉलेज है ये सारी इनहेरिटेड?
शायद बहुत साल पहले हमारे यहाँ भी माएँ तो अस्पताल में जाके बच्चा नहीं पैदा करती थी, वो घर पे ही डिलीवरी होती थी। कोई घर की बुजुर्ग औरत ही उसे हेल्प करती थी, तो बच्चे तो तब भी पैदा हो जाते थे और बच भी जाते थे, लेकिन उसमें से कुछ मर भी जाते थे। तो आई थिंक जितना इवॉल्व होते गए हम, उतना ही जैसे जो हमारा प्रसव का टाइम है, जेस्टेशन पीरियड है ह्यूमंस का, वो कंपेयर टू माइस या कंपेयर टू म्यूरिन घोड़ा या गाय बहुत डिफरेंट है। और मतलब जैसे जैसे हमें प्रोटेक्शन मिलती गई, हम ज़्यादा निर्भर हो गए गैजेट्स पे, साइंस पे, तो नेचुरली हमें उस पर डिपेंडेंस हो गई। अब चिड़िया तो किसी अस्पताल में नहीं जाती है ना, वो तो नेचर पे डिपेंड करती है। तो बाज़ दफ़ा मुझे लगता है कि नेचर भी उसे प्रोटेक्ट करती है। इससे ज़्यादा मैं कुछ नहीं कह सकती।
Hello ma'am, I am Arnab Guha from Impeccable Innovations Bangalore. We are a startup, millet based startup, and we are working in the disease and disorder segments. My question to you is, why is there is a tremendous increase in autism in India as well as in US? In India, the figures are not there, but in US it is 1 in 36 newborn is autistic by the age of 2 or 3. So in your opinion and in your practice, why you think the autism is increasing?
It's a very good question, because yes, autism is increasing. Number one, we are diagnosing. Before this, like, if a child was not speaking for 2 years, we were not worrying. If a child was not getting stimulated by the environment, we were not worrying. But now we are worrying about it. Secondly, autism is more common in premature children. Autism is more common in children who've had problems at birth, like asphyxia, where stimulation is not done. More of screen time, where, if you see a family, the mother and father, mother is busy on her phone, and the father is also busy on his phone, and the child is just busy with the TV, watching the cartoons, or he's also busy on a smartphone. So there is lack of stimulation, which happened in West before us. In India, we had more joint families. The grandparents were a great stimulus to the child. They would talk more often. With the nuclear families, that is gone totally. So that is also one factor that we are seeing more of autism, because children are not getting stimulated. The brain is not getting stimulated. So they are having delayed development. They are having problem with the behavior. They are having problem with the learning. So there are multiple reasons.
So ma'am, you are trying to say that the main issue is happening post-birth?
No, that's one of the issues. I wouldn't say that that is only. Now we are also saying that change in the gut microbiome is also playing a role in the brain development. Like, those mothers who have dysbiosis, where, you know, if a mother has more of inflammation, she has more vaginosis. That means she had more vaginal inflammation. And the baby is also exposed to the inflammation. The brain development gets a setback. So these babies can have maldevelopment of the brain. They can have problems with their microglial function. So they can have behavioral and learning disorders. So autism is one of the learning disorders, and autistic behavior is a range of autistic learning disorders. So that is why there are multiple factors that we're seeing autism more often. And it is going to become a huge health problem, because the schools don't accept those children because they are so slow learners. Parents are also sort of perturbed because, you know, the children can't find the right school. So that is going to be a huge problem.
Our startup is
Also,
working
I
with
think,
these children. So, but the main question still remains why
yes,
it is.
I think we'll take the questions. Yes. No. I'm totally looking at the time. So yeah, that was a very nice presentation. Thank you so much, Dr. Claire. And now we have two distinguished speakers. We are shifting gears. We are going to move to polycystic ovarian syndrome. And we have Dr. Raka Guleria. She's a very senior gynecologist, is now with Fortis La Femme, but I know her for many years when she was in Holy Family. And we have Dr. Anupam. He is a senior microbiologist with Lifeline Laboratories. So we are shifting gears, and just as we heard now that you know, the gut microbiome actually changes during pregnancy. And there was this very interesting study which showed that in the 3rd trimester, the gut microbiome of a pregnant woman is literally like that of an IBD patient. And when you transplanted the fecal microbiota into germ-free mice, the mice had just the same symptoms. So one common disorder, as I may say, in women, especially of childbearing age, is PCOS. And it is characterized by inflammation, obesity, insulin resistance, and the like menstrual disorders, infertility. And today we've just been hearing about how the gut microbiome could be linked to many of these conditions. So Dr. Raka, what are your thoughts on the link of the gut microbiome to PCOS?
Thank you, Neeta. Okay, when I was going through literature, I came across this article, and I have to sort of tell it to you verbatim, what they say, that studies have shown that the gut microbiota of PCOS patients is related to the occurrence and development of insulin resistance, hyperandrogenism, chronic inflammation, and metabolic syndrome. And these can affect the clinical manifestations of PCOS through the short-chain fatty acids, liposaccharides, sex hormones, and brain-gut axis. So what we've been listening to and hearing about the whole day. And in polycystic ovarian disease patients, this is what we see. We see obesity, we see signs of hyperandrogenism like hirsutism and acne, and we have hormonal disbalance like irregular periods and ovulatory cycles. And all this it's a spectrum of disease which we are seeing, and now we find that yes, it is related to the gut microbiome.
It is, yeah. So while environment and genetics and so many other factors, but I think the gut microbiota also plays an important role.
It plays a role, yes. I mean, environment, yes. Girls these days have a more sedentary lifestyle, and the diet is also definitely different. It's different from what I think our mothers and grandmothers used to have. So that plays a major role in it. So I think all these factors together contribute to this epidemic of PCOD which we are seeing these days.
Yeah. Thank you, Dr. Raka. And Dr. Anupam, my question is that, again, we heard a lot about inflammation, we heard about the leaky gut, and we also heard about the immune system, which is largely located in the gut. So do you think PCOS could also be linked to an interaction of the gut microbes to the so-called 70% of the immune system or the gut-associated lymphoid tissue in the gut?
So first of all, thank you for having me here. So ma'am asked a very elaborate question, and I'll try to not give such an elaborate answer. So as a microbiologist, I can tell you, up to now, whatever discussions have happened here, more or less you might have, everybody would have painted a picture that yes, gut microbiome is involved in every disease. So if I have to speak particularly about PCOS, so as my colleague ma'am mentioned that it's a very, it's a disease with very diverse symptoms involving both hormonal, the metabolic and the other symptoms as well. So now if you bring all that together and relate it to the gut microbiome. So the gut microbiome is almost like a second genome of your own body. There is one genome which is obviously your own, and there are so many of bacteria in your gut that they together almost redefine you in a sense. So when we talk about the correlation between the gut microbiome to a certain disease, first of all, you will have to go through various research articles, and there are plenty available, and they will all describe whether some bacterial species has increased or decreased in certain diseases. Now, if you go particularly with, if you go through the research articles and read in particular with the PCOS, you might come across a lot of studies which have done a lot of research in mice, not so in humans, but in mice, and they have basically described that yes, some Prevotella species or Bacteroides species, these bacteria either increase or decrease, but there is no consistent finding. As of now, we are still at very infancy stage of our research, and yes, things are coming up. And as a microbiologist, I must tell you that, having or receiving a stool sample which says from the clinician screen for ova and cyst, now we are moving on to screening for the entire genome. Now that is such, it's a very,
it's a new science actually. It's yeah, true. So Dr. Anupam, to all three of you, we've heard about FMT, fecal microbiota transplant, and there's been a lot of data that, especially for C. diff infection, that when you transplant fecal microbiota, it's probably more efficient or effective as compared to conventional treatment with say vancomycin. Do you think just favorably modulating the gut microbiota among the many other treatments, metformin and everything else, could be an intervention that we could look into the future for treatment of PCOS? Because almost every girl I see, of childbearing age, has some symptom of PCOS. Do you think just modulating the microbiota could play an important role in preventing or kind of treating PCOS?
Ma'am, in fact, it has already been looked into, and there are studies which have explored the prospect of fecal transplantation in mice, and it has given good results. I must admit that all these studies are in a way in agreement that yes, transplantation of fecal microbiota does help, but yes, we still need to explore it in humans. And when you talk about antibiotic mediated change in gut flora, for example, you talked about C. diff. So we know that clindamycin therapy changes the gut flora. So when you are doing a fecal transplantation, the one thing you must keep in mind always is the antibiotic history of the patient. If there is any predisposing other history, and also whether that patient has or has not received a chronic medication which involves antibiotics in other medications as well. So yes, there is a role of fecal transplantation.
So Pooja is looking at me and wanting me to close the session. So we have had a very, very interesting sessions. There are new insights.
Dr. Hajela, in fact, I've got 3 of these doctors, so I do have something. You all talk about, and I was mentioning this to Dr. Claire, we talk about the young girls with the PCOS, you talk about the mothers to be, the infants, but I would like to present a question, which is what happens with, how can this help with women who are my age and kind of heading towards, other kind of problems with the perimenopause and the menopause? How come there is nobody talking about how our guts can perhaps help with those hot flushes at night?
You have actually given a new topic for research.
This is new food for thought, Pooja.
I must admit.
Clearly not enough.
People will get intrigued and look into it.
But yes.
Having said that, I think with your perimenopausal or postmenopausal symptoms in your hot flushes. Dietary control and dietary modification does play a major role.
Yes.
Definitely. So if you go on that path, yes, you will have less of the hot flushes.
Thank you.
To that, I would add positive thinking, positive feedback, and exercise. I think would also play a huge role.
So it's basically what we say, a balanced diet, a healthy lifestyle. I think that's the way to go. So thank you so much. Thank you very much to all the expert panel members. It has been very interesting. Of course, we could go on and on, but then looking at the
but
time
thank you to
and
Dr.
paucity of
Dr.
time.
Jela. You've really thank you to you. You've really managed this so well. Come on, everyone. Let's give them a big hand. Let's have you for a photograph right there. Oh. Thank you, I'm honored. Over to you, Arjun, for the next session. I know, I'm sorry, we are again skipping the tea break. We're giving you food for thought right in here. And remember what the participants said, food is overrated. We need less of it.
Thank you for a very, very interesting session. And I think, Pooja, I hope you made notes. They said less stress also. And hopefully we can manage the time today. That will definitely help your hot flushes. So now, without much ado, let's go to our next session. And a super interesting one that we've been looking forward to. And this is gut and chronic disorders. And for this, I have an entire group of very, very learned pioneers in this field that I'm going to call up on stage, starting with Dr. Ajay Bhalla. Ladies and gentlemen, I want some enthusiasm. Please put your hands together for sir. Also, if I can, Dr. Jagmeet Madan was supposed to join us, but couldn't be here. Along with them, I also have Dr. Ashima Shukla, who I would like to invite on stage. Dr. Anup Bhagat, Dr. Mankul Goyal, Devjyoti Dhar, and Dr. Pankaj Verma. If you can all of us join us on stage, please. So I will request the AV team to start with the video for Dr. Jagmeet Madan, please. And if all of us already don't know, Dr. Ajay Bhalla is a renowned gastroenterologist and has a special interest in the gut microbiome.
A very good evening and greetings to all eminent speakers and delegates from Mumbai. Gut health, to my mind, is an everyday investment for life. In this session, we are going to cover a number of chronic disorders, and what I'm heartened about is that most of these chronic disorders, what we picked up, are the ones which have gained a lot of importance in the recent times. Diet could strengthen or weaken the microbiota-brain interaction, or directly change the microbial diversity to influence the gut-brain axis. The emergence of psychobiotics and a discussion on this new development should be the way forward for our discussion in ensuring good quantity and good quality of sleep. There's a huge emerging science on gut-skin axis, starting from the normal healthy skin to the skin-associated diseases, be it psoriasis, atopic dermatitis, acne. I'm very glad to share that in our institution we are conducting 2 randomized control trials, one on sleep quantity and quality, and on the other one on acne. And both randomized control trials have a backdrop of food-based intervention and the effect of food-based intervention on these 2 aspects. And I'm heartened to say that we are looking at gut microbiota and we are also looking at the skin microbiota. The role of diet, gut microbiota in the prevention of prediabetes and type 2 diabetes and the complications of diabetes has been very well documented. And to my mind as a nutritionist, exploring the role of gut microbiota to prevent prediabetes, to prevent hyperinsulinemia, to prevent insulin resistance, to prevent the degree of inflammation in the body is an area which really needs to be explored. And again, I'm very happy that this conference has a backdrop of use of millets. We've just celebrated the International Year of Millet last year, and we all today are very well literate about the beneficial nutritive and non-nutritive components in millets and how they can help facilitate a good gut environment.
I think we'll stop the video here. Thank you, Professor Jagmeet Madan. You know, I've been here for the last 2 hours and I've realized I think it's a gut microbiome which is causing all the diseases. There's nothing other than that. And probiotics, they seem to be like the health craze. You have kefir, you have kimchi, you have all the fortified yogurts, you name it and everybody wants that. But, you know, there is a link, there is a definite link between gut dysbiosis and chronic diseases. And that's what we're going to focus on. It's going to be a very, very time-bound panel discussion, so I want my panelists to be very sharp and just answer in that much time. We have missed out 2 tea sessions, they said, so we will follow by that. So my first question will be to Dr. Pankaj Verma, who is a physician, he's an integrated disease specialist, and I would want him to tell me, how do you think our chronic diseases linked to gut dysbiosis? What is the problem with the thing?
Thank you, Dr. Ajay. As we are discussing since morning about all the gut microbiome diseases, now everybody is very much clear, like every chronic disease has a basic chronic inflammation. So that chronic inflammation has multiple causes, and among those, basically, either they are pro-inflammatory cytokines or they're anti-inflammatory cytokines. And these cytokines are basically driven by your enteric system and your hormones. And that enteric nervous system is basically like a symphony of so many microbiomes, microbiota bacteria. Either they induce the pro-inflammation in the body, or they increase the IL-1, or either they decrease IL-10, so that lead to decreased inflammation in the body. So in many areas, all the inflammation disease, like I would say rheumatoid arthritis, asthma, type 1 diabetes, type 2 diabetes, all the autoimmune disorders, now there are so many articles and research available which link your gut inflammation, your gut dysbiosis with various pathological evolution of your diseases. Now, I would say it's very difficult to find it out whether all this inflammation will lead to inflammation in the gut, which lead to change in or disruption in the natural microflora, or this abnormal microflora in the gut, which lead to chronic inflammation, which lead to presentation of diseases. Because usually what we see is all retrospective. We are taking the sample of diseased persons, not the healthier person. So if you do more detailed study on healthier population and see over the period what happens during the course of disease, whether depending on their microbiome, whether if that change in microbiome can lead to actual chronic inflammatory disease in any manifestation like arthritis or diabetes, or whether this change was happened post or after acquiring that disease. So yes, there are some correlation happening between gut microbiome, but it is not completely validated and well defined.
Yeah, thank you, Dr. Pankaj. It's now seen, you know, I think in the next decade, more than 50% of the population will be suffering from chronic diseases. These will be non-communicable diseases. And there will be a link. There will be a link which will be established. I'm glad you pointed out diabetes, obesity, heart disease, there were cancers. Of course, we've covered a lot of fatty liver. We have had Doyens here before who've spoken about it. And of course, the autoimmune part. But there seems to be something else which is very, very important. We have known about the gut-brain axis. And it's a bidirectional axis. You know, your gut affects the brain and the brain affects the gut. So to answer a question about what is the role of emotion and stress in mind and gut, we have Dr. Ashima Shukla. She is a clinical psychologist, and I'd like her to answer this question.
Thank you so much, Dr.
Yeah.
Yeah, I think we've been hearing so much about the gut and mind connection, the axis, and there's so much research in the last 2 decades that's gone all over the world because, you know, all these lifestyle diseases not only depend on the food that we eat, the environment, the pollution, the toxins, you know, our sleep patterns. These are all lifestyle patterns that has kind of changed over decades. And now we see lifestyle diseases even in India. But, you know, this was something which we have been hearing even in Ayurveda in India for like 5,000 years ago, where they have talked about, they have brought in this, where you know, your health begins and all illnesses begin in your stomach or the gut. And I'm glad that we are talking about this today. So emotions, we all you know, find ourselves talking about that, you know, having butterflies in the stomach often, or just feeling of nausea or a queasy feeling in our stomach just before a presentation or an exam perhaps. All these are just simple, you know, reactions. They're a way we express ourselves of the real emotions that we are going through. And there is a, you know, the gut or the brain, they are very sensitive. The gut is very sensitive to any emotions that we experience, whether it is anger, whether it is feeling of, you know, stress, or anxiety, or even when we are happy, the gut reacts. And this axis, or this, this reaction of the body, particularly in the gut, of being sensitive, also is the same that happens in the brain. So it's the same neurotransmitters that are, you know, that happens in the brain and they're released there, which is also released in the gut, like serotonin, dopamine, and they're responsible for our cognition and our behavior. So the emotions and the stress has an absolutely direct connection as far as you know, the gut health is concerned.
Thank you. I guess you have answered it all. You know, that's where the new concept of psychobiotics has come up. And there has been, I'll just add on that there has been a link to so many diseases like schizophrenia, ADHD, Parkinsonism, anorexia nervosa, Alzheimer's, where there is gut dysbiosis. And there seems to be improvement which happens when you give these antibiotics, the so-called psychobiotics. We are not going to cover the liver and the other part of major diseases, but there is one part which was not covered, was the dermatology part. And we have Dr. Mankul Goel here, who's a dermatologist. My question to him is that what common gut disorders are linked to chronic skin diseases? And what are the mechanisms which link this? So if you can highlight that.
Thank you, Dr. Balla. I'll try and speak something which has already not been spoken.
Yes.
So I think if you look at it, chronic skin diseases, we can say there are two kinds. Ones which are related to the hormones of the patients, like acne, hair thinning, which are related to PCOS. There we find that the link with gut is more indirect in about 70% of the cases, in form of inducing metabolic syndrome and insulin resistance, and through that the gut microbiome impact. However, 30% of the patients are also directly impacted by the food intolerances or infections in the gut. But more importantly, in autoimmune disease like in lichen planus, we see very often patients respond to metronidazole, such a simple medicine. And people would have been treating it for years, and a 10 to 15 day course of metronidazole resolves the lichen planus. And in a lot of the stool samples, they have parasites growing, and then it's just a wonder and surprise for me the number of cases of lichen planus which respond to a simple drug as metronidazole. Another common example is urticaria. How many patients of urticaria are carrying either Helicobacter pylori how many are carrying blastocystis, some would respond to doxycycline, some would respond to metronidazole, some will respond to triple regimen of H. pylori. So it's amazing and it's very gratifying as a doctor to, treat these patients who have been on chronic immunomodulators or suppressants, and suddenly they do a 10-15 day course and they become better. But of course the journey for them doesn't end there, because after that these microbes tend to recur. So it's a lot about their diet and lifestyle, and what you just talked about, the gut-brain axis. Same with psoriasis. A lot of patients, psoriasis is well known to be associated with metabolic syndrome. But apart from metabolic syndrome, a lot of them have SIBO or SIFO, small intestinal bacterial overgrowth or small intestinal fungal overgrowth. And again, very remarkable, very gratifying to treat that, and the patients have a sudden remarkable improvement. And again, joining the dots, it's about a combination of hormonal issues and gut issues driven by infections, infestations, food intolerances, emotions, lack of enough secretions from liver, pancreas, gallbladder, and stomach acid, and stagnation of the current lifestyle, which put together lead to a lot of these issues, which ultimately are happening by the mechanisms of leaky gut and molecular mimicry and many other means which have all been described. Thank you.
Thank you. Thank you, Dr. Mankul. I think that was very elaborate. I don't need to add anything here to it. I'll just say that there are some GI disorders which are linked with skin manifestations. I see a lot of pyoderma gangrenosum. I'm a gastroenterologist. I see it with IBD, which also tends to respond very well to probiotics. I guess somewhere down, all diseases are linked to it. But there's something more which is there, which is contamination of food and feed by mycotoxins, which is a serious problem. And it's a serious problem regarding food safety. We don't address this much, but we have with us Dr. Anup Bhagat, and I would want him to answer this question as to what is the impact of mycotoxins on gut.
Molds are commonly present in the houses and working place, and we are not aware of the impact of mold in the body. So mold produce mycotoxins, and mycotoxins produce mycotoxicosis. Molds are getting into the body by consuming the mold contaminated foods or by skin contact with the mold infested substrates or inhaling toxins secreted by the mold spores. These mycotoxins inhibit the protein, DNA and RNA synthesis and disrupt the cell wall. It also damages the macrophage system and inhibits the clearance of the particles from the lungs and inhibits the synthesis of proteins I have spoken, but it also sensitizes the lipoprotein, that is LPS, bacterial endotoxins. Mycotoxins and gut microbiome have a bilateral relationship. This is the new perspective. If you have a robust health and balanced microbiome, you can eliminate mycotoxins from the body. If you do not have balanced microbiome and robust health, these mycotoxins will eliminate the good organs from your gut and promote the colonization of pathogens, resulting in the mycotoxicosis, causing hepatocellular carcinoma. And aflatoxins play the key role in inducing the hepatocellular carcinoma. Once this occurs, death is inevitable.
Thank you, Dr. Anup. This is something which is there. What he talked about is, there's a microbiome which can affect the mycotoxins, and the mycotoxin which can affect the microbiome. That's also bidirectional here. And I guess the relationship with HCC, aflatoxin, is very well known. Colorectal cancer, as well as lots of chronic inflammatory diseases. So this is something very important where we need to take care of this mycotoxins, which should not be added to the feed. You know, I somehow feel there should have been an ideal microbiome for all of us, and I wish we could have acquired that. And then we would have been free of all diseases. But we actually do not know. I wish, since there is such a link, at least we should be able to test our microbiome. Unfortunately, so far we do not have very good testing methods. And I would want Dr. Deep Jyoti, who is a microbiologist, a question for him is that what chronic disorder patients mostly get their microbiome tested? And I'd like you to elaborate what are the tests which are available, because this is probably going to be the best thing coming around in future. Instead of doing any other tests, if you were to get your microbiome tested and whatever you're lacking, you replace it, you're cured of all diseases. I don't think there's going to be any disease which microbiome will not cover.
Thank you so much. Well, before I answer this question, I must tell you that I'm a co-founder of a company called Leucine Rich Bio, which is South Asia's first microbiome company. We were the ones who brought microbiome testing to India way back in 2016, 2017. And since the question is, what chronic disease patients do we see? Well, we have a spectrum of patients, Dr. Bhalla, to be very specific. We have patients with type 2 diabetes coming to us, looking at their microbiome, and hypertension, NFLD, a lot of autistic patients. So the spectrum is huge. We've had a lot of patients with psoriasis coming up. And I'll tell you one very interesting fact. When we started this journey of microbiome testing in India, we didn't know what to put in the report, to be very frank, because there was no one that we could see a template and follow. We started putting things up which were very technical in the beginning. So a lot of people came back and said we didn't understand anything. So we made it very simple. Then the doctors came back and said, no, we want some technicalities because it's very simple. So we have to strike a balance somewhere so that it is understandable both at the level of the layman and also for the clinicians or the nutritionists to implement whatever is given in the report. So that's part one of your question, I guess, answer of your question.
And I'll continue with the rest also. Is gut dysbiosis common in chronic diseases? Have you found? Because what I have a list is the people who get tested worldwide, there are new things coming up as IBD, type 2 diabetes, cardiovascular diseases, also families with colorectal cancer or familial cancer syndromes.
So let me first explain dysbiosis. See, dysbiosis, as rightly explained by all other panelists before or speakers before, is a disbalance between good and the bad microbiota. Again, what we normally use in parlance, normal parlance, is microbiome, but actually the word is microbiota. Microbiome is the genetic material of the microorganism. So basically the right technical term is the microbiota. We do see dysbiosis. In our sense, we had to define the term dysbiosis because again, it is not defined. What do you mean by dysbiosis? So in our case, what we have done is we not only look at the good and the bad, so-called good and the bad, because to me, any good bacteria can become bad. They are mostly opportunistic. It also depends on the person's immunity. If the immunity of the person is bad, the good microbiota can become bad also. So again, those terms are debatable. But yes, dysbiosis is there. That means that the production of SCFA is less. That means the production of neurotransmitters is less. That means the diversity is less. If you put all these things together, then this term dysbiosis can be addressed. And there what we have done is we have patented a particular score called Rich Index that gives a kind of indication of how dysbiotic the gut is. And in 99% of the cases that we have seen so far, close to 6,000 cases so far, all of them had dysbiotic gut.
So, is this as a standardized test available now in India also? I was going through it. There is a SOVI test which they are talking about.
SOVA basically sells our test in their name. So we provide the test. Our test is called BugSpeaks.
Okay.
BUGSPEAKS.
Great.
Can I ask one question?
Yes, please. It's an open house. So I'm going to I had these questions which were charted out, but any more questions?
I have a small presentation if I can, in 10 minutes.
I don't think we'll have that much time for a presentation because we are running late. So we'll just go ahead with the questions. Please, Dr. Bhatt.
Thank you, Dr. Dhar. So, I have done a few tests from BugSpeaks as well. So, I just want to understand, apart from the three things that you mentioned, that diversity, short chain fatty acids, and there was third thing that you mentioned, neurotransmitters, which give us a guide. How much can we rely on a microbiome test to tell us that this particular pathogenic microbe is in excess and needs treatment? The second question is that sometimes, for example, for H. pylori, we have done a stool test from a good lab and the stool antigen test is positive, but the microbiome test doesn't reveal an excess, or vice versa.
Yes.
So can you just share on that part?
The first part is, some of the abundance of some of the microorganisms that we report in our report is based on the Indian reference. Initially, when we started in 2016, 2017, there was no Indian reference at all. So we had to rely on the Western or American or European reference, which during the course of our journey, we realized it's not correct.
Yeah.
See, one thing we have to understand, it's an evolving space, it's an evolving field. What we know today might not be correct tomorrow, and so on and so forth. So once we started to put the Indian reference into the picture, then a lot of the factors that we earlier used to think right were found to be wrong. For example, I'll give you one small example. Initially, people, even now, a lot of people put emphasis on firmicutes to bacteroidetes ratio, F by B ratio. People say that in obesity, F by B ratio goes up, IBT, F by B ratio goes down, or something like that. I personally, and later a lot of researchers also realized that F by B ratio is not the right way to look at the microbiota. It's absolutely not the right way. Similarly, some of these microorganisms whose abundance is high with respect to the so-called healthy Indian gut is what we report. We always say that you have to clinically correlate, because sometimes what happens, there was a very interesting example. There was a gentleman who had Klebsiella Klebsiella in his gut, which was very high. And when I was doing counseling with him, I asked, what is the background? He's fairly healthy right now. He said during COVID he had a lot of pneumonia. He had pneumonia, and he didn't know what was the causative organism, but it is possible that Klebsiella was the causative organism, and somehow it has come to the gut and deciding it there. If its immunity goes down, there's a chance that he might again get the lung infection back. So we get to unearth a lot of things by looking at the microbiota, and we are looking at thousands of species at one go. That's the power of the technology.
Yeah, Dr. Dhar, you're right. I do not know what exactly is the microbiome of our country. Even there will be a north-south divide, there will be east-west divide. There is going to be difference because it's related a lot to our dietary habits, a lot related to what we have got from our parents, from our mother with the type of delivery. There are lots of things which are linked to it. But yes, you have come up with a testing, which I don't think, I'd like to ask, how many people are aware that they could actually get their microbiome tested? There are very few, but it is available. It's not a very expensive test. In fact, in the West, in the US, there is a company which is trying to market another one, where they will be able to guide you. They'll keep checking it every 2 months, your microbiome, and if it changes, they may be able to predict disease. So it's something which is really, really exciting. And one good thing which Dr. Dhar pointed out was, which I also learned, was like in schizophrenia, lactobacillus and bifidobacterium, the two bacteria which is supposed to be healthy, are in excess. In ADHD and schizophrenia, they are at higher levels than normal. So it's not necessary that only the firmicutes and the ratio of lactobacillus, they have to be impaired. There could be good bacteria which could also be causing problem. So I think we have already covered this long-term impact of mycotoxin. Dr. Anoop, do you want to add something more to it? You had already covered, you had said it leads to HCC and cancers, or there is something more you'd like to say?
These mycotoxins are disaster of 21st century. Once they are in the blood or in lymphatic system, they take different biochemical pathways to become carcinogenic, teratogenic, mutagenic, estrogenic, hemorrhagic, dermatotoxic, immunotoxic, hepatotoxic, nephrotoxic, and the worst happens is in the brain, neurotoxic. They are every possible pathway is possible depending upon the microbiome of your body. Thank you.
Thank you, Dr. Anup. I think that's a scary thing. We need to look at it. Our food and the animal feeds, whichever, have to be looked at, because you have something even called mass mycotoxins. They may be there, and your good bacteria actually unmask them, and they'll become toxic to you. I think this is going to be our second last question to Ashima. Dr. Ashima, any tips for managing stress and gut health? Any special tips? You are a mind and body specialist, so you're going to link them and tell us.
Yeah. The thing is, we all are experiencing stress all the time, and well, we really can't do much about it. We could be getting stressed on the road, seeing bumper-to-bumper traffic, or at home. But the important thing is how we react to it. So that determines the whole, the physiological changes that happens in the body, and the response, the stress response, which is the fight-flight response as well. And getting stress once in a while also enhances the performance, because there's good stress as well, which is helping us to perform well. And there's been a lot of research on this, of how the level of stress and your peak performance, match up to a level where you are performing so well. But having said that, I think we all are experiencing a lot of stress in the world, whether it's emotional, physical, mental, financial, relational, psychosocial factors are there. Right now, there's a lot of toxins in the air. I mean, there are a lot of stresses around us. But an important thing is that we have to be responsible for our own health and emphasize self-care, and a routine which kind of takes in account what are the important pillars of lifestyle modification, which is good restorative sleep, hydrating yourself well, eating the right food and eating it mindfully. You could be eating the right food, a healthy plate, but if you are not eating it with, peacefully or mindfully, it's not helpful at all. We can have anything, the good plate, the healthy plate, the Mediterranean plate. I mean, it really doesn't matter, because our brain and our gut, especially the gut, responses and transmits the same neurotransmitters that are there for the brain also when it faces stress. And it releases hormones like serotonin, dopamine, and that affects our well-being all the time. So very simple things that we can do in this busy life of ours is, yes, have a routine, prioritize yourself. We are always taking care of others and worried, whether it's workplace or home. We must take out 10 to 15 minutes in a day, which is just for us, and connect with nature, connect with family. Social connectedness is very important for our reducing our health. And besides this, of course, meditation, yoga, exercise. Even 15 minutes exercise every day is good if you can do it 5 times a week, because the effect stays for 48 hours in our body. So that is important. Eating the right food, making a very, very informed choice of what we are eating is very important. Of course, probiotics, prebiotics, and these are essential in our daily diet. And I think also relaxation techniques, where even if you're practicing pranayams or breath focus exercise, there's a fantastic link between the mind and the body, and that enhances our body and well-being.
Okay. Thank you, Dr. Ashima. I'll just add one thing. I tell most of my patients who come to me with functional bowel, there is first thing you should follow is relaxation. Relaxation could be anything. It could be reading a book, it could be watching a movie, going anywhere. Then there's recreation. Recreation is a sport. You go to the gym, you play a game of badminton, you play tennis. Third is meditation, and last is medication. Unfortunately, people move straight to medication, and that's the part which I would highlight otherwise.
And also monitoring our thoughts, doctor.
Yeah,
you know, it's
yes.
very essential that we
Absolutely,
consciously monitor our
absolutely.
thoughts
We
towards
have now our final
activities.
question, which I'm going to ask, which is going to be addressed to Dr. Pankaj, which is how improving gut health will treat and prevent chronic diseases. We know there is a link. Now you tell me briefly. You have just 1 minute, and then we'll wind up. I think we'll be in time.
Thank you. Basically, in Atharvaveda, there is a quote, Aham Annam. We are what we eat. So ultimately, just choose wisely whatever you're eating, because it will become ultimately part of it. It will define your health, your infections, your immunity. So that's why just work on how, as the ma'am said, choose wisely. Since I'm working in holistic medicine, I apply Ayurveda a lot. Vata, Pitta, Kapha, your Prakriti matters a lot. So find your Prakriti, find customized diet plans according to you. Don't eat anything, especially in India, we eat so many, like as we said, milk, lactose intolerance is so much, gluten tolerance is again increasing in the very fast way. So just be, I think, conscious and aware of your food choices, because in my practice always say कि जो स्वाद में है वो स्वास्थ्य के लिए अच्छा नहीं है, और जो स्वास्थ्य के लिए अच्छा है वो स्वाद में इतना अच्छा नहीं है. So ultimately you can change your taste buds if you're actually willing to work on it. Thank you.
Thank you so much. Thank you, my panelists. I think we'll close this session on gut and gut dysbiosis and chronic diseases. Thank you so much. And we are in time. Arjun should come now. Sorry, I didn't.
Thank you, Dr. Bhalla. That was very well conducted. Very appreciate the sensitivity to time. We come to the last session of the day. We all know that populations around the world are growing older. So therefore, there's a growing interest, because there are more old people, therefore there is a greater interest in their well-being. In the last session of the day, we explore the vital nexus between digestive well-being and the elderly population. Let's get some insights into fostering a healthy gut for enhanced overall well-being in the golden years. I invite Dr. Chandrakant Pandav and his very good friend, surgeon and researcher of scriptures, I like that title, for Dr. Yash Gupta. Please come on stage. You will be chairing the next session, and I would request Dr. O.P. Sharma to join them on stage. I believe we are hearing you speak on disorders of gut-brain interaction in the elderly.
Thank you.
Can we have the clock reset to 20 minutes, please?
Just scroll down.
Yeah.
My slides from here only.
Sorry, 1 second. I'll just.
Just I have to scroll down. Yeah. Thank you.
Sir, Dr. Pandav will be inviting you to, I think he's chairing the session. Yes, please, if you could. He has to introduce you too. Dr. Pandav, the clock has been set to 20 minutes for you, and it's right in front. Sure, sir. We'll just try and wrap it as soon as we can.
Hello, Namaskar, very good evening. At the outset, I would like to express my thanks to Ishi Korsla and my good friend Sarat Gopalan for giving me this opportunity to talk today on disorders of gut-brain interaction in elderly. Ma'am very rightly said that the number of elderly are increasing, and that's how they are getting the back seat also. So I am invited in the end. I am Dr. O.P. Sharma. I am a physician geriatrician. I deal with the people who are mostly above the age of 60. I work as a senior consultant at Indraprastha Apollo Hospitals. Microbiome and microbiota, we have been talking since morning, and everybody knows that these are the places where the microbiota is there, starting from stomach to duodenum, jejunum and colon, everywhere they are there. Now, microbiota have certain functions, and they have been very nicely shown by Dr. Sood. And basically, they have protective function, structural function, metabolic functions. Kindly concentrate on the slides rather than on your mobiles. I know you won't leave as a mark of courtesy before I finish. And there are metabolic functions of microbiota as well. But fermenting dietary fibers, short chain fatty acids, and still. What has happened? And short chain fatty acids, which are of importance, and equally importance is the synthesizing of certain vitamins inside the intestines by microbiota. Well, we all have been talking about gut and the brain. So here is actually a diagram which shows that from hypothalamus to pituitary to adrenals to circulation, via cortisols also, there is an effect on the intestines, and it is a bidirectional thing. The gut affects the brain and the brain affects the gut. Microbiota affecting the brain is both in the central nervous system as well as in the autonomic nervous system. There is an enteric nervous system as well, which also gets affected by the microbiota. And hypothalamic pituitary axis is a well-known example of that. Vagus nerve, I think Dr. Sood talked about, it is a major parasympathetic division of an autonomic nervous system which literally affects everything. And the lactobacillus are very intimately associated with it. There are certain neurotransmitters, and it is through the neurotransmitters there is a bidirectional effect of gut on the brain and brain on the gut. And the chemicals which play important role are acetylcholine, noradrenaline, adrenaline, GABA and serotonin. Now, neurotransmitters and GI functions, GABA, they affect the sphincter of the esophagus, the neuroepinephrine affects the gut motility, acetylcholine affects the gut motility, the serotonin facilitates the serotonin secretion and the peristalsis movement with which we are all concerned. GABA, basically through the lactobacillus and bifidobacterium, noradrenaline basically through the E. coli and Saccharomyces, acetylcholine basically through the lactobacillus, and serotonin through the Candida, Streptococcus, etc. Now, serotonin is basically the main thing. Biogenic amine that affects as neurotransmitter, and serotonin plays an important role because tryptophan is a precursor involved in the GI secretion of gut motility. It has a role to play in the pain perception. It maintains the mood and the cognition. There were certain questions about the emotions and the gut, and it is through the serotonin that it gets transmitted. 95% of serotonin is contained in the gut, in the mucosa and nerve terminals at the central nervous system. Alterations in serotonin transmissions may underline pathological symptoms, and selective serotonin reuptake inhibitors are known as to modulate the psychiatry and GI symptoms. Basically, the drugs, some of the drugs that we use, particularly Librium, that affects by affecting serotonin this way. Now, gut hormones and neuropeptides, they affect each other bidirectionally through certain things like ghrelin, gastrin, orexin, connexin, biotin, and NYP. They affect the feeding behavior, they affect the energy synthesis and consumption, they affect the homeostasis, They affect certain circadian rhythms, and circadian rhythms are very, very vital for us as far as heart rate, as far as blood pressure, as far as intestinal movements are concerned. They affect the arousal, they affect the anxiety. Now, this diagram basically shows how the gut-brain axis affects the brain, affects the gastric mucosa, affects the immune system, affects the gut microbiota. Friends, during the COVID period, when the initial data came that 14% of the mortality were in elderly only, there was a huge panic among the elderly people, and I was getting a lot of phone calls from elderly. What should we do? I requested the then Health Minister, Dr. Harshvardhan, kindly reanalyze the data and then tell us. And then we came to know that it was not because of the age that they died because of the uncontrolled comorbid conditions. So basically, it was the immunity that was playing the big role rather than the age. Now, NYP, again the same thing has been shown by this diagram, that how the hormones, how the neurotransmitters, they affect the brain. Now, microbiota derived signaling, they under the anaerobic conditions and the large intestines, undigested carbohydrates and fermented foods to SCFAs. Now, SCFAs means short chain fatty acids. They are acetates, propionates, butyrates, and certain gases also play an important role. Now, energy sources for the host, butyrate, acetate, etc., they are greatly affected by the short chain fatty acids. Now, microbiota derived signaling affects the appetite control, affects the energy expenditure, affects the gut motility, and affects the anti-cancer benefits through various mechanisms. Enterotypes associated with habitual diet are the fecal communities clustered in enterotypes distinguished by the levels of bacteroids and probitas. Enterotypes were associated with long-term diets, bacteroids, proteins, and probilates and carbohydrates. Here is a great list of the same things which is available on the net. You can go through that. Diet can rapidly affect the microbiota. Now, this was a study in which 6 males and 4 females were studied. It was not an elderly study. It was in the young people with a BMI ranging from 19 to 32. That means they were lean and thin as well as they were thick people. Crossover design was taken and dietary consumption was seen. And the 3 main things that were studied were fibers, fat, and the proteins. And they were differentiated between plant-based and animal-based. And what was seen? That the diets which were basically plant-based, rather than the diets which were animal-based, they scored over them. I am not promoting vegetarianism, though in the morning somebody said it is good to be either Jains or to be Jews, but yes, vegetarianism plays an important role. Diet can rapidly impact the microbiota, that is a well-known fact, and plant-based increased short-chain fatty acids, acetate and butyrates, they play an important role. Animal-based, the increased branch-chain fatty acids, isolarates and isobutyrates, they are also very important as far as the metabolic functions are concerned. Dietary fibers, I think since morning this is being talked about, that non-digestible, soluble and insoluble carbohydrates and legumes are intrinsic and intact in plants, isolated and synthetic. I am not promoting vegetarianism, but yes, this plays an important role, and that's why when the concept of high fiber diet came from the West, we were surprised because our diet was already high fiber. It was their diet which was not a high fiber diet. Different types of fibers in different types of plants, supplemental fibers in the range of foods, and things like cellulose, B-glucans, inulins, polylenics, and soluble corn fibers, they were the important part of that. Now there are terms like probiotics, prebiotics, and symbiotics. Prebiotics is a substrate that is selectively utilized by host microorganism conferring a health benefit. They are the prebiotics. Probiotics are the live microorganisms, while symbiotics are the products that contain both prebiotics and probiotics. Well, food sources for dietary fibers we all consume and are really certainly good, and it is advocated that out of 3 meals that we eat, at least if one of them is of fruits and vegetable, it will certainly help everything including the metabolism. That include fruits, vegetables, whole grain, nuts and legumes. We all know the sources of that. There are certain sources of prebiotics. Among the foods, they are oatmeal, barley, onions, greens, berries, bananas and legumes, which are available plenty in our country. However, supplements are available in the form of tablets and powders. There are certain sources of probiotics also among the food items, and they are yogurt, fermented milk, drinks, kefir, enfetta formula, cheese and cereal. On the contrary, if you are not able to have an access to them, or if you don't have a taste to them, they are also available as capsules, powders or tablets, but nothing like the original one. Gut-brain axis, let's come to the main thing, that is the galacto-oligosaccharides. 5.5 grams a day reduced waking salivary cortisol. That was the main important thing, which causes suppression of neuroendocrine stress response. Now, any kind of little bit stress, somebody honking at your back, or a red light, or somebody trying to cross over in front of you, the stress that comes, and these repeated stresses, they collect and they affect it. So this is one thing which affects that and controls it. There is an increased attentional vigilance in processing of positive versus negative, and that is interpreted as showing an early anxiolytic-like profile where threatening stimuli are less likely to attend to, and reduction of anxiety-like behavior and dampening of fight or response for fighting, that is controlled by galacto-oligosaccharides. 4 weeks intake of 250 grams of fermented milk by healthy women affect activity of the brain regions that control central processing of emotions and sensations. And that's quite obvious that there are certain beneficial effects of general signs on anxiety, depression and reduced cortisol. Now coming to specific topic, that is the gut-brain axis specific to elderly. There is a term called inflammation. Since morning there have been talking of inflammation, slow grade inflammation, continued inflammation. There is a term which we use in geriatrics, and that is inflammaging. Inflammaging is a sterile inflammation which actually leads to slowing of the aging process. Inflammation is a negative process. On the contrary, inflammaging is a positive process and will affect your immunosenescence. There are neuroinflammatory and cognitive declines that occur in elderly. There are neurodegeneration diseases like dementia and Alzheimer. There are behavior disorders, and there are certain anxiolytic things, which all these things are affected by the gut-brain axis. Now, a rather new and somewhat unusual concept connects brain functions to gut microbiota, and that is called gut-brain axis. A microbiota gut-brain axis, and states that probiotics consumption and a healthy gut microbiota positively influence the brain functions related to behavior and cognition. So not only your behavior changes, but even your cognitive functions also change. Synergistic with low chronic grade peripheral inflammation, this faulty barrier exposes the aged brain to negative and extracerebral signs. Given the quasi-consent failure of pharmacological treatments in the neurodegenerative disease, increased interest is directed towards the allopathic medicines, including the dietary supplements. So what we saw, the neurodegenerative disorders which we have been facing day in, day out, like dementia, Parkinsonism, even Alzheimer's, we found out that there was a limited role of medication. So there came the concept that can the gut affect it? Can the gut microbiota affect it? And these are the studies which have shown that yes, it does. And that's how the allopathy has become interested in gut-brain axis affecting the brain. There is an interplay between gut microbiota and CNS by immune, neural, and metabolic pathways. Let me not be disturbed again. I'll quit myself. In elderly person, this axis is reported to be altered, contributing to systematic inflammation. Yes, if there is a systematic inflammation going on anywhere in the body, it will affect the neurodegeneration. So kindly check for inflammation, and if that inflammation is being controlled, if the gut microbiota plays a role in controlling that inflammation by its supplementation through the probiotics, it is most welcome. Currently, there are several clinical trials addressing the relationship between gut microbiota and CNS, psychiatric disorders, and at least one directly investigating whether there is a correlation between composition of gut microbiome, permeability, and intestinal barrier, and systematic inflammation, which may lead to dementia. So, chronic inflammation, supplementation of probiotics to check that inflammation, particularly in the gut, will certainly help people suffering from dementia rather than giving them drugs only. Well, this is again the same thing that I have explained in detail. So what I like to do is just quote one study that there is a diversity of the gut microbiome related to cognitive behavior outcomes in healthy older adults. What they did was they took some healthy, absolutely healthy people who were above the age of 60, and in them they gave gut microbiota in the form of probiotic, and they found that their behavior and cognitive functions further improved. So that what I want to say is it has not only a role to play in the disease but also in the maintenance of the brain health. Impact of gut microbiota in brain aging, polyphenols as a beneficial modulators is something which is under trial, and I am sure is going to be a revolution in this era. Gut microbiota axis through the lens of gut microbiota and the relationship with Alzheimer's disease, not only the tau protein deposition, but what they said that there are certain gut microbiomes which when they used in people with Alzheimer's during the pre-Alzheimer's stage, it has a beneficial role to play. The influence of gut microbiota alterations in the age-related neuroinflammation and cognitive decline, I have already talked. So the gut microbiota is not only age-defined but also age-defying. That means it is one of the things which can slow down the process of aging. So friends, the use of antioxidants, the use of probiotics, and certain other good dietary habits will help you in slowing down your process of aging. However, unfortunately, there is something that leads to microglial cell death, and this is under experimental stage, and they are trying to find out it is available in which all foodstuffs, which all chemicals, and an international law is likely to come against that. So I would like to sum up my talk by saying that dietary fibers, prebiotics, probiotics, they impact the human health and the microbiota, neurological and physiological connections that enable the bidirectional communication between gut and the brain. Much interest is understanding the complex relationship among diet, microbiomes, and health, identifying and utilizing key foods, nutrients, and microbes to modulate the microbiota for health benefits. There is a use of prebiotics, probiotics in elderly, which affects the inflammation, aging, neuroinflammation, cognitive functions, neuroregulations, dementia, Alzheimer's disease, behavior, anxiolytic behavior. And one thing that I would like to add, which has not been talked about, that because of the sleep deprivation, the lack of melatonin secretion that occurs in the body, supplementation of that actually works more or less like gut microbiota. Thank you very much.
Thank you so much, Dr. Sharma. That was very enlightening. May I ask for comments from Dr. Pandav and Dr. Gupta?
Hello, can you hear me?
Yes, sir.
Hello. As I see from a holistic perspective of all the questions that have been answered since morning, now we are moving from a single discipline medical care to multidisciplinary medical care, what is known as integrated health care or holistic health care or complementary alternative medicine. Dr. Sharma, actually I want to borrow your I just want to show you last fifth and sixth slide. आपका पांचवी last में से fifth and sixth slide, can I see it please?
Sorry, sir. The last slide?
Last 6 slides.
Last 6 slides.
Because he has basically focused on what I want to say.
3, 4, 5, 6. Is that the 6th slide?
नहीं,
ये वाली?
इसके पीछे वाली. Where he has got, you'll understand it.
I got the opportunity. Yes, please. If you could, because I'm not sure which slides are happening now.
यहाँ पे.
Yeah, that was the main thing. One was inflammaging. Inflammaging is a sterile inflammation. Actually, the inflammation leads to 2 types of response in T cells and B cells, and this kind of inflammation which stimulates T cells and B cells, that increases the immunity of the person. Second was aging. There are many theories of aging, and inflammation is one of the theories of aging. So any chronic infection leading to inflammation in your body leads to increased or accelerated aging that should be taken care of. Neuroinflammation and cognitive decline. Cognitive decline basically occurs by many factors. Some are modifiable factors, some are non-modifiable factors, and among the modifiable factors is the cessation of smoking, abstinence from alcohol, having a good 7 hours sleep, a diet which regulates your intestines also, that you have your proper GI movement, a diet which contains the sufficient quantity of minerals, vitamins, which are part of antioxidants which help you and which doesn't take you to negative calorie balance. Neurodegeneration, that is a dementia and Alzheimer. About the Alzheimer's, yes, it has been shown that the deposition of a tau protein inside the brain leads to Alzheimer, which could be vascular related, which could be age related, which could be genetic. In them, yes, there is a role of vegetarian diet in that, and microbiota have been tried in some of these cases during the pre-Alzheimer stage, and they have shown benefits. Lastly, the behavior disorders are very well known to occur in people who are suffering from some kind of irritation inside their stomach, irritable bowel, and who have GI symptoms. In them, behavior disorders are very well known, and they play their role through serotonin, and there lies the role of certain drugs like rhenidium bromide, which can be equated to 10 minutes of meditation. But actually the problem occurs, you are doing your meditation and your mobile is ringing, your attention goes towards that time and again. So if you are doing your meditation, please make sure that you switch off the telephone, close the room, and then do meditation, rather than having all the reasons for interruption to come and check your meditation. Anxiolytic effects. Anxiolytic effects are again seen in some of the foodstuffs, and they are basically green vegetables and fibers, and certain things which contains even selenium, they act as antioxidants, and they affect the anti-anxiety effect.
Yes, Dr. Sharma. I just want to ask you, while you're focusing on this slide, this is my platform slide. Where will you put Parkinsonism in this matrix? Parkinsonism? Where would you put Parkinsonism in this slide where you have shown?
Sir, Parkinson's, if it is vascular Parkinson's, it's slightly different from the age-related Parkinson's. And in the age-related Parkinson's, there is a role of diet, there is a role of sleep, there is a role of gut microbiota. In the vascular Parkinsonism, there is more of the role of control of diabetes mellitus, hypertension, and dyslipidemia.
Yeah. So, ladies and gentlemen, I wanted to share with you my own story. I have been having Parkinsonism since last 16 years. It started in 2005, and I started treatment in 2016, 11 years after I had the early symptoms. And of the three triad things you mentioned about the management of Parkinsonism, one is the traditional drugs that are being used, the allopathic drugs. The second thing is, and most important thing is diet, and I've been a patient of Dr. Ishii Khosla for the last 1 year in terms of the dietary advice she has given. The third thing is that I'm myself prescribing my own medicines. I go to Dr. Bankul, is here, Bankul? I go to him for homeopathy, I'm taking allopathy, I'm taking Siddha, Unani, Ayush, reflexology. And this has greatly helped me to improve my Parkinsonism. I was in a very bad stage. I needed 2 people to get me up from the chair. Over a period of time, I bounced back to normal.
I agree with your experience about the diet, and particularly if you are allergic to gluten, and if you take gluten-free diet, and if there is less of the irritation in the intestine, then REM sleep gets affected. And it is during the REM sleep that there is a increased secretion of growth hormones, which are the reparative hormones. That's how they say there is an importance of good 7 hours sleep. In fact, what happened was the age of menarche in China is around 19 years or so. On the contrary, the age of menarche in USA is something like 11 years. Because of the twinkling lights, use of the excessive mobiles, neon signs, etc., and not proper darkness while sleeping affects the sleep pattern. And it is the sleep pattern which affects not only the melatonin, but also the hormones, which include the sex hormones and the growth hormones.
So, to those complex methods of I'm using to take care of my Parkinsonism, I've also discovered very important role of music and dance therapy. I'll just share with you for about 2 minutes.
Music has been shown to improve the cognitive functions. It's a well-known fact, but how much the dance therapy, I do not know, sir. I have delivered more than 300 lectures across the globe, starting from Vietnam to USA, but I am yet to come across a chairperson like this. Give 3 cheers to my chairperson.
Thank you so much. I also want to share the success of IDIN story. We are very fortunate today's chief guest, Meenakshi Lekhi. She gave us such an exemplary presentation talk. And we need to move from research to policy, and policy to program. That's the second point I wanted to make. The third point is, where is Ishi?
Ishi's right here.
Your contribution to this area is exemplary. You are a visionary, madam. Please stand up.
Ishi, can you come to the dais?
Come on the
Ishi,
dais.
can you come to the dais?
She is very shy, very humble.
Ishi, can you come to the dais?
This is an incredible journey she has started.
Come. Actually, I had heard about Ishi, but I had not met her. But it was in a flight to Singapore where I was going to chair a session on nutraceuticals. And one young lady came and sat by my side and introduced herself as Ishi Khosla. I said, "Are you the great nutritionist?" She said, "Yes, I am." And I was so impressed by her that in this conference, when she said, "We are doing a conference like this, we would love to invite you." I said, "I'll be there from morning to evening," and trust me, it has been a great learning session. Thank you very much, Ishi Khosla, especially for raising the awareness of celiac disease. I remember the APCON, the Association of Physicians of India, which is the biggest conference of physicians. In that, one lady had come from UK, she was a gastroenterologist, and she talked about celiac disease. And then somebody said, "Yes, I have seen a case of celiac disease." But now the celiac disease awareness is so much, a lot of credit for that goes to Ishi Khosla. Thank you, Ishi.
I must also make a confession. My batchmate, Dr. O.P. Yash Gupta is sitting here. He'll give his own comments. But we are totally ignorant. Both of us are from the All India Institute of Medical Sciences, New Delhi. I consider it as the world's leading institution. But I must say that a confession is that we knew nothing about celiac disease or probiotic that you're talking about. So that's the third thing I want to say.
Yeah.
And finally, today is 20th January. It also happens to be Ratan Tata's birthday. And I want to thank you because he took my research work on iodine very seriously. That's why today iodine story is a public health success story. Thank you very much.
Dr. Gupta, very briefly, can we ask you to share your comments, please?
Just make a few comments.
Yes,
first of all, thank you, Ishi, for inviting. This is organizing this wonderful conference. It has been extremely knowledgeable content, and there are lots of takeaway points. I've trained in general surgery. I've done lots of abdominal operations and gut operations, and then I trained in plastic surgery and trauma surgery. But now I am a medical director of a company which called GutScope. So here, I want to say something here, and which is in tune with what has been said all throughout the day. That first of all, if one has any gastrointestinal symptoms, then don't take them lightly. Do consult a physician to start with, a gastroenterologist. And endoscopy is quite easy and common to do. Gastroscopy and colonoscopy is very, very easy to do. And we have picked up problems which, like cancers and of the, gut and other things and stomach. So first you've ruled out a major problem, then you start looking at the other things, which is obviously the balance of the diet, the probiotics. The probiotics dysbiosis is very, very common, and the probiotics are very available in plenty now. But you have to choose the one which has got a very high concentration of bacteria, because when it passes through the stomach, most of them get destroyed because of the stomach acidity. So one has to choose something which can actually let go into the intestine and get. And the third thing I want to say is the Peyer's patches. People say that gut is a big immune system, and it's the biggest immune system, lymphoid collection, and the lactobacillus has been known to act on the Peyer's patches, and then it produces a lot of protective substances. So, and especially with elderly, I'm 70, so I have kind of tried to do some yoga, meditation, and also developed interest in scriptures and the science in our scriptures. And I also wrote a book on it, which is called Science in Sanskrit Scriptures. So this is, and part of it is like Patanjali, the Sushrut, the Charak, and they've told us great things about how to maintain your gut health, especially, and also your general health in general. Thank you.
I'll just
Thank
take
you.
a half a minute, madam.
Ji, sir.
Actually, if you look at the program, there are 42 speakers, and there are who's who. And Dr. Ishii, a lot of Padma awardee functions have participated in this today's program, which is, I think, another record. So congratulations, talks about the deep respect people for you. Thank you very much.
Thank you so very much, all of you.
One last bit. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashyantu, mahakaschit bhag bhavet. Let everybody be happy and healthy, and nobody suffers in this world. Thank you.
Thank you so much. That's such a lovely wish for everybody. Guys, come on, they deserve a big round of applause for wishing us well. Dr. Tom, are you ready? Yes, you are. Well, who better than Dr. Tom to, give us a summary of the conference and basically sum up all the learnings for us. I know it requires you to be a little more patient. Please bear with us. Thank you.
Thank you all for staying. I'm going to talk about how to rebuild the microbiome. And this is a 90-minute to 2-hour presentation that I'm doing in 30 minutes. So get ready. Hold on. Here we go. And you also have access to the slides so that you will be able to review again and again. You don't have to try to remember it all now. Oh, excuse me. Yeah. In healing the gut, you must develop a pleiotropic approach. There's a term, all roads lead to Rome, that there are many different things that will contribute to healing the gut. There are many. I've met so many doctors that will come up to me and say, I recommend glutamine to heal the gut. And they're waiting for me to say something. I say, well, that's a good component, but did you know that vitamin D does not turn on the same genes healing the gut that glutamine does? Or that fish oils turn on different genes than vitamin D or glutamine? That there are many approaches that have to be included when you're going to heal the gut. It's called a pleiotropic approach. First and most important, you have to put the fire out. And in putting the fire out, you have to stop throwing petrol on the fire. You have to identify what is it that's triggering the inflammation in my gut. What is it? And of course, the most common source of inflammation is what's on the end of your fork. But also excessive stress hormones will cause inflammation in the gut. It's very, very common. Lack of sleep will cause inflammation. Just Google sleep and intestinal permeability. Here come the studies that you will see there are many contributors that you have to learn about that may be contributing to a pathogenic level of intestinal permeability. The first thing we recommend to our patients is castor oil. Castor oil packs. You pour castor oil on a wool or cotton pack, you put it on the stomach, a sheet of plastic wrap, and then a towel, and maybe a hot water bottle, a little gentle heat. And you just relax for 30 minutes. The castor oil penetrates, it reduces inflammation very quickly, and it activates genes of regeneration. And there's really good science to it. When you read the studies, you say, oh my gosh, I didn't know that about castor oil. That's really something. These are the components of castor oil, which I don't know if you can see on the screen, but they include rutin, gentistic acid, quercetin, gallic acid, camphanol 3-beta, ricin A, ricin, and then they identify what aspects of the immune system each of these components will address. So you've got really good science in using castor oil packs as an initial step that the patient takes to heal their gut. It's not just a pill they take. They're so used to just being told to take a pill and keep living the same lifestyle. Here you have to engage them in taking some action to help their body heal. Castor oil is antimicrobial. The castor oil packs are antimicrobial in the gut. They will address Staph aureus, E. coli, Streptococcus mutans, and others. Topical administration of castor oil for 8 days reduced edema by 58%. So it's just a simple tool that people can use. Castor oil packs are safe and effective for enhancing gut function. They enhance detox pathways. They enhance bowel elimination. They inhibit the inflammatory response to LPS. They break down biofilms of pathogens in the gut. There are many reasons why you begin with a simple castor oil pack. I'm going to give you 21 different things to do here in 30 minutes. So I just took 3 minutes to tell you about castor oil. So you can see how fast I have to go to give you the big picture, right? So number 2, moderate aerobic exercise. It's well established that moderate intensity exercise modulates gut microbiota, induces anti-inflammatory effects in the gut. In this article in the Journal of the American Medical Association, the magic number was, well, they followed 78,000 participants, and the magic number was 9,826 steps per day. You walk 9,826 steps per day, you reduce your risk of dementia by 51%. And part of the mechanism by which that works is that you change the microbiome. And here's the summary of what moderate exercise does. Increases muscle mass, increases exokines, increases mitochondrial biogenesis, increases mitophagy, decreases oxidative stress, increases fatty acid oxidation, decreases pro-inflammatory cytokines. The list goes on and on. Decreases branched-chain amino acids, increases mucus secretion, increases insulin sensitivity, increases beneficial microbes. Moderate exercise. You get your patients moving. It's an important component. You have to change the lifestyle that created the problem. And this is a component of it. Next, as I said in my talk earlier from Professor Fasano at Harvard, the 2 most powerful triggers activating a leaky gut are LPS, lipopolysaccharide from pathogenic bacteria, and gluten. And as I showed you earlier, the gluten thing occurs in every human that consumes gluten, activating intestinal permeability. Food for thought there. Eating styles. There are many different eating styles. I know you can't see this slide, but if you look at the center part where the multicolored little representations of bacteria are, you see which diets reduce the diversity of the microbiome, and they are the gluten-free diet. Reduces the diversity of the microbiome if it's done incorrectly. You have to learn how to do it correctly. That's very important. The ketogenic diet reduces total bacteria and diversity. The low FODMAP diet reduces total bacterial count. The Western diet reduces the diversity of the microbiome and the total count. So you have to, when you're doing therapeutic diets, you have to keep in mind, how am I going to protect the microbiome with that therapeutic diet? There's benefits to the therapeutic diets that you recommend, but you have to think about the microbiome. And we recommend, in general principles, the Mediterranean diet. But we recommend a modified Mediterranean diet. We all know about the Mediterranean diet and its benefits overall. And a gluten-free diet, the first goal of a gluten-free diet is to maintain the improvement of epithelial integrity, reduce the intestinal dysfunction, and the reduction of inflammation. And this is a great article to read on the Mediterranean gluten-free diet. And what you find is that it's the one that makes the most sense when you read the science. And you see on the bottom of the pyramid, the most important thing that people need to focus on is hydration. Most important. And we don't do that with our patients. We don't talk about hydration enough. It's critically important. Above that is fruits and vegetables. And they have to be organic at least 3 times a week if they can't do it every day. But at least 3 times a week, the studies are very clear. You change physiology dramatically. You reduce miscarriages if they're doing organic at least 3 times a week. And I don't have time to talk about the study now. I'll be here afterwards if you want to know about that study. Above that are the pseudo-cereals like teff and buckwheat and millet and sorghum. The pseudo-cereals, quinoa and amaranth, they are above the fruits and vegetables. And then above that, spices, extra virgin olive oil, yogurt, a little bit of wine, physical activity, herbal infusions. Above that, potatoes, quality proteins, and at the very top of the list, rarely is gluten-free foods. Rarely gluten-free foods on a gluten-free diet. You do not substitute gluten-free foods for the gluten foods your patients are currently eating, because the gluten-free foods are white paste. They're not enriched, they're not enhanced, they have no nutritive value. They're great as a treat on occasion. I love a gluten-free blueberry muffin. I don't do it very often, maybe once every 3 weeks, once every 4 weeks, but I'm half Italian, so I'm going to do gluten-free pasta once in a while. But when I do gluten-free pasta, I take the digestive enzymes to make sure I'm protected. And that's a whole nother story. I can answer the questions later for those that want to stay about the enzymes. But American Journal of Gastroenterology published in 2019, they looked at 5,624 foods ordered on gluten-free menus in restaurants. 5,624 foods. 32% of everything on a gluten-free menu is not gluten-free. It's contaminated. 32%. 54% of gluten-free pizzas are not gluten-free. They're contaminated. 51% of gluten-free pasta is not gluten-free. It's like, what? That's why when you order from gluten-free restaurants, 32% of everything is not gluten-free. You need digestive enzyme protection, and you need the right kind of enzymes, but we can talk about that later. Nuts, if you look at walnuts as an example, they're a superfood because they're high in omega-3s, and they have beneficial phytochemicals and antioxidant polyphenols and fiber, but they increase probiotics, they decrease pathogens. So we recommend 3 to 5 walnuts every day. Just a few. It's all it takes, just a few. Root vegetables, Mrs. Patient, when you go shopping and buy your fruits and vegetables, always organic, of course, but buy every root vegetable in the store, a type of every one of them. Carrots, rutabaga, sweet potatoes, turnips, parsnips, and I'm not familiar with the root vegetables in India, but it's the same concept. And you alternate your root vegetables. You have 1 root vegetable a day for you and your family every single day, 1 root vegetable. And you alternate them because every root vegetable feeds different families of probiotics. And you want to feed all of the families of probiotics. And then you go to Google and you type in list of prebiotic foods. Here comes a list. You print the list out, you put on your refrigerator. You get 2 foods from the list every day and 1 root vegetable every day. A banana is a prebiotic. An onion is a prebiotic. Garlic is a prebiotic. But you get the list, you give it to your patients, and then you tell them 2 from the list and 1 root vegetable every day. You're training them to change the lifestyle that produced the problem, right? We want to feed the healthy microbiome, and you need multiple sources to do that. 1 root vegetable and 2 other prebiotics every day. Because when you eat prebiotics, they feed the good bacteria in your gut. They increase the good bacteria in your gut. The good bacteria produce this exhaust that gets into your bloodstream, and it targets different organs. producing better function out of each of these organs. And the end result is you decrease glycemia, decrease insulin resistance, decrease fat mass, increase glucose tolerance, decrease steatosis, decrease inflammation, decrease lipemia, decrease metabolic endotoxemia by feeding prebiotics. Right? So you make sure every day your patients understand they're getting prebiotics. This is a researcher that came from China to the US to get his PhD in biology, I think it was, and he worked really hard, and that's what he looked like when he graduated. And he remembered his grandmother had told him about bitter melon and Chinese yams, and he fermented bitter melon and Chinese yams. He started taking them every day, didn't change anything else in his diet, and this is how he looked 2 years later. Just by adding fermented root vegetables to his diet, because he built a healthier microbiome and altered the diversity of his microbiome. And, Mrs. Patient, I'd like you to take a prebiotic supplement for 2 months while you're changing your lifestyle. Let's not have a downtime here when you go gluten-free. Let's make sure you're getting enough prebiotics. So when you give a prebiotic supplement, you provide important support to the intestinal microbiota as well as important nutritional guidance for the patient. The supplementation of gluten-free diet with prebiotics enriched inulin for 12 weeks resulted in an average concentration drop of 36% of volatile organic solvents in urine samples. So you supplement these people for a couple of months until they've got the lifestyle down correctly. Next, bone broth. Mrs. Patient, I'd like you to have 1 cup of bone broth per day. Why? To rebuild, where's the study on that? I think the slide will pop up in a minute. It looks like, yeah, here we go. 1 cup of bone broth per day. The gut barrier is divided into a physical barrier and a functional deeper barrier. Gelatin tannate is like a seal that covers the damaged inside of the intestine. Bone broth is high in gelatin tannate. So when you have a damaged gut and you have intestinal permeability, as the arrow demonstrates, and you have a cup of bone broth a day, you put a seal over the wound. And if you've ever been in a pair of shorts and you slide on the carpet and you get a carpet burn on your knee, you don't want to put a pair of pants on your knee for a couple days because it hurts the skin. That's the inside of your gut when you've got a leaky gut. So you take bone broth, which acts as a seal on the inside of the gut, you heal faster. So that's the damaged gut. Now it goes to a healed gut. Supplementing for mucosal barrier support product. Mrs. Patient, for a couple of months, I'd like you to take a supplement for healing the gut while we're working on transitioning you to bone broth on a regular basis. This is the one we use in the US, but there are many supplements that you can use to help support the inner lining of the gut. Next, inoculate with fermented products. Mrs. Patient, I want you to get 5 types of fermented products. Get sauerkraut, get kimchi, get miso, get fermented beets, get curry flavored, whatever you like. And every day you work up to, you may start with just a little bit, it might take you a month or 2, but you work up to a tablespoon of fermented vegetables a day. And you alternate them because every vegetable fermented produces different families of bacteria, and you're inoculating the gut with these families of bacteria. You're teaching the patient how to live a lifestyle to build a healthier, diverse microbiome. It's a critical component of this whole process. So you tell them to get 5 different types of fermented vegetables and alternate them on a daily basis. Consumption of fermented foods not only provides important macronutrients, but delivers large numbers of potentially beneficial microorganisms to the GI tract. A tablespoon a day, and you increase the number of microbes in the diet by 10,000-fold. You read the science on this and you go, oh my God, why didn't I ever know this before? Next, Mrs. Patient, for a couple of months, I want you to take a supplement of the probiotics. Not forever, but for a couple of months while we're transitioning you to this lifestyle. We like the spore-based probiotics. They inoculate in the gut, they don't get destroyed by hydrochloric acid, and you increase the production of what are called keystone species, very important species of beneficial bacteria in the gut when you take the spores. To build and accelerate a rebuilding program for 2 months, Mrs. Patient, take the spores. You'll find that they help. Spores help to reduce the leaky gut. Next, consume fruits high in polyphenols. And these studies show that black raspberries increase the amount of Akkermansia, which is a keystone species of bacteria in your gut, a very important species to have as dominant in your gut. Black raspberries do it. We've all heard before that a cup of blueberries a day for 3 years and your brain's functioning as well as it was 13 years earlier. Those studies came out in the 1990s. And it's because the blueberries are encouraging growth of beneficial bacteria in the gut, whose exhaust goes up to the brain, and you get better neurotransmitter balance and better brain function, right? So blueberries, black raspberries, and other fruits here in India that are high in polyphenols. You'll have to do your own research to find those. I don't know what they are. Butyrate-producing bacteria is increased by black raspberries. And why is that important? Because butyrate is essential to heal a leaky brain. A leaky gut, but also a leaky brain. You need butyrate levels, which is one of the short-chain fatty acids. And when you eat the right polyphenol-laced fruit, you increase butyrate levels. Next, applesauce. An important protein for gut barrier function is intestinal alkaline phosphatase, IAP. IAP increases detoxing of LPS. It increases remission of systemic inflammation, it protects the gut barrier, and it modulates the gut microbiota, intestinal alkaline phosphatase. You increase intestinal alkaline phosphatase by eating pectin, the pectin in apples. This is why an apple a day keeps the doctor away. This is where that phrase came from, because it's true, it does. You increase IAP. And as this drawing shows, when you have elevated levels of IAP, the LPS, the exhaust of bad bacteria, cannot bind onto the receptors on the gut lining. And you do not activate toll-like receptor 4, creating the intestinal permeability and inflammation that I talked about this morning. But when you don't have enough IAP, intestinal alkaline phosphatase, now the LPS binds onto the receptors on the lining of your gut, penetrates into the gut, activates the systemic inflammatory cascade, and you're out to the races on your way to what eventually, this is where sepsis comes from. Sepsis is an accumulation of LPS, and it's the #1 cause of death of elders in the hospitals in the US. I'm not sure here, but I know it's very high. I don't know if it's #1. An important mechanism is the dephosphorylation of LPS by IAP, which induces a 100-fold reduction in toxicity of LPS. And this comes from applesauce. Supplementation with apple-derived pectins significantly increase the level of intestinal alkaline phosphatase. Apple-derived pectin modulates gut microbiota and is critically important. And of course, organic is much higher in polyphenols than conventional. So you always want organic whenever you can. So Mrs. Patient, when you go shopping, buy 10 or 15 apples, wash them, don't peel them, cut the seeds out, and chop them up into pieces, put them in a pot, and add, if the apples are this high, add water to 1/3 the height of the apples. Put a little cinnamon in there, a couple of raisins, turn it on high. In 15 minutes, you've got applesauce. That's all it takes. It's very simple. Have your children help you do it, and so they're engaged, and then they want to eat it, right? And you go for at least a tablespoon a day. I mean, can you eat more? Of course you can eat more, but at least a tablespoon a day of applesauce, and you increase intestinal alkaline phosphatase with all of the benefits of that. You can't use commercial applesauce. You need to make it fresh because the commercial doesn't have as much pectin in it. They filter it out. Next, Mother Nature's way of healing intestinal permeability. Every newborn baby is extremely permeable. It's normal in the womb to be completely permeable because baby is swimming in this soup of the amniotic fluid. So there's no closure to the junctions inside the gut. And when baby's born, the first food baby gets is mother's milk, right? It's not milk. For the first 5 days, it's not milk. It's called colostrum. Colostrum is very, very different. And the first thing, one of the first things colostrum does is it activates the genes in the gut to close the tight junctions. Okay, baby, time to tighten up now. Food's going to start coming down. And so baby's not breastfed at birth for some reason, has permeability that stays, and they give a soy formula. Those soy molecules go right through the permeable intestine into the bloodstream, but baby doesn't have a well-defined bloodstream or immune system yet to fight it. So these macromolecules of soy come in. Those are the kids that have a hard time. They have a really hard time. It's just one of the mechanisms. There are many mechanisms that, but you want to keep the baby alive, of course, most important. Colostrum. High intestinal permeability is a normal feature of newborn gut ecology. We need to wrap it up? I need to talk faster. So I'm going to skip a couple of slides about colostrum, and I will just say there are many players that help to heal the gut, but colostrum is the only one that plays the entire symphony. We give every patient colostrum when they come to us with evidence of a leaky gut. Vitamin D. Critically important. This is the tight junctions, and vitamin D, I'll skip the explanations, but all those red circled areas is where vitamin D is completely in control. If you look on the bottom left at that drawing there, there's scooped areas. That's the tight junctions. I think of them like the Panama Canal. Food molecules come down into the first part, the gates close. The immune system checks it out. Then the gates open. Food goes down a little lower, the gates close. The immune system checks it out. Gates open, food goes down a little bit more. Vitamin D completely controls the gates of the tight junctions. They're called the tight junction strands. Completely controlled by vitamin D. Next, the omega-3 fatty acids. They're anti-inflammatory, critically important. I'm on my way. They quiet down NF-kappa B, the major amplifier of inflammation. Their safety is well known. A dose of up to 3 grams a day of fish oils is safe for general consumption, even if you're on blood thinners. 3 grams a day is safe. Next, glutamine. We all know about glutamine. It's the most important nutrient for new enterocytes to be built, critically important for that. One study where they gave colitis patients 30 grams a day for 4 weeks, significant improvement in every patient. They stopped the glutamine and the colitis came back. Why? Because they didn't deal with the microbiome or the lifestyle. So you can't just give any nutrient. Next, curcumin. We all know about curcumin. It's the most powerful natural anti-inflammatory that I know of. And these are the pathways, some of the pathways that curcumin will modulate for an anti-inflammatory effect. And I love this slide because these are all the conditions that benefit from curcumin. And the highlighted ones are those that are autoimmune. So I have to do that again because I spent an hour on that slide. So let's just see how that goes. All right. So the gut's on fire, the body's on fire. Eliminate the inflammatory foods. Fasting mimicking diets I didn't talk about help to heal the gut. Alternate prebiotics, apple pectin from applesauce, bone broth, fermented foods daily, probiotics, vitamin D, zinc, carnosine, I forgot to talk about zinc, critically important, glutamine, fish oils, curcumin, and colostrum. Your gut's on fire, the body's on fire. Strict avoidance of all wheat exposure, absolute necessity of working with a dietitian or a nutritionist to guide people on how to do this. Rebuild the microbiome with the gut restoration protocol. Daily applesauce, bone broth, alternating numerous prebiotic, probiotic foods, fermented and root vegetables. Initial supplementation for a few months with prebiotics, spore-based probiotics, colostrum. Longer-term supplementation, vitamin D, fish oils, curcumin, glutamine, and zinc. So spend 1 hour a week on this. get these slides, spend 1 hour a week to learn this, and in 6 months, you've got it down. You've got it down. Allocate 1 hour a week. Just read 1 or 2 studies on each topic every week. And then in 6 months, you really have this down. Professor Fasano, who tells us, and Professor Schoenfeld about gluten and how dangerous it is. David Furman's drawing that really puts it in perspective. Patients understand this drawing with the wheels about inflammation and how bad inflammation is, and that it is the cause of every disease. You've got this. If you take the time, you've got this. Just put a little time into it. These are the results you get again and again and again. You reverse Hashimoto's, you reverse rheumatoid, you reverse lupus again and again and again. When you take the time at 1 hour a week to learn this, I hope you'll dive in. I hope you will. And thank you for your kind attention. And on behalf of the Celiac Society, thank you very much for being here this weekend.
Thank you so much. We really need to wrap up. I'm going to invite Dr. Sarath Gopalan to make his closing remarks.
Thank you, Pooja. When a day goes by well, all good things will come to an end when the day ends. But what is important for all of us to take away is the important learnings and messages we have gained from that day and see how we can put it into utility in our day-to-day lifestyle and in our professional day-to-day dealings. Then it becomes even more meaningful when it becomes a part of our life, because no learning is a waste and all these things have to be put to good use. So it is hoped that this day-long session has been really meaningful to all of you. Honorable Minister Meenakshi Lekhi ji, Mr. Sukumar Ranganathan, Dr. Chandrakant Pandav, Dr. Srinath Reddy, Dr. Naveen Dang, Dr. Harsh Mahajan, Dr. Anupam Sibal, the esteemed faculty and distinguished audiences. I would like to thank you all for making it today to be here with us at this International Symposium on Gut Health and Lifestyle Disorders, themed Millet for the Microbiome, Your Way to Wellness, ISGH 2024. No symposium is successful without the active participation of the attendees, the audience, and thank you all for participating right from the morning in this important symposium, and hopefully you've been able to take away some learning points. To deliberate on the importance of the gut microbiome, its profound connection with health, ill health, and transformative potential of millets in building a healthy microbiome are some of the important areas which were touched upon during this whole day-long symposium. I would now like to take this opportunity to thank all those who have helped and supported this mission. Ms. Lekhi and Mr. Sukumar, Dr. Tom O'Brien, Dr. C.S. Pandav, Dr. Naveen and Arjun Dang, Dr. Anupam Sibal, Dr. Ajay Bhalla, Dr. Ashima and Ashutosh Shukla, Dr. Neerja Hajela, Vijay Dhawan, Colonel Vijay Dhawan, Reema Bhatnagar, Pooja Kotari, Aarti Kotari, Sajal Mehta, Neeraj Arora, Ishita Jain, Anju Khosla, Gagan Khosla, Shivani Aswal, Elborn team and India Habitat Center, and also the audiovisual team of Grover has really helped in this. Now, having said this, the backbone of the conference in the organizing committee, certain people deserve special mention. Without the efforts of Anju Khosla, without the efforts of Pooja Kotari, without the efforts of Neeraj Arora, Shivani, Anindita, and other core members who have been really working tirelessly in the organizing committee, and the person behind the scenes who was looking at this whole thing and planning it, Gagan, who's right there. He was overseeing the whole thing and making sure that the logistics of this conference was worked out well. And last but not least here, among the organizing and the scientific committee, no words are enough to express the initiation and the vision shown by the President of the Celiac Society of India, Ms. Ishi Khosla. We have had a number of people working behind the scenes. We have had Hima Bhatnagar, we have had Reema, we have had Mini, we have had many other people who have been tirelessly working behind the scenes but were not the direct face interacting with the public. The conference, to sustain a conference, it's important that there's sponsorship. And we have had some sponsors who have come to the assistance. We have ITC, we have Morpen, we have Agilus, we have Melan, we have Yakult, and we have Dabur. And our partners with whom the Celiac Society of India collaborated: Food Safety and Standards Authority of India, Hindustan Times, Dr. Dang's Labs, First Medical Diagnostics, Shubh Group, Asha Chandra Welfare Consultancy, Prana, the Integrative Medicine Institute, Sarvam Foundation, Foodbury, Pick Story, Indian Council for Control of Iodine Deficiency Disorders. Yeah, I'm finishing. Our supporters: Organic Wellness, Baggeries, Skyrup, Whole Foods, Nario, Melwatch, Spring Gluten-Free Foods, The Fat Dumplings, NutraHelix Biotech, Mulgaon Verde, Caramel, Centrum, NSB KSP Nutritional Supplements. Thank you one and all for making this event memorable and a success. Ishi, any last words you want to mention?
Mansi Chaudhary.
Sure.
Mansi Chaudhary.
Sure.
Arjun there.
Oh, I didn't mention. Of course, Arjun and Naveen, very important. Sorry. Arjun and Naveen and Mr. Vijay have already mentioned. Arjun and Naveen. Mansi Chaudhary and Swarnik and many others who have contributed behind the scenes. Arjun, please come. Prashant Joshi as well. Sorry. Arjun's name was not here. Yeah, I'm moving on.
No, we're going quickly for a photo. Okay. Guys, come on quickly. Reema, Anju. Yeah.
Let's do it fast, guys, because we are already late. All right, smile, guys, smile, everybody. Move it closer, move it closer. Neeraj, hurry up. जल्दी आओ आगे just a second Neeta, come in the front
Yeah, they complete, yeah. Okay. No, done. You're through.
Let's everyone move this side.